Brandy pronounced herself? Had Brandy been given all the options? Were her cancer doctors at the Zangmeister Center called and consulted? Were the doctors that had been treating her for the several days called and said, hey, this is what's going on with her? No. Nighttime, ICU, family's told, do you want her to live the rest of her life on the ventilator, or do you want her to let her, pull the plug and go natural? And who knows if she ever would have woken up, because she was given, on the defendant's order, 1,000 micrograms of fentanyl, 6 milligrams of midazolam, extubated and dies in 5 minutes. Look at the pain scores from the hospital stay. Look at what was given to her to help her control any pain she might have been in. Ask yourselves, what was the purpose of these medications at the time of extubation? Frances Burke was 73. She's 5'3", 215 pounds.
Mr. Zion, hold on. We've been an hour and a half. How are you all holding up? Do you need a break, guys? Okay. Let's take 10 minutes enough? Okay. With it, David, call it up.
All rise.
Remember the admonitions and do not discuss the case yet. You don't.
She did not. This is what happened to her. I checked with the medical records. Let's go pull the records. Let's go look at it.
Okay. Be seated.
Oh.
Yeah, so there were just little things.
All right, yeah, change that. Okay, yeah, go ahead and make those changes. No, I did change that one back then with the,
Okay. Mr. Zion, I'm guessing you're noon by the time you're done.
probably. I mean, I'm just going to go through the rest of the patients and victims, and then, and then I have some closing remarks, but yeah, I mean, probably close.
Okay. Mr. Baez, I assume you'd prefer to start after lunch and get into 3 or 4 minutes of your argument?
If it's 3 or 4 minutes, obviously not, but if I have a half hour, I'd like
Okay.
to take.
I was getting a barometer because I always hated breaking them up if I could avoid it.
Understood.
Okay? So let's play it here. Anything for the record, Mr. Zion?
No, sir.
Anything, Mr. Baez?
No, sir.
Okay, enjoy your 10 minutes.
All right, yeah, I did not change it. I mean, I just pulled the one and worked on it over the weekend, and it was on the K drive, so.
Yeah, I don't know how it's going.
We're here today to announce the results of an approximate 6 investigation, a 25-count indictment against Dr. Husel for murder.
How did we get here?
Let me express my deepest condolences to the families.
You gotta be joking. It can't be. Why would he do that?
Here.
Okay.
A place where families are reliving pain.
We're all hurting.
We're all horrified.
Here. A place where a doctor is accused of killing his own patients.
Dr. Husel, do you have any answers as to why?
No comment.
Is it fair that you're walking out of jail today?
No comment.
Do you have anything you can say who are hurting right now?
Never did Dr. Husel or anyone on his team have the intent to speed up a patient's death.
So how did we get here? In this series, we will answer that question and others and explain to you how we broke the story of the patient overdose scandal at Mount Carmel. It is more than just the story of a lone doctor accused of giving his patients too much pain medication. It's much more than that. It's about a series of missteps, miscues, and miscalculations on the part of a health organization that helped contribute to a tragedy.
I was just wondering if you might have some time to talk with me.
So we called Dr. William Husel on January 14th. That's the same day we went on air with the story.
Have you already retained a lawyer, or is there someone I could call?
He declined to comment, telling me to contact his attorney. We had been working on this story for several days, acting on a vague tip that a doctor had been dismissed from the hospital. We were pushing our sources for more information, and we were able to get a hold of some internal memos from the hospital showing that the doctor had not lived up to the hospital's standards of care. The day we went on air with the story was the day that first lawsuit was filed. It was also the same day that Mount Carmel released a video statement.
Hello, I'm Ed Lamb, President and CEO at Mount Carmel Health System.
So Mount Carmel put out this video announcing that Dr. William Husel had been fired and that over 5 years he had ordered significantly excessive and potentially fatal doses of pain medication that had been given to 27 near-death patients. They all died. The hospital at the time also announced that it was suspending 23 nurses and pharmacists for their roles in administering these drugs.
On behalf of Mount Carmel and Trinity Health, our parent organization, we apologize for this tragedy, and we're truly sorry for the additional grief this may have caused the families.
What we would later learn is that the hospital created a second video. This one was only sent out to staffers and, in part, laid blame.
Sadly, our investigation revealed that some of our colleagues did not meet our standard of care. The actions that created this tragedy were instigated by this physician and carried out by a small number of good people who made poor decisions. They ignored the safeguards we have in place.
So in that second video, Ed Lamb appears to lay some blame on the staffers, which is different from the video that was released to the public.
We take responsibility for the fact that the processes in place were not sufficient to prevent these actions from happening.
What we would later learn is that the hospital had been investigating for months, and that when it first learned of an allegation involving Dr. Husel's patient care, in between the time they learned that and when they removed him, 3 more patients died, something we would attempt to press the hospital on later.
Was there any chance to remove him
Not
prior to
before
that?
October, no.
No upper-level management knew prior to that?
No.
He shortened her life. He took her right to choose her death away. And I just feel that Mount Carmel should have stopped him long before this happened.
Albert Belisari's sister Joanne was a companion nun, very active in her church. Of all the patients identified by the hospital as being tied to the overdose scandal, Joanne Belisari was among the first. She died in 2015 and was the first 1,000 micrograms of fentanyl.
It looks and appears to me you had a road doctor, you had a breakdown in protocols in the hospital.
Albert says he feels let down at a Catholic hospital that allows him to let things happen.
You should have called me. I've done it for you. You should have called me.
Hey, David.
Now we sort of like pay a bunch of money. They're going to fix CDC. Yeah, I know this is she's 18 years old. She loves it. She it is up.
It should be on there. I can't actually see, I can see 5 different angles right here. What we'll do is on the break, we'll get IT in here. Next break, we'll get IT in here to fix it. Okay, without any patience. Yeah, I don't know if it's
Yeah, that's a good point.
I think we got the wrong side. Yeah, they should two more messages. Silly.
that one, I know. Okay.
What?
Beth asked that you would check your IMs because she's sending you a message or something.
Oh, I was checking earlier. Okay.
It should be working, everything up here is rolling. Well, the power is on this one, but that screen is blank, so I don't know if there's I don't see those on the desk. Well, let's not worry about it right now, we can just.
Oh, here's the final jury instructions and your copy of the verdict forms. And then I will give you, after I get done reading it, I always give you this copy of the one I actually read. Okay? To the court exhibits. Any luck?
There are people yeah. I'll tell you what, it's got all that fat and everything else in it. That's, just keeping it on. She put on, she lost that much. Actually, she lost
That's with Pedialyte and baby rice cereal. Dry milk. Anybody can use vitamin.
What, sir?
The roughage.
No. It's plenty of protein and fat.
Any, if she wants to put a mic out here so it can be heard. Any objections? Go ahead and get up there real quick.
All rise. Thank you. Please be seated.
Ladies and gentlemen, I hope you had a wonderful break. We're going to continue on. Mr. Zion.
Before we move on past Brandy McDonald, folks, I had the wrong name up there, and for the record, I've corrected this slide. Brandy's mom's partner's name was Jerry Brown. That's the one that testified. She was the one that was that told you, well, we didn't want Brandy to live the rest of her life on ventilator. That was the choice they were given regarding Brandy. Look at the pain medications, look at the MARS. Folks, look at all of the evidence in this case, but there is State's Exhibit 14 prime. You'll have this notebook back with you. That has the MARS, some of the other direct flow Charge-sheet, pain scores, and the medication that was given to them. So in 14 prime, that is from States 1 through 14. Look at that. Look at the previous pain medications, look at the previous doses of benzodiazepines, and ask yourself, what purpose did he have when he ordered these beyond thunderdome doses during palliative extubation? Frances Burke was a 73-year-old woman. She was 5'3", 215 pounds. She has a stroke at home on January 13th of 2018. You heard the testimony of her son. He said, remember, she was trying to buy a movie. She was trying to use the clicker for something that she doesn't normally use it for on the TV. She was looking for water. There's water bottles next to her. Something wasn't right with Mom. She had a stroke. And she's taken by squad to the hospital. She's vomiting in the squad to protect her airway. The squad intubates her on the way there. A CT scan does show a large brain bleed. She's critically ill. But on January 14th of 2018, before he's even allowed to see his mom in the ICU, the family is being asked to sign a DNR. He never talked to the doctor. That was his testimony. And when he did get to see his mom, she did not appear to be in pain. Remember what Dr. Schweiger said. You need a 48-hour to 72-hour time for the patient to declare themselves. An ICU trial. That's one of the reasons you sedate somebody, protect the airway. You even paralyze them so they're not fighting a machine. Give their body time. Let's see where they're at. Was she given time? She was critically ill, folks. Was she given time? She was given 16 minutes after the defendant gave her 1,000 micrograms of fentanyl. She was extubated and died. Look at the previous pain scores. Look at the medication he gave her when she was extubated. Jeremy Sue, her family called her Sue, Hodge. Jeremy Sue Hodge was 57 years old. She was 5'4", 225 pounds. She had shortness of breath. She tells her family she needs to go to the hospital. She collapses in the driveway, and the neighbor gave her CPR in the driveway. EMS is called, and they give her CPR all the way to the hospital. They take her right from the ER right to the cath lab, right to the place where they go and check out the person's heart. What's going on with her heart? Well, they can't figure out what's going on with her heart. They do know her glucose is very high. I mean, it was like 800, 1,000. It's in the medical records. She codes in the ICU, the PEA, the pulseless electrical activity code, and they bring her back. And once again, critically ill. But when you see these codes in the hospital, what did the experts tell you about it? There's a lot of survivability to those, because it's not like bystander CPR. You've got doctors and nurses right there doing CPR right and giving the medications they need to survive. She's not given time though. Robert Hodge, her son, said he never let to see her. He was never even allowed to go see her until after they had made the DNRCC decision on that same day. She's given 800 micrograms of fentanyl, 6 milligrams of midazolam. She's extubated and dies within 5 minutes. There's no pain chart. She's there for such a short time, they don't even chart the pain she's in. Give pain medication to control pain. Give anxiety medicine to control anxiety. It's not even in the record prior to the administration of these drugs. James Allen, 80-year-old man, he's 5'6", 180 pounds. His son Jim Allen testified. Back on May 24th, that date's wrong, I'm sorry. But on the day he went in, he's not feeling well, he's not eating, his vitals aren't good, and so his son, not Jim, his other son, takes him to the hospital where he eventually diagnosed with gallstones. He's having gallbladder issues. His bile duct's all clogged up because of these stones and sludge that are in there. Right? I mean, this is not a death sentence, folks. This is not, well, he's 80, it's over. This is something they can fix, and they try to. They do an endoscope. They get rid of the stones and the sludge in his bile duct. They put a stent in there, which is just something to keep everything open, to keep the duct open. But he doesn't get better. He has to go to the ICU. He goes back to the regular floor, has a low blood pressure. They can't figure out what's going on. He starts vomiting blood, and you see that coffee brown hemosis. That's what they do. He's throwing up blood. He codes. They bring him back. Well, what was going on with Mr. Allen is the stent wasn't in the right place that they had put it. They do a second endoscope and try to fix the placement of that stent that they had placed in to keep his bile duct open. So he's not, ladies and gentlemen, a man that is at the end of some terrible cancer or other illness. He needed time in the ICU to see if he could get better. But that's not what Jim is told. He's told his dad, he's told his dad is in total organ failure. His dad had no chance. It's over. Can you give us 20 minutes? My dad's birthday. 20 minutes, midnight. We just can't. No one answers us. Nope, have to do it now. They sing happy birthday to him anyways. Remember, these are supposed to be planned events. There's nothing emergent about palliative extubation. You can wait for relatives who arrive from out of state. You have time to go and gather the team and talk to all the other doctors This is not in the middle of the night. You have to do it now. You can't wait 20 minutes so you can sing your dad happy birthday properly. But that's what happened to James Allen. He was given 1,000 micrograms of fentanyl, 6 milligrams of midazolam on the defendant's orders. He's extubated, and he died. Look at the pain medication. Look at the direct flow charting. Ask yourselves what those scores mean, whether those scores are real, or whether that's just what the nurses are putting in. Troy Allison was 44 years old, 5'8". He was a big man, 312 pounds. On July 15th of 2018, he's brought to the ER by ambulance because he was having difficulty breathing. When he gets there, he has a seizure and codes in the ER. So once again, he's coding. It's serious. It's bad. But he's at the ER, and he's got everything Western medicine can provide to him to help him at that point when he's in the ER at Mount Carmel. He has another code shortly afterwards, but they bring him back again, and he's transferred to the ICU. Now, what do you know about Troy? They did a CT scan on him, see what's going on with his brain, to see if they can observe, as Dr. Ralston did with Ryan Hayes. He's got an anoxic brain injury. But that report doesn't even come back before the defendant is talking to Mariah, the stepdaughter, and Christine, the wife, about extubating Troy Allison. Remember Mariah's testimony? She looked right at him. You have the results of the CT scan? What, if anything, did he say? He didn't say anything. He just stared at me for a second and then turned and started talking to my mom. They told you, the defendant told them, 99.9% sure Troy is brain dead and his organs are failing. What choice are these families given? What choice is Mr. Allison being given there? So, in addition to looking at the pain scores and the charting, in Mr. Allison's records, I would recommend you look at that CT scan that came back 1 minute after he was pronounced dead. And look at the results of that CT scan, which results were normal. Was he given a chance to declare himself? Was he given a chance to be in the ICU to see if his body could recover from the critical illness it was in? If you're asking yourselves, why are we here talking for weeks and weeks and weeks and hours and hours and hours about sick, dying people, what is the point of all of this? Troy Allison, along with all the other ones that could have lived, that's the point, folks. You didn't even wait for this result back. They didn't even chart pain scores. No other pain medication given to him. What purpose did he have when he ordered these drugs? Someone that's not in documented pain. Bonnie Austin was 64. She's 5'4". She weighs 152 pounds. On September 30th, she's having trouble breathing, so her husband calls the EMS on the way to the hospital. She codes in the squad. They bring her back. She has a pneumothorax, which the doctors explained to me was air trapped between her lung and chest wall cavity. And so they have to cut, when they put a chest tube in to get that air out, they cut into her with a scalpel. They do it without pain meds, folks. She's intubated and taken to the ICU. On that same day, on defendant's order, she's given 600 micrograms of fentanyl, 6 milligrams of midazolam. She's extubated and dies within 30 minutes. David Austin talked about how he met his wife and was married, was smitten immediately with her and married within weeks of meeting her 30-some years before. He was told his wife was gone before they extubated her. It's over. He couldn't even be there with her. He just started walking. I don't even remember how long I was there. We brought in Tara Schwartz. She is the Bonnie Austin's grandson's girlfriend, who was present after she was extubated. She thought she was seeing a miracle when Bonnie would look at them and mouth words and stuff, because they were told, no brain activity, brain, she's gone. That's why David walked away, not because he didn't love his wife, because he didn't want to hold her in when she died. He was told she's gone. She's not there anymore. He just laughed. Why would you? Tara sat in there, held her hand, I'm going to take care of your grandson, I'm going to take care of David, it's going to be all right. And Bonnie turned her head, and her and her mom were talking to her, trying to mouth something. Bonnie Austin was not gone. Only pain charted is when she is given the 600 micrograms of fentanyl. Nick Timmons. He's the second of the 2 overdose cases in this matter. He was 39 years old. He was 6'1", weighed 196 pounds. In October of 2018, he's found, it's in the medical records, down in the basement. He hadn't moved, maybe for days. We're not sure how long he had been there. They do find a hypodermic needle near his body. And in anti-mortem blood, just detected Ryan Hayes, there were illicit drugs in his system. They called a squad. They gave him Narcan on the way to the hospital. He has very low blood pressure and sugar. He's positive for cocaine and marijuana. He's not dead, folks. He's talking to them. In the medical records, you'll see that. He's not some coma guy that's not there. He's talking to them. He's sick. He's terribly sick, but he's not gone at this point. He had sepsis, which is the body's reaction, overreaction to infection. It's very serious. He needed dialysis, and he needed surgery for compartment syndrome. That's when you stay in one spot for too long and the muscles get, the blood can't flow correctly, and that actually fillet open the affected muscles, or to relieve that pressure. You'll see that surgery. In that surgery, it says he was given 14,000 micrograms of fentanyl. Remember what the expert said about that. That is not likely that that is what he was getting. That is not. Dr. Schweiger, who to this day works 70 hours a week in an ICU right now, said that is not what happened there. Because I don't know what that 14,000 is. That is not a dose anyone would get during this surgery. So, but that is in the medical records. His brother Lynn, a recovering addict, who's living in sober housing in West Virginia. He gets there the next day. He has to wait for his girlfriend in Portsmouth to drive and pick him up and take him. But he's not coming to say goodbye to his brother. He's coming to be with his brother, to get him through this, because Lynn knows, just because you're a drug addict in the bottoms of on the west side of Columbus, doesn't mean it's over. Doesn't mean you don't have value. Doesn't mean that you can't come back from that. That there is life after addiction. Lynn, the man that came in here and testified, he's proof of that. You can come back from even heroin and fentanyl, that there's life after that. And he's there to help his brother through. And he's told his brother's going to be okay. Until the night shift comes on. I don't know. What do you mean? The day, what happened? Your brother coded. Well, okay, so what's going on? I wouldn't leave. Look, man, I've been up for 30 hours. I gotta go. I'll be home. I'll call him. How many times they call him? Oh, he's coded again. Save my brother. He's coded again. Save my brother. He's coded again. Save my brother. He's told it's over when he gets back to the hospital in the middle of the night. He's told it's over. He agrees to the DNR, CC. They extubate him. They give him 1,000 micrograms of fentanyl, 10 milligrams of midazolam. They extubate him. And 5 minutes later, he's given an additional 10 milligrams of hydromorphine, and then another 10 milligrams of midazolam. Remember, hydromorphine times it times 100, if you want to know how much that's equal to in fentanyl. That's in 5 minutes in medical records. Remember Jake Beaver's testimony? Remember how important it is to know what's going on at bedside, what's actually going on at bedside? Oh, his brother came running out. Oh, he's in so much pain. Is that what Lynn told you happened? You're thinking, well, maybe Lynn's got an axe to grind here, a stone to grind. Remember saying this. Maybe Lynn's not being truthful about that with everything that's happened since then. Well, what did the other nurse that was there that night tell you? Nurse Cheryl. I do not recall anybody coming out of that room holler and say my brother's or give my brother more pain medication. I don't recall that happening. The other nurse that was in the ICU that night corroborates what Lynn tells you. Now, ladies and gentlemen, I would argue too, Nick just wasn't dying fast enough. Look at the medications that were given. Look at the pain scores. Count 12, Sandra Castle. She was an 80-year-old woman. She's 5 foot, 240 pounds. She went to the ER on 11/9 because she was having some issues that they needed to adjust the gabapentin medicines that she was on. They sent her home. They said, go home, schedule an outpatient, stress test, see what's going on with your doctor, outpatient. But the very next day, her heart stops while watching TV. Her son does CPR until the squad gets there. They bring her back. The squad brings her back. They get her to the ER. They do the hypothermia therapy. That's where they take somebody that's had potentially an anoxic brain injury, whose heart is stopped, and they put you on ice, literally put you on ice, and pull you way down so that they can take care of the swelling in the brain and see if you're going to be able to survive this. I would argue too, that's circumstantial evidence. They had not given up on her in the ER. They sent her to the ICU and she's intubated. Now, Dr. Dellinger and Dr. Mahoney do talk to the family about withdrawing care after she's been there, after she's been given that time to declare herself. Not the same day, not within hours, not in the middle of the night, 3 days later. 2 doctors. You're going to see that in the instructions, folks. What's a terminal condition? 2 doctors say someone's in a terminal condition. The law recognizes this should not be a decision by 1 doctor in the middle of the night. You need 2 doctors to say someone's in a terminal condition. So she's extubated in the afternoon on 11/13, and look at the medicine she's given. Look at the medicine she's given before Dr. Husel gets there. The levels of morphine. Because nobody is about people dying in pain or anxiety. She was having some pain and anxiety. It is appropriate during this procedure to give people pain and anxiety medication. And she lives. She doesn't die within 10, 15, 20 minutes. She lives. And the decision is made instead of transferring her to the palliative floor within a couple hours, which would have been the procedure. Because she has so many family members there, they said, I'll just keep her here and get to see her. Instead of making everybody move down, et cetera, we'll just keep her here. She's not an ICU patient anymore. She's a palliative patient at this point. She's not being actively, intubated, life-saving measures. They are allowing her to die naturally. Until that evening, about around 11 o'clock, her daughter, Sarah Burnham was there. She hears the death rattle, that secretions that as you are progressing to death, you can't clear them on your own. The drug they give you to dry that out. It's loud. She didn't think it was so loud, but remember what Sarah told you? Not Sarah not coming out saying, something's wrong with my grandma, she's in pain, please help her. You stuck, their money comes in. Want us to give you something for that? Quiet it down. Yeah. Okay. In this count, ladies and gentlemen, you get a glimpse of appropriate comfort care. Remember when Dr. Ely was being cross-examined by Ms. Menashe about all the other things all the other doctors were doing for these patients in these records? Yeah, there was some good care going on at Mount Carmel West. There was definitely some good care going on. And you get a glimpse of it here. About the pain medication she's given, this pain she's in, and the stuff that's given to her for that. Until. And there's so many of these is because this is how it's supposed to be. This is not 5 minutes and you're done, 7 minutes and you're done. They put out a craft cart for the family, they bring snacks in because this is a process. Until the defendant orders 1,000 micrograms of fentanyl and 10 milligrams of methadone. Where is that justified in any way in her medical records? What is his purpose to quiet that rattle when he gives her 1,000 micrograms of fentanyl and 10 milligrams of methadone? He approached them about it. Rebecca Wallace was a 75-year-old woman. She was 5 foot. She was 226 pounds. Her husband had passed. Her parents had passed. The person she did have in her life was her friend from church, Janet Watkins. And her friend from church says, something's wrong. You're not breathing right. I'm worried about your heart. You seem to be having a lot of difficulty. And she's telling her friend, I want you to go to the doctor. I'll take you to the doctor. She finally does. Takes her to the doctor, and the doctor says, you need to go to the ER. What's going on with your heart? So they do a scan of the heart. It shows she has a narrowing aortic valve. They put a stent in. If you'll see in the medical record, she was very nervous about this procedure because her family doctor had said the dyes they use for that procedure are very hard on your kidneys. And so the dyes in your kidneys are compromised. So don't let them do that, But she talks and talks about it, and she sees this as her chance to have more life. Even in her 75th year. This is not a woman that's looking like, well, it's over, I'm done, let's get it over with. She takes this chance on this procedure that she knows has risks because of the dye they use and the condition of her kidneys. She wants to live. But there are issues after that. And one of those issues is that large bruise, that internal bleeding she's having on her thigh, on her inner leg, because of where they went in and nicked her artery there. She's transferred to the ICU because of respiratory failure and because the hematoma kept getting worse. Janet Watkins had to go take care of her husband who was having some issues. She calls. Dr. Husel talks to her. I'm glad you called. Yeah, it's over. It's time. She leaves her, gets someone to watch her husband, and she goes right to the hospital. This is another person. This is another person that had a very strong belief about having a natural death. Not dying in pain, not dying in agony, that's not in anybody's plan. But to die naturally. She wasn't given that chance, folks. She was given 1,000 micrograms of fentanyl, 10 milligrams of methadone. She's extubated, and she's gone in 5 minutes. Look at the pain medications. Look at the pain scores. Melissa Penix. This is the one. Here we go again. Greg Dreschbach, the pharmacist, stumbles across this one. This is the one that finally got things to stop. 82-year-old woman, 5'2", 146 pounds. I would argue to you she is diminutive in size. She's taken to the ER on 11/15/2018 because she was very short of breath and coughing up a bit of blood. It's described as scant. So it's not like she's vomiting blood, she's coughing up blood, and it's even in the doctor's almost reads like, yeah, she's on 3 different blood thinners. So that's an issue. She had recently been in the hospital in September, but not for some terminal condition, not for some terrible cancer or other disease that's incurable. She had thrush, a yeast infection in her throat. She does okay. For those 5 days that she's there, she's having some trouble breathing. They place her, they don't go right to ventilation. They place her on the breathing mask, the BiPAP. Her daughter's there, Deborah Leonard, talking to her mom. They're not there on a death watch for their mom. It is not occurring to them watching their mom progress through this hospitalization that this is the end. Her granddaughter was helping her put her makeup on the day she died. Dr. Woodkeep, she's one of those attendings, the first one who testified. She, this is a template, cut and paste job. She was like, it's confusing what's going on with her. Clinical picture is confusing. But not to the defendant, who convinces the family that this appendix is done, it's over, she needs to be extubated. And he orders to her, now he's not even using different opioids. Not even putting in 1,000 mics of fentanyl and 10 of the 11. Differentiate that from 2 different categories, which nobody does. Don't give a patient 2 different narcotics at the same time. Now he's just out and out. For the first time, giving straight up 2,000 micrograms to this 82-year-old woman with compromised organs, compromised breathing. She weighs 146 pounds. She's 5'2". Gives her 20 of these vials all at once in a bolus. States Exhibit 28A. You heard the wonders. The one witness say, yeah, it's a big syringe. You got to put this in. It actually depletes. It depletes the supply they have on the ICU that night. A nurse, you heard the testimony of Greg Greshfall. Yeah. We're out of fentanyl in the Texas ICU. Go get it from the other. Go get it from the other Texas. No, we're out of fentanyl in the ICU. Both machines. It drained the system of what they had up there. And for good measure, on top of the 2,000 micrograms of fentanyl, 10 milligrams of midazolam, she's extubated or dies within 4 minutes. Look at the paralytics they gave her. Remember, paralytics are given when someone is intubated to help them so they don't fight the machine, so that they can let the machine do the breathing for them. You've got to make sure those are out of a person's system before you extubate them. Because if you're on paralytics and you extubate them, you're dead. You can't breathe on your own. And this is an 82-year-old woman who is critically ill. Look at the timing of those paralytics. Look at the timing of that medication, and ask yourself, what other purpose did William Husel have when he ordered those doses to be given to this woman under these conditions? Look at the pain medication, look at the pain scores. You cannot look into the mind of another. So ask yourself, what actions, what circumstances tell us his purpose? These are some of the things I would argue to you, some of the circumstances I would argue to you, tell you what his purpose is. The size of the dose of the fentanyl. States Exhibit 28B. I would argue to you, this is not a mistake, that this is a unit dose of fentanyl. 100 micrograms. Remember, they all said that would be the most I would give in morphine. I would give 10 milligrams. Maybe I've done that, probably in a divided dose, which is equal to milligrams. This is not a mistake that in the ICU, in the Pyxis machine, this is what they stop. Because if someone needs fentanyl, this is what you give them. You don't double it, triple it, or in the case of Melissa Penix, times 20 it. The size of the dose of the benzodiazepine. No one could actually recall the unit doses that the midazolam came in, but they all said it was several doses of the midazolam. And all the other doctors and the experts in this case told you those are giant doses. You start with 2 to 4, if indicated, not 10. His training in anesthesiology. He knew what these drugs do to people. He was trained at the Cleveland Clinic. This is not negligence. This is not reckless. This is on purpose. He knows what fentanyl and these benzodiazepines do to the human being. He knows it. And he's teaching it to these brand new nurses. His reaction when asked by pharmacy. Not a conversation. Not a, hey, this is what I'm doing this for. It's for a procedure. Oh, so there's not an extra. It's for a procedure. Remember, he's not a man of many words when he talks to him. He knows people are questioning it. His reaction when asked by nurses. What did he teach them? What did JP were telling you about lactic acid? Lactic acid, that's like when you work out and your muscles are all sore, and these people have really high lactic acid. So yeah, I mean, I know they're not in any pain, and I know we didn't give any pain medication, but now you see they've got all this lactic acid in their muscles. That's so painful. Well, what did an actual expert in this tell you? What did Dr. Schreiber tell you? Lactic acid in the blood, which is what they have, is not the same as lactic acid in the muscles. And in Dr. Schreiber's experience, lactic acid in the blood is not painful. But the nurses in the ICU, unwitting complicitors to all of this, are being trained. That's why we're giving them have to give them all this. Lactic acid levels. Look at oh, we had to jam in this arterial line. I mean, they describe a Foley catheter, which does not sound like a pleasant experience, but they don't say, inserting a Foley catheter into a male. Like, jammed, Jim Beamer said, Husel talking about being jammed into your penis. Well, is that how you describe a Foley catheter? No, it's not. It's not. Whatever you could do, whatever you could train them, whatever you could indoctrinate them on, how much pain they're in. That's what you would tell the nurses. The quick deaths of these victims. Dr. Ely, I told you, I added up the times. The median time was very, very quick. I had never seen this before. No one else anywhere is doing this under these circumstances. Not at Mount Carmel, and her Dr. Schreiber, and her Dr. Ely. No one else in the world is doing what he is doing. Not even close. And there is no literature that supports what he is doing. And we talked about the unit dose of fentanyl as dispensed in the ICU. He's intelligent. They all said it. All the nurses that knew him. He's very smart. I would argue to you that is one of the factors that show he knew what he was doing. He was doing this on purpose. He trained at one of the best hospitals in the country. He's very proficient at all the other tasks as an ICU doctor. Inserting arterial lines. Remember, every time, that's what they crossed him on up here. Look, he saved their lives during this code. And he saved her life by giving her this medicine. And he saved her life by doing this. And he saved her life. Yeah, he's very proficient at all the technical aspects of the job. He knows how to adjust a ventilator setting. Come here, let's show you. What do we do then? He's very good at all the technical aspects of what he does. But I would argue to you, a terrible healer, a terrible doctor. All of these things and more show me what he was doing. He was purposely hastening and causing their deaths. Each and every one of them, folks. Think about the other doctors. Every one of them that testified, including the experts, say, PRN, it means has needed. Ask yourselves this. Who doesn't order any PRN medicines for any of these folks? You want to find where the shots are that killed everybody is? Go to the medication records on each and every one of them. Not the infusions, because the infusions start right after them. But the medication records, turn to the last one. You'll find it right there. He doesn't order PRN because he knows this is it. I'm going to give them this, and they're going to die quickly. They're not going to need as needed medicine because I'm doing it all right now. He knew this. How do we know he caused? And caused, remember, with that instruction, there can be more than one cause of death. Cause includes hastens. The testimony of Dr. Ely, the testimony of Dr. Schreiber. Look at his qualifications, look at Dr. Ely's qualifications and experience. He's board certified in internal medicine in 1992. Not as the defendant became as a freshman and a doctor in 2000. In 1992, Dr. Ely has been doing this since then. He's board certified in pulmonary medicine in 1996, and he's board certified in critical care medicine in 1997. Decades of experience. He was also years and years doing lung transplants. Richmond agitation scale, you ever hear of that? Oh, yeah. Dr. Sessler, my friend Dr. Sessler. Yeah, from Richmond University. He came up with that. You heard from the guy that validated that. That is published in the Journal of American Medicine for validating the RAS score. That's in use here and all over the world. It's been translated in over 40 languages. This is the guy who 20 years ago, with his friend Dr. Sessler, validated the Richmond agitation scale is used throughout the world in medicine. There's just no justification beyond Thunderdome, is how I describe it. Like driving 250 miles an hour through a school zone while people are crossing the street and thinking you're not going to hurt somebody. He's been practicing more than 25 years and would never, ever use these doses. Why isn't there medical literature that supports it? There's no literature. Nobody does this. These were lethal doses. So while the defendant is good at the technical aspects of what it takes to be a nighttime ICU doctor, I would argue to you Dr. Ely shows you what it is to be a healer, a doctor actually. Someone that is there to care for people and to treat them, even in their deaths. He's a technician over there, folks. He knows what he's doing. That doesn't make him a good doctor. Dr. Schweiger. Well, if you wanted somebody that had the same background as the defendant, because that sends you to a point that, well, Dr. Ely, internal medicine. Well, Dr. Schweiger has the background in anesthesiology that the defendant does, right? He has that. He's been board certified in anesthesiology since 1994. So almost 3 decades ago, he was board certified in anesthesiology. But what else is he board certified in? Critical care, which is what we call a doctor who works in the ICU. And what else was he board certified in? Acute and chronic pain management. Boy, that's what I would argue to you this case is all about, right? I mean, this is the guy that is board certified and recognized as an expert in those fields. He's board certified in acute and chronic care management. He knows how to do it right. Had these patients declared themselves, term heart we use in the ICU. That's the whole point. We're not doing this just as like as a way to spend money on somebody at the end of their life. You're sedating them, you're intubating them, you're paralyzing them, not because we want to run the bill up, giving them time. Time is what this is about. To let the body heal itself. Not all of these patients, he told you, within a reasonable degree of medical certainty, based on his training and experience, had reached that terminal phase. And the judge will tell you, in the state of Ohio, the definition of terminal condition has a requirement that 2 physicians declare it. He told you lactate in the blood is not the same as lactate in the muscles, and his experience is not painful. And this is the guy that's board certified in pain management. He told you over and over again, on each and every one of these 14 victims, there is no medical justification for the doses of fentanyl and benzodiazepine. I'd like you to consider, I'd argue you to consider his qualifications, consider his prior experience. You heard from the testimony of Dr. Ziv. What did he really tell you? What did Dr. Ziv really tell you? I would argue to you he spoke in generalities. He didn't talk in any specifics about any of these 14 patients. Didn't talk in any specifics about the doses they were given. I would argue to you he didn't do that because there's no medical justification. He wants to talk about in general. You want to cover the pain. In general, you want to do this. And unlike Dr. Schweiger and Dr. Ely, who took the deep dive, the necessary deep dive, the reason this has taken 8, 9 weeks, however long we've been here, and what we...
Okay. What? I didn't hear what you said.
Burden shifting.
Okay. Ladies and gentlemen, it's the state's obligation to prove here. The defense doesn't have to prove anything. Okay? Now, he can comment on the testimony of the doctor, but it in no way shifts the burden to the defense at all. Do you understand that? Continue on, Mr. Zahn.
Unlike Dr. Schweiger and Dr. Ely, who took the deep dives on each and every one of these, and made mistakes in their reports. I mean, one of the mistakes was he referred to the victim as a he rather than a she. But there were other significant mistakes about procedurally what occurred to some of these people. He said, oh, yeah, no, that's right. Yep, you were right. In the medical record, I had said this happened at this point, but you are clearly showing me right now this is what happened. Yes, that was a mistake. Yes, that was an error. And they both did because, I would argue to you, the massive amount of material they reviewed and delivered evidence on. What did Dr. Zivit tell you about any mistakes or contradictions? Nope. 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 He didn't admit one thing was wrong with anything he said. What about the established medical science that's been tested, that all the other doctors in this case testified about the known synergistic effect, the potentiating effect when you give benzodiazepines and narcotic pain medication together? 1 + 1 doesn't equal 2, 1 + 1 equals 4 or 5. And that wasn't just the experts, that was the doctors at Mount Carmel, the other doctors, his former colleagues, that was the pharmacists who told you that. That is a known thing. There are studies about that. No, I don't. That's not. So when the science contradicted what he wanted to tell you, that's not real. What about this organization you belong to and their recommendation? Oh, I resigned from that committee. I don't agree with that. What about when you testified previously? Oh, different context. What does that have to do with this? That has nothing to do with this. Different context. Wouldn't admit that there was anything contradictory or mistaken, except that apparently he accidentally put on 2 degrees he didn't have on a CV. That was one thing he did acknowledge he had made a mistake about. I would argue to you that what he is a crusader on is the government, the state, getting into the business of medicine. Doesn't like it when they do it in the death penalty. He doesn't like it when they do it here. And he's not some random doctor that was pulled from some hospital in Tennessee or Florida. Somebody sought out and said, what about this? He has a connection to the defendant. They share a mentor. So consider that in evaluating the credibility and the veracity of his testimony. Double effect. You heard a lot about double effect. First of all, it's not a law in Ohio. It is a bioethical and philosophical doctrine that doctors should be guided by, not just in palliative extubations, but in all they do. It is a recognized thing doctors have to consider, and that is the good must outweigh the bad. It's about proportionality. That's what this is about, proportionality. Does this good that we want to do, control pain, outweigh the bad, speed up death? So that is not a law in Ohio. It's something doctors need to take into consideration. And all the doctors say, well, it's about proportionality and moderation. And that, what he's doing to these patients, all 14, is not proportional to any symptom they have, and it's not moderate in any way or in any universe. It is not a carte blanche for a doctor to do whatever he or she wants. The fact that there maybe have been more than one cause of death in each and every one of these victims is not a defense, as long as the drugs he administered were either the cause of death or the hastening of death. Remember that instruction when the judge gives you. There may be more than one, there may be one or more causes of an event. However, if these drugs were one of those causes, even if they had these other diseases that also caused their death, it's not a defense that they were just really sick people and died anyways. And Dr. Ely and Dr. Schweiger were unequivocal after the thorough and complete examination of these medical records. These doses either hasten or the out-and-out cause, especially in Melissa Penix's case. The out-and-out cause, he killed her with these drugs. Another thing, once again, we're back to that. This is about reason, this is about common sense. 12 people from the community in Franklin County. This happened in your town, in your county, folks. That's why you're here. What does your common sense tell you about that? Fentanyl is a powerful, dangerous narcotic pain medication with the known effect of suppressing respiratory function and can kill a person. Midazolam is a powerful, dangerous benzodiazepine with the known effect of suppressing respiratory function and can kill a person. These two drugs used together have a known demonstrated synergistic effect, which potentiates the effects of these drugs they have on their own. People die every day in our community overdosing on fentanyl. Not something we just call fentanyl, it's really something else out there in the community. Fentanyl. The drugs he used, now not pharmaceutical grade, not of the purity he's giving them, but what everyone's out there dying and overdosing on.
Objection, Judge.
Okay. Sustained.
In your common experience, what is going out there?
Objection.
Judge, I'm allowed to talk about the common experiences of our community, and this is a
I
common
understand what
experience.
you're allowed to talk to. It's sustained. Move on.
Dr. Schweiger talks about the Utah study. This is one of the many studies that he testified about the known synergistic effects of these two drugs. The one that Dr. Zivit just said, I don't agree with that. These are 12 healthy men. And when they gave much lower doses than what he was giving to these very sick older people, 11 of the 12 had to be rescued. You're like, what are we here for? I mean, these people are so sick. Brian Hayes is gone. Drug addict. Timmons, gone. Drug addict. They're on their way out. Why are we here? Because it's a crime to kill a dying person, folks. So at the end of the day, though, you'll also be instructed on attempted murder. And this, you only get there if you feel the state has not proven beyond a reasonable doubt causation, in fact, on each and every one of these. And you're to consider each and every one of these separate and apart. That's why this has taken so long. These are 14 separate murders that in and of themselves would take a long time by themselves to try. But these are 14 altogether. So you look at count 1, and then you look at count 2, and then you look at count 3. And on any one of those, if you're not firmly convinced, your reason and common sense doesn't tell you 2,000 micrograms or 1,000 micrograms killed these people, actually caused their death, you may consider the lesser of attempted murder. And in attempted murder, before you can find the defendant guilty, and that's on each and every one of these, the lesser included is, was it his intention to at least try to cause or hasten their deaths? So you will be given the instruction of the lesser included offense of attempted murder in these cases. But only go there if you, as a group, no, state didn't prove cause on count 1, count 2, count 3, etc. Whatever count you're on. I say that way because it's not like an all or nothing thing. It is each individual count needs your separate deliberations. Don't go there as a compromise if you believe the evidence supports the greater charge. Attempted murder is the same thing as murder, just with the word attempt in there. The judge will tell you what attempt means. We talked a lot about this. We talked a lot about the purpose. What was someone's intent? Why was he doing this? Motive. The state need not prove motive. The presence or absence of motive is one of the circumstances bearing on the defendant's purpose. And the judge will tell you, in the state of Ohio, you can have a good motive for doing something. You can have the best motive for doing something. But if it's illegal, if what you're doing is a crime, but I'm doing it for a very good reason. I'm doing it for the best of reasons. I'm doing it for mercy. I'm doing it because I think this is what good medicine is. Quickly and painlessly causing the death of these dying people. I'm doing this because I want to be a good doctor and do good in the world. But if he is purposely causing their death and who's hastening their death by this, that good motive is not a defense in this case. We've talked a great deal about this and brought here for this very reason. Motive is the why. One of you said when we were talking about it. Motive is the why. Why did you do it? Purpose is the intention. What did he intend to do when he did it? You can find that he might even have had a good reason as to why he purposely caused or hastened the victim's death. That's not a defense to the crime of murder in the state of Ohio. It's like what we talked about in voir dire with the vet, right? When your dog or cat is at the end of its life, that vet who has given great care to your animal throughout the course of its life, who's done everything, who's done miracles, to bring it along. But when it's over, and you've made the decision that it's time to, and we euphemistically call put them down, put them to sleep, and you take them to the vet is not giving them that medicine because that veterinarian is a bad person with malice in their heart for that dog or cat that they've otherwise given great care to. They are doing that out of mercy because that is what you do to sick animals. But their intention is not just to cover the pain and let them die a natural death. Their intention, their purpose in giving the drugs they give those animals when they euthanize them is to kill them. And that's fine in veterinary science. That is not fine in the ICU at Mount Carmel or anywhere in the state of Ohio. Things not to consider. Of all the things, and I want you to consider all the evidence. And to reiterate what the judge just said, I want you to hold me to my burden. Because I've got to prove these things to you beyond a reasonable doubt. And this is too important not to hold me to that burden. So while I comment on what you consider Dr. Zivit for, remember, no matter what, hold me to my burden. Did I prove to you that he purposely caused the death of each and every one of these people? And of all the things I want you to consider, no matter who produced the evidence, either through direct testimony or through cross-examination, which was extensive, was excellent. The things I ask you not to consider are things like sympathy. Either sympathy for the victims' families who lost their loved ones and then were told months, years later, they did not die naturally. Or sympathy you may have for the defendant and for those that are here who love and care for him. Put that aside. Any bias you may have, either against the people that testified for the state, or any bias you may feel against anyone else involved, just put that aside. The last thing I ask you not to consider, and the judge will instruct on this, is the topic of punishment. Punishment, if we get there, and I argue to you we should get there in this case, is reserved by law to the judge, Judge Holbrook in this case. And as I said in voir dire, I know it's on your mind after a guilty verdict, because if anyone chooses to talk to us afterwards, that's the first thing they ask. That's fine afterwards. But in considering whether or not the state of Ohio is necessarily proving that he purposely caused the death of any of these folks, of all of these folks, I ask you to take that out of the equation and just consider the facts, and circumstances, and evidence. So what to consider? Everything that's been admitted to, physical exhibits, the testimony and stipulations. That's the evidence in this case. Thank you.
Thank you. Mr. Baez, it's late in the thing. You want to stand up and say hello, and basically that's about it?
I'm more than happy to start when we all come back from lunch.
Okay, fair enough. Let's give you guys, we'll get started at 1 o'clock. Okay? Have a wonderful break. Remember the admonitions. It's particularly important you don't start discussing the case. You don't have the law yet. Okay? With that, all rise. Have a great lunch, guys. Thank you for the coffee, by the way. Y'all can be seated. Okay, for the record, anything, Mr. Zion?
Well, we would like to talk about some of the slides the defense has provided to us this morning.
Do you guys want to do that here, or you want to do it in back?
You can do it on the side. I'm hoping this won't take long. But
Well, why don't we do this? Why don't we eat our lunch? You guys talk about it and see if you get a compromise. If you can't get a compromise, then we'll meet, let's say 22, 1.
sure.
That way my court reporter can get something to eat. Okay? Anything else?
No, Your Honor.
We'll get started with continuing the closings at 1. With that, I'm going to close the record.
We're here today to announce the results of an approximate 6-month investigation, a 25-count indictment against Dr. Husel for murder.
How did we get here?
Let me express my deepest condolences to the families.
You gotta be joking. It can't be. Why would he do that?
Here.
Okay.
A place where families are reliving pain.
We're all hurting. We're all horrified.
Here. A place where a doctor is accused of killing his own patients.
Dr. Husel, do you have any answers as to why?
No comment.
Is it fair that you're walking out of jail today?
No comment again. Sorry.
Do you have anything you can say to the dozens of families who are hurting right now?
Never did Dr. Husel or anyone on his team have the intent to speed up a patient's death.
So how did we get here? In this series, we will answer that question and others and explain to you how we broke the story of the patient overdose scandal at Mount Carmel. It is more than just the story of a lone doctor accused of giving his patients too much pain medication. It's much more than that. It's about a series of missteps, miscues, and miscalculations on the part of a health organization that helped contribute to a tragedy.
I was just wondering if you might have some time to talk with me.
So we called Dr. William Husel on January 14th. That's the same day we went on air with the story.
Have you already retained a lawyer, or is there someone I could call?
He declined to comment, telling me to contact his attorney. We had been working on this story for several days, acting on a vague tip that a doctor had been dismissed from the hospital. We were pushing our sources for more information, and we were able to get a hold of some internal memos from the hospital showing that the doctor had not lived up to the hospital's standards of care. The day we went on air with the story was the day that first lawsuit was filed. It was also the same day that Mount Carmel released a video statement.
Hello, I'm Ed Lamb, President and CEO at Mount Carmel Health System.
So Mount Carmel put out this video announcing that Dr. William Husel had been fired and that over 5 years he had ordered significantly excessive and potentially fatal doses of pain medication that had been given to 27 near-death patients. They all died. The hospital at the time also announced that it was suspending 23 nurses and pharmacists for their roles in administering these drugs.
On behalf of Mount Carmel and Trinity Health, our parent organization, we apologize for this tragedy, and we're truly sorry for the additional grief this may cause the families.
What we would later learn is that the hospital created a second video. This one was only sent out to staffers and in part laid blame.
Sadly, our investigation revealed that some of our colleagues did not meet our standard of care. The actions that created this tragedy were instigated by this physician and carried out by a small number of good people who made poor decisions. They ignored the safeguards we have in place.
So in that second video, Ed Lamb appears to lay some blame on the staffers, which is different from the video that was released to the public.
We take responsibility for the fact that the processes in place were not sufficient to prevent these actions from happening.
What we would later learn is that the hospital had been investigating for months, and that when it first learned of an allegation involving Dr. Husel's patient care, in between the time they learned that and when they removed him, 3 more patients died, something we would attempt to press the hospital on later.
Was there any chance to remove him prior to that?
Not before October, no.
No upper level management knew prior to that?
No.
He shortened her life. He took her right to choose her death away. And I just feel that Mount Carmel should have stopped him long before this happened.
Albert Belisari's sister Joanne was a companion nun, very active in her church. Of all the patients identified by the hospital as being tied to the overdose scandal, Joanne Belisari was among the first. She died in 2015 and was the first to receive 1,000 micrograms of fentanyl.
It looks and appears to me you had a rogue doctor, you had a breakdown in protocols in the hospital.
Albert says he feels let down that a Catholic hospital would allow something like this to happen.
They're saying it's comfort, but when Joanne, she was out of the comfort zone. She was going to die anyway. And he didn't even consult the family before he inserted the fentanyl.
That process in particular, Albert says, about the drugs being inserted, he claims was not explained to him.
I'm angry, we may have consented if he asked, but he didn't. He just chose it himself.
Another patient, Jan Thomas, died 2 months before Joanne in March of 2015. She got 800 micrograms of fentanyl.
Okay.
Reliving the loss of a loved one has been difficult for a lot of these families.
It just rips the wound right open again. So it hurts a little bit more this time.
The patients' families hired attorneys who sued Mount Carmel and Dr. Husel in wrongful death lawsuits. They claimed the doses were grossly inappropriate and that the hospital was negligent. Husel's attorney and those for the hospital have argued in court filings that these patients were in very poor health, or in some cases dying.
If his intent was not to cause them death, his intent was then to do what? What was his
comfort care? Comfort care. I think it's important that everyone watching this understand that the patients that we're talking about are end-of-life patients. These people were being kept alive primarily due to the equipment in the hospital.
Prosecutor Ron O'Brien used an analogy to sum things up. He said Husel's actions were akin to blowing out a candle while there's still some wax left over. A grand jury indicted Husel on 25 counts of murder because 25 patients, according to O'Brien, received 500 micrograms of fentanyl or more.
And I have found no one, nowhere, that says 500 micrograms of fentanyl is an appropriate use of fentanyl for treatment of someone being taken off a ventilator.
All of the patients were in Mount Carmel's intensive care unit, where Husel worked the overnight shift. Many families told us their loved ones were in bad shape, but they were convinced by Husel or others that their loved ones were dying or brain dead. Records show nearly all the patients got the drugs around the time their ventilators were being removed.
You know, you want to believe it's just a bad dream and that it's not true.
Lisa Coleman recalled a conversation she had with Dr. Husel about her father, Jim Allen.
He said, I can promise you that he will not suffer and he'll go quickly.
Did they tell you that Jim was brain dead?
They said he was in complete organ failure.
That's what they told us.
That's basically what they told us too.
Yeah.
After news of the scandal broke, the Centers for Medicare and Medicaid Services steps in, sending state health inspectors to the hospital to find out what went wrong. They find in 24 of the 27 patient cases they reviewed that Dr. Husel used an override function on a medication dispensing machine to essentially bypass the pharmacy and gain access to pain medications like fentanyl. To families and their attorneys, this is proof that the hospital's internal safeguards were not working.
This proves their negligence. It just proves to me that they weren't guarding, watching the ship. Their words should speak for themselves.
The hospital says it first learned of an allegation involving Husel's patient care through a formal around October 25th, 2018. But it didn't remove Husel from patient care until November 21st. And during that period, the hospital got additional reports, and 3 patients died.
We want to know what that formal report was. We want to know what informal reports they had. Reality would tell us that somebody in this 4-year period of time was saying something about this.
Was the hospital aware before October?
We've been discovering things all along as we've been learning the investigation process.
But was there any chance to remove him prior to that?
Not before October, no.
It's only after these lawsuits are filed and CMS steps in that we learn from Mount Carmel that some of the patients could have seen their conditions improve with other treatment. And we start to hear from sources inside the hospital who allege that this tragedy could have been prevented.
Hello, I'm Ed Lamb, President and CEO at Mount Carmel Health System.
The same week the news broke about the patient overdose scandal at Mount Carmel, the federal government steps in, sending state inspectors to the hospital to find out exactly what went wrong. How did these large doses of medication end up in the patients? By late February, the hospital admits that some of these patients could have seen their condition.
We are aware of 5 cases in which this possibility is a concern.
All this time, we had been talking to Mount Carmel employees, some of them telling us key details. None wanted to be identified.
It is absolutely a systemic failure.
We did speak to one who worked directly.
He is well respected among the staff members. He is very calm.
The source says the allegations against Husel that he allegedly accelerated the deaths of 35 patients could be hard to prove.
The line between providing comfort and accelerating death is a very great one.
His criticism was aimed at the hospital, who he says erred in suspending nurses and pharmacists who helped administer or approve these drugs, saying they hadn't been trained properly, ventilator removal, and that the hospital safeguards weren't strong enough. Husel's accused of ordering large doses of fentanyl and using that override function on a medication dispensing machine to bypass the pharmacy and gain access to the drugs.
So in other words, you could order, you wouldn't have to tell the pharmacy you were doing a ventilator withdrawal?
That's exactly right.
You could just say, I need 1,000 micrograms of fentanyl.
That is exactly right.
So the source says that Husel was very much liked by his colleagues and that he even helped train some of the people working in the ICU.
Did anyone challenge Dr. Husel over these high doses?
Now, Dr. Husel has been known to prescribe high doses of narcotics and sedatives. He has been challenged, and there have been verbal communications to managers about these things, but no one expected that these events had led to death.
Mount Carmel has said it did not learn of concerns about Husel's patient care until October of 2018, when it first began to investigate. But sources tell us that the hospital erred long before this, in 2013, when it first hired Husel.
The families need to know that, we could have prevented him from having those privileges and being on that floor, on that unit.
This source alleges that Dr. Husel didn't meet Mount Carmel's own criteria to work as a critical care intensivist. We got a copy of Mount Carmel's application for clinical privileges, and in order to work in the ICU, you have to either be a DO or an MD, have completed a fellowship in critical care, a residency in internal medicine, and be eligible to take and pass the board exam in internal medicine. Husel met just 2 of those 4 requirements. The hospital said they got an outside legal opinion and that according to its own bylaws, Husel's skills were good enough. But our source disagrees.
No, I think this is obvious. He should have never been in the hospital. We could have prevented 35 deaths.
Through our own research, we found out that the hospital was not aware of Husel's past convictions in 1996 on a misdemeanor charge of possessing a pipe bomb. They didn't learn about that until after Husel was fired in December of 2018. So how did that happen? Well, according to our sources, the hospital's background check only went back 10 years, meaning if he was hired in 2013, the background check would only have gone back to 2003 and missed the charges from 96 and the other charges from 94 when he was charged with breaking into cars. The state medical board knew all of this. Husel told them about it when he applied to get his license to practice medicine. But it was information that never reached the hospital. When they did learn about it in the days after his firing, the president of Mount Carmel West, Sean McKibben, and his wife called 911.
There's a situation with a physician that lives in Dublin that puts us at risk because my husband is the president of the hospital where he used to practice. And so we are, there's concerns about our security and our safety.
Husel never threatened anybody, but a hospital spokeswoman said at the time apprehensions were high. That's why those calls to police were made. Mount Carmel has said it wants to make corrections and that it does not want to have a tragedy like this happen again. So far, those details have only slowly been released through press releases that the hospital puts out or videos that it creates. The hospital, for the most part, has largely avoided direct questions from reporters.
We are an amazing health system, and that is the truth. Unfortunately, it wasn't just one. We're talking about at least 40 people. 40 people, at least, knew. Somebody was refilling the Pyxis. Somebody knew all those vials of fentanyl were gone. The Versed, the Dilaudid. Somebody.
There are a few questions that remain unanswered. Why did this happen? Who knew about it? What did they know? And when did they know it?
Somebody knew after the 5th time, after the 10th time, then after the 15th time, and the 35th time.
Was the hospital aware before October?
We've been discovering things all along as we through the investigation process.
But was there any chance to remove him prior to that?
Not before October, no.
Mount Carmel administrators have repeatedly said that they were unaware that one of its doctors was ordering high doses of pain medication and that others were administering it to near-death patients. But sources tell us the rank and file knew.
Did anyone challenge Dr. Husel over these high doses?
Now, Dr. Husel has been known to prescribe high doses of narcotics and sedatives. He has been challenged, and there have been verbal communications to managers about these things.
Mount Carmel suspended 30 employees, many of them nurses and pharmacists, and submitted their names to their respective state boards for potential discipline. Documents sent from the boards allege that the nurses should have known these dosages were harmful. Mount Carmel admits its own internal reporting system led an employee to blow the whistle on Husel in late October. Remember, between October 2018, when the hospital said it first learned of an allegation involving Husel's patient care, and November, when they removed him from patient care, 3 patients died. And something else happened. Husel's name was included on a list of physicians who were re-credentialed and reappointed to the active medical roster. Critics say this illustrates another institutional failure, that the left hand didn't know what the right hand was doing.
The processes in place were not sufficient to prevent these actions from happening.
And while the hospital has acknowledged some responsibility, it has only communicated through news releases and videos it creates. They've claimed the prosecutor's office and their own attorneys have told them not to speak about the scandal. So when Mount Carmel ends up in the news again with additional tragedies, a deadly helicopter crash involving a partner agency, and a Legionella outbreak, when 2 of these incidents involved internal failures, we still had questions.
Sean, I'm wondering, it appears as though you guys have gone from one controversy with the patient overdose scandal to this one dealing with Legionella. I'm wondering what role or responsibility administrators bear for that, for both of those.
You know, we're talking about the Legionella situation today. You know, if there's another time that you want to get together and talk about that, Samantha, I'm sure, can arrange for that.
Sure. I mean, we've asked that repeatedly. I just want, you guys have been rather sheltered from direct questions related to the patient overdose scandal. I'm just wondering if there's anything that you guys would care to share in regards to bearing responsibility for what happened, not only with that, but with this.
Yeah, I mean, again, We're here to talk about Legionella today.
He would not answer our questions. Dr. Husel has also said very little.
Dr. Husel, do you have any answers as to why?
No comment.
Is it fair that you're walking out of jail today?
No comment again. Sorry.
Dr. Husel's medical license has been suspended, his Medicaid provider agreement is on hold, and now he's facing a murder trial accused of ordering too much fentanyl for 25 of the 35 patients who died under his care.
So what do you say to that?
Just trust the process.
Do you trust the process?
Yes.
Do you feel that in the end you will come out not guilty?
Hope so.
Never did Dr. Husel or anyone on his team have the intent to speed up a patient's death.
These were conscious decision-making orders by the physician.
Attorney Jerry Leesburg and his firm represent 17 of the patients' families suing the hospital and Dr. Husel, including 2 patients who died within hours of each other, Timothy Fitzpatrick and Beverly Schertzinger. In Fitzpatrick's case, something unusual happens.
He asked for 1,000 micrograms of fentanyl to overdose a patient and was told by the pharmacist that they didn't have enough fentanyl and that they would therefore request that if he accomplish what he needed to accomplish with 500 micrograms, if that was sufficient. And he said yes. So he took 500 micrograms and gave it to one patient, and then he took the other 500 micrograms and gave it to another patient.
The other patient to receive 500 micrograms of fentanyl that day was Amy Paff's mother, Beverly Schertzinger.
The pharmacy didn't have enough fentanyl. That's an issue. Why do they not have enough fentanyl? Because this doctor keeps giving them to these patients. You know, the fact that he gave it to one patient and then gave it to another, and it's upsetting.
Just the estate of Ryan Hayes.
While the hospital isn't saying much publicly these days, it is quietly settling some of the cases involving these patients' families. So far, the hospital has paid out roughly $4 million, including $485,000 to the family of Ryan Hayes, one of 2 patients, to get 2,000 micrograms of fentanyl.
We don't really have any evidence, for example, that Mr. Hayes was going to survive regardless of Dr. Husel's intervention.
Even though the attorneys acknowledge their client may have died anyway, that hasn't stopped these settlements from coming in. I asked one of the attorneys if that fact creates a defense for Dr. Husel.
He did something criminal, and it's really not about the survivability so much of these patients. It's really about lack of oversight by the hospital system and by his criminal actions in prematurely terminating these patients.
Any explanation you can give on behalf of the doctor?
Not right now.
When you say not right now, when will that be?
Well, I imagine there's going to be a trial.
A criminal trial that could last 8 weeks.
We're talking about the ability to exonerate him and the ability for me as his lawyer to appropriately defend him without compromising an ongoing murder case.
Attorneys for Husel and the hospital want a judge to place additional civil lawsuits on hold while the criminal matter is still pending. But attorneys for the patients' families have said there's still a lot of work to do. They want to interview the nurses and the pharmacists, and they want to review hospital policies.
I think it's very important to find the root cause of why did this happen? How did it go on for 4 years? Once we determine that root cause, that's going to be important for all hospitals to incorporate that and make sure this doesn't happen at some other hospital, some future date.
Even with a potential criminal trial and dozens of wrongful death lawsuits, it may not answer all of the questions. We may never learn why. We do know how we got here.
For the first time since the scandal erupted, we're hearing from nurses and pharmacists about what happened inside Mount Carmel Hospital that led to the firing and later criminal charges against Dr. William Husel. Husel has pleaded not guilty to 25 murder charges, accused of ordering potentially fatal doses of fentanyl for his patients.
But in sworn video statements filed as part of the civil lawsuits against the hospital, nurses and pharmacists paint their own picture of a well-respected doctor who treated dying patients and a hospital that allowed for easy access to powerful painkillers. Here's Chief Investigative Reporter Bennett Haverly.
I believe I've already answered the question.
Ma'am, it's not for you to say. Is that your answer?
My answer is that the medications that I gave my dying patients were not harmful to my patients.
And
They were comfort care medications to keep them from feeling themselves suffocate to death.
This exchange between former Mount Carmel nurse Jamie Burke and a lawyer representing the patients' families helps illustrate the conflicting viewpoints about what happened inside Mount Carmel Hospital that led to lawsuits, firings, and a doctor being criminally charged with his patients' deaths.
Do you have anything you can say to the dozens of families who are hurting right now?
I'm going to have no comment for all your questions.
Civil attorneys and the county prosecutor allege that Dr. Husel ordered excessive and inappropriate doses of fentanyl for the near-death patients under his care. But in sworn depositions obtained by 10 Investigates, some of the nurses who worked alongside him tell a different story.
Did he ever suggest to you that or insinuate in any way that these drugs could in fact hasten death?
He told me that his intent is comfort care.
Former Mount Carmel nurse Jacob Deemer told attorneys that he asked questions of Husel about high doses, but Husel told him that there was no maximum dose for fentanyl when a patient's ventilator is being removed. Many of these patients under Dr. Husel's care were said to be in poor condition. The central question that's being debated: did the large doses accelerate their deaths?
I certainly did not want that to occur. I didn't want harm to occur. So on the news, or you see something and it says, 35 people camp. That just makes me upset. And I know that's not my truth.
Some of the nurses allege these patients were dying anyway, and that the drugs were meant to lessen the severity of those final moments.
So now he's going to be palliatively withdrawn. I'm going to take away his breathing, take away the pressure that's keeping lungs open, his PEEP. I'm going to take all of that away, and he's going to be on room air. He's going to suffocate to death. 500 micrograms of fentanyl was not a large amount at all.
Mount Carmel Health System has paid out nearly $14 million in legal settlements to the patients' families who sued after they were told by the hospital that their loved ones may have been given too much medication. Several lawsuits remain pending. These video depositions are part of that ongoing legal fight. We obtained them through the courts before a judge ordered them sealed.
We've heard dosages of 500, 600, 800, 1,000. Were you aware in the community there of the nursing that he used those kinds of dosages of fentanyl prior to extubations?
Yes.
Okay. Did everybody know that?
Yes.
Former Mount Carmel nurse Mariah Baird and Husel got married after the two met while working in Mount Carmel's ICU. Baird and many other nurses deposed as part of these lawsuits also face potential discipline from the state nursing board, in part over failing to question the medication orders. Baird was the nurse responsible for caring for patient Jan Thomas.
Did you have any concern at the time of Jan Thomas's extubation that 800 micrograms of fentanyl could in and of itself cause death?
800.
Form. Go ahead and answer.
800 was an appropriate dose for my patient.
How these doses were accessed has also become a central focus for the patient's attorneys. Health inspectors who reviewed hospital records found that Mount Carmel's pharmacy was often bypassed by nurses who used an override function on an automated medication dispensing system, or AMDS, to quickly gain access to large doses of fentanyl and other drugs that were given to patients as they were taken off ventilators.
When I was in orientation, I was taught that everyone was overriding.
Nurse Stephanie Lachard and others testified that overrides were common in the ICU. Pharmacist Gregory Driesbach also noted it, saying he raised concerns to his manager about the high doses being accessed via override. Initially, Driesbach said he thought people might be stealing the drugs. He rejected an order of 1,000 micrograms of fentanyl meant for patient Rebecca Walls. The drugs, he said, were later given to her anyway.
That had to be of some concern to you.
It was.
Driesbach fired off 2 emails to pharmacy managers in the fall of 2018. It was the day after Walls' death that he learned of an even larger dose of 2,000 micrograms of fentanyl meant for Melissa Penix, which Driesbach said drained the intensive care unit of its entire supply of fentanyl.
If you remember earlier, I stated that when they give these doses, it drains the machines upstairs of all the medication. So in this case, it drained both machines of all the medication. So they asked me to send someone up urgently to refill them because they needed fentanyl for patients that were in the unit. I said, just take from another machine until we fill it. And they said, we used both machines, the whole stock, on a pallet of extubation earlier.
And that had to be shocking and alarming.
Objection.
Objection.
Yes?
It was unusual, yes.
Shocking and alarming?
Objection. Asked and answered.
Were you shocked and alarmed when you learned that a patient had received?
Yes.
You'd never seen that before?
Not a dose like that, no.
Husel's privileges about a week and a half after that email from Driesbach were revoked, and Husel was fired in December of 2018. He has since filed his own defamation lawsuit against the hospital, alleging that the hospital rushed to judgment and failed to thoroughly review the medical records of the patients. The hospital has denied that narrative. We were not able to get a hold of the nurses, but an attorney who represents them declined to comment today. Husel's trial is set for 2021. Reporting live in Columbus tonight, Bennett Haberly, 10 Investigates.
Bennett, thank you. If you'd like to go back to the beginning and read up on this case with Dr. Husel, just go to 10tv.com/.
I'll be right over there.
Yeah, thank you. Please be seated.
Good morning, ladies and gentlemen of the jury. How are you today? It sounded like it was a bit festive in the hallway. Okay, we're going to move on to the next phase of the trial. This is the opening statements. It's what the lawyers think it's going to be. It's like the trailers at a movie theater. They're going to tell you what they think the evidence is going to show. It is not evidence itself. That'll come in the next phase. But with that, Mr. Zion, are you ready to proceed?
We are, Your Honor.
Ms. Grubb, I'm sorry.
Yes, thank you.
Okay, before you get started there, if you all are comfortable, you can.
As far as the masks.
As far as the mask, because you're in your own little cubicle there. Okay? I want you comfortable. Now, when you go, you got to put it back on. Okay? Sorry about that, Ms. Grubb. You may proceed.
Thank you, Your Honor, defense team, colleagues, and members of the jury. Good morning. My name is Janet Grubb. It is my pleasure to finally address you this morning. Mount Carmel West Hospital was an unlikely crime scene. The hospital formally opened in 1886, having secured the services of the Sisters of the Holy Cross. The training school for nurses was opened in 1903. The first graduates received their diplomas in 1906. 8 sisters were included in the class. It still exists today and is now the Mount Carmel College of Nursing. This location was known as Mount Carmel West. It was one of the 4 facilities that comprise the Mount Carmel Health Systems. Mount Carmel West moved in 2019 and is now known as Carmel Grove City. Mount Carmel Health System is the second largest healthcare system in Central Ohio. Our evidence will show that they employ approximately 9,000 total employees and over 2,000 doctors in their numerous outpatient facilities and their 4 hospitals. Mount Carmel East near Reynoldsburg, Mount Carmel Grove City in Grove City, Mount Carmel St. Anne's in Westerville, and Mount Carmel New Albany Surgical Hospital in New Albany comprises the system. Mount Carmel Health is owned by Trinity Health, a Michigan corporation. The Hospital of Mount Carmel West occupied a unique position in the areas of west and southwest of downtown Columbus, including Grove City and other small towns in the region. The hospital's ethic and profile fits the patients it served and the people who worked there. Hardworking, family-oriented, religious, trusting, generous. If you grew up in this area, chances are you stayed there. This is a painful family affair with no end of pain on so many levels. Our evidence will further show the pain relates certainly to the loss of the lives, who we will prove were murdered by the defendant, but also extends to the loss of careers, jobs, friendship, financial security, and trust in healthcare professionals and institutions. The evidence will reveal that this case unfolded one surprising step after another. The pharmacy staff at Mount Carmel West became alarmed about certain drugs ordered and administered at the direction of William Husel. Their concerns were escalated to hospital administrators, other physicians, and ultimately to the top medical officer at Trinity Health. The setting for the use of these drugs was the night intensive care unit at Mount Carmel West. These medications are powerful, potent opiates, benzodiazepines, and paralytics employed in the treatment of seriously ill individuals who are placed on ventilators to help sustain their lives. The evidence will show that these drugs were prescribed in massive doses in combination with one another. During the ongoing COVID-19 epidemic, we became aware of the use of ventilators to care for people needing life support. Being on a ventilator was not and is not a death sentence. People do come off of them and live. Unfortunately, that was not the case for the victims in this prosecution. The medical testimony in our case will demonstrate that when an individual is they should be highly expertly managed to determine their physical state and to preserve life. This is a highly dramatic event in a person or a person's loved one's life. There are no guarantees when you go on a ventilator. If you are conscious going on a ventilator, you must know that you may never wake up alive again. This is the state in which we find our victims. Our evidence will establish that many of our victims were elderly. Some were younger than 40. They had multiple medical conditions. Many were extremely serious. They had families, lives, and people who cared about them. They went to the hospital for help. Several of them were not sick enough that they were destined to die during their hospitalization. They all had one thing in common. William Husel was the nighttime ICU physician who ordered lethal levels of drugs or a combination of drugs with their removal from a ventilator after their loved ones made the excruciating decision to withdraw care and remove them. How did this happen? These drugs were obtained through Mount Carmel West's pharmacy system from a drug dispensing machine known as a Pyxis machine. They were located in the ICU. Often, Husel ordered drugs verbally and overrode the hospital's procedures for pharmacy review. At the time of the majority of these cases, in order to be within hospital policy for an override, it would either need to be an emergency situation, which our evidence will show is typically not the situation with an extubation, or the drugs administration himself. These drugs were removed in massive amounts, well exceeding reasonable dosing for the procedure of removing ventilator support. Physicians trained in their use will testify that the doses used were at levels that could not be supported by the patient's medical histories or current circumstances. They will further testify that the drugs ordered by the defendant caused the death of the victims as alleged in the indictment. The nighttime West did not have a dedicated pharmacist. Two pharmacists served the entire hospital during the night shift. If a physician ordered opiates or benzodiazepines on override from the Pyxis machine and the drug was administered, there was never pharmacy review for appropriate use. In the case of defendants' dosing regimens, this practice of overprescribing fentanyl and other drugs continued without oversight for years. You will hear how well-respected defendant was at Mount Carmel West. The nurses, pharmacists, and other doctors liked him and thought he was a good doctor. He was attentive to the patients and willing to share knowledge. Doctor of the Year honors were bestowed on the defendant during one of his first few years at the hospital. He was well known for his training at the Cleveland Clinic in anesthesiology and critical care. He was and is, in many cases, still highly regarded by many of the young nurses who worked on the ICU at night. Many new nursing school graduates, ambitious, bright, and in the defendant's thrall. They looked up to him, trusted him, and had extreme difficulty in questioning his orders or methods. His ability to verbally provide alleged reasons for his dosing, coupled with his training as an anesthesiologist, caused the nurses and pharmacists to accept his practices as appropriate and even essential. Our dispute his reasoning through our experts' explanation of the proper standards of medical care. Members of the jury, this case is a mountain of evidence, information, technical data, and criminality against 14 innocent and seriously ill individuals. Our evidence will show that this case is not about the following. It is not about fentanyl as a drug of abuse. It is not about drug diversion from a pharmacy. It is not about Medicaid fraud. It is not about a hospital system desperate to survive. It is not about taking comfort care from the dying or wanting people to die in pain. It is not about assisted suicide. It is not about criminal behavior of anyone other than the accused, William Husel. It is not about civil judgment for or against anyone involved in this case. It is not about wrongdoing by Mount Carmel as an institution, its employees, including administration, nurses, and pharmacists. This case will touch upon the following concepts: medical malpractice or negligence, group dynamics in the medical profession, financial pressures in the U.S. medical system, system failures in large institutions, the culture in the ICU at Mount Carmel West, the assumption in a medical setting of good intentions, the Catholic Church principles of sanctity of life and care for the sick, needy, and/or elderly. Our evidence will demonstrate that this case is about the following: standards of medical care, the rights of the critically ill and their families, including right to self-determination, right to the truth, and right to sit vigil over the dying as they progress towards the time of their natural death. It is also about the properties and interactions of powerful drugs, including opiates, benzodiazepines, and paralytics. We will demonstrate that our case is also about the science of maintaining the critically ill in an ICU setting, including appropriate pain management as used by other physicians at the hospital. It is about the science of managing pain within the palliative withdrawal of care, including removing a patient from a ventilator and controlling their pain and or agitation upon withdrawal of care. This science includes concepts embodied in a set of orders maintained at the hospital and used by other ICU and palliative care physicians. Similar dosing practices comprise the standard of care in the medical profession. You will hear how these medication regimens used by other physicians involve opiates and benzodiazepines in a much lower equivalent doses. Mount Carmel's palliative ventilator withdrawal order set, in existence for all of our 14 cases, but the first, recommended a pre-dose of 5 to 10 milligrams of morphine before extubation and adjusted amounts after extubation to keep the patient comfortable. It also suggested 2 milligrams of Versed, a benzodiazepine for agitation or anxiety. Oxygen therapy was also suggested. The conversion of morphine to fentanyl is roughly 10 to 1. Translated into fentanyl, the pre-dose would be 50 to 100 micrograms. Defendant administered 600 to 2,000 micrograms at one time. The defendant's pre-doses were 6 to 10 to 20 times the recommended dose of fentanyl, depending upon the patient, and 3 to 5 times the dose of benzodiazepines. The state's evidence will further show that opiates and benzodiazepines have a synergistic effect and create a medication multiplier, not a simple 1 + 1 = 2. This combination of drugs creates an overwhelming risk of respiratory depression. Our evidence will also show that after an extubation, the standard of care involves maintaining a caring presence at the patient's bedside, monitoring pain, and ongoing titration or adjustment of the medications to keep the person in a state of comfort, allowing them to pass naturally. This is in direct contrast with the defendant's practice of administering an enormous shot in a short period of time and calling it a day. Our evidence will also show that Mount Carmel Hospital System ran an internal audit, and the defendant was the only physician in the entire hospital system using fentanyl and benzodiazepines in these grossly inflated doses for this purpose. Ultimately, our case is about the fact that William Husel caused the death of our 14 victims. You will hear and see for yourselves the way this case was referred to the Columbus Police Cold Case Homicide Squad and Franklin County Prosecutor Ron O'Brien. Police involvement came on the heels of the Mount Carmel Hospital internal investigation or review of the defendant's dosing practices. The hospital's review was separate from the police investigation and resulted in the termination of Husel, pharmacy staff, and nurses. These concerns were eventually directed to his practice when he ordered the removal of people from ventilators, supporting their breathing, along with other life-preserving therapies. These homicides are loosely classified as cold cases. The reasons for that are the period of time between the death and the suspicion of foul play. Most of William Husel's victims died without any question regarding the reason for their demise. Fortunately, we have the actual medical records for each of the deceased. The records demonstrate as much relevant medical information as possible, short of an actual autopsy. Based on the drugs administered involved in these cases, the evidence of death and why they died will be clearly proven by the state's evidence. The state of Ohio will present a number of mainstream medical experts. All of them possess special certification in their medical fields. Many of them publish in their fields and teach us physicians in order to educate the next generation of practitioners. Years of relevant experience and will testify that William Husel's dosing practices were unwarranted and unprecedented. The state's experts will establish that our victims' medical situations fall into several categories. Many were not in a position to feel discomfort, pain, or agitation. Nonetheless, they were administered large doses of fentanyl or fentanyl and benzodiazepines without being medically indicated. Several of our victims should have been maintained on life support for a longer period in order to eliminate all possibility of hope and to be observed. Others of our victims could have survived with appropriate care and informed decision-making by families. In this case, we will demonstrate that because the defendant was not acting in good faith and used drugs wildly excessive for the needs of his patients, this defense does not apply. We will present testimony from numerous physicians, nurses, and pharmacists employed at Mount Carmel West at the time of the murders. These individuals played a part in the events detailed in this case. They are not accused of criminal conduct. In each instance, the defendant ordered the administration of the lethal doses of medication. Our evidence will establish William Husel's actions caused the death of these patients. As we previously discussed, these people were quite ill and receiving care in an intensive care unit. The state's experts will establish that not all of these people were terminally ill on the date of their death, or at all during their hospitalization. We will prove that William Husel's acts were a cause of their individual deaths. We will prove through our evidence, all consistent with Ohio law, that the defendant is responsible for all of these deaths as the natural consequences of his unlawful acts, even though the victims had serious illnesses. The state does not need to prove the defendant's motive. However, his purpose will be very clear. The state's witnesses will demonstrate through actual, detailed medical testimony that given the medical status, ages, and previous course of treatment of his patients, Dr. Husel knew exactly the natural result of his purposeful acts, and that therefore he possessed the intent to end the lives of 14 innocent individuals. As William Husel possessed advanced training in the use of the drugs he in the lives of his patients, the state will show that his actions were not mere accidental or medical negligence. They were, in fact, murder. The drugs used and the size of doses used in conjunction with other powerful drugs were important elements in determining his intent. But other behaviors were important too. These behaviors include what events were treated as emergencies or urgent, the timing of these procedures, the time of day of these procedures, how consent to proceed to comfort care was obtained and from whom, Other factors included the actual medical condition of the people that were murdered, and that some of the murdered could have left the hospital to go home or to hospice. As previously discussed, this case had many heartbreaking aspects, none more so than the loss of the patients of William Husel listed in the indictment. These people had names and families. Joanne Belisari, Ryan Hayes, Beverly Schertzinger, Danny Millette,
Our youngest daughter, because we have
Francis Burke,
3 girls, she's a senior, is
Brandy McDonald,
committed to Ohio Wesleyan.
Jeremiah Hodge.
Private liberal arts school. And I'm excited because that's where I went, but I didn't influence her. She wanted to go there. So it was, it's fun. It's always good to go back and visit, not too far away either. So it's such a cool experience. So, yeah. In hindsight, I was going to pick the following Saturday, but you never really know the weather.
What does she play?
Well, actually, she plays lacrosse, but I don't think she's going to play it in college. But it's Iowa Wesleyan in Delaware, Ohio. So, fairly well known. Good. I'm yeah. I went there many years ago. Graduated in '86. They also do a little extra for you if you're a legacy as far as scholarships. Otherwise, it's $63,000.
I go to Capital Law, so
yeah.
I know, yeah. Lots of student loans, they're fun. Yeah.
I think I am student loan free.
How did you manage that? Scholars, baby, scholars.
Yeah. I had nurse school, my first year of law school, and then that summer I negotiated.
Would you go back in time? We're dealing with a technical difficulty in maybe a couple minutes.
Yeah. What helps in your Catholic in every class?
They kind of expect that when I talk in about 10 minutes still.
Didn't help either that I was in the swing with the dean for rarely drinking wine, and when I got the email saying we're going to pull the Xbox, I'm like, I'm like, you got 2 Xboxes here. And he's like, don't worry about it. By the time we get back, it'll be fixed. I'm like, well, I need to know now because I need to like transfer. And literally by the next day, I'm like, that's fine.
It was like about 60 grand a year, but I did the summer, so more like 70. And I got like 20 grand in scholarships. I also wanted, so I don't have the time to offer like options. But
they wanted to advertise afterwards to the whole market. I was like, yeah, that's a hard one.
That's hard. It's good. About to be good time. Might be able to talk my buddy into letting me take the vote out. Hey, you know the rule. You know what's better than the vote? Everybody that votes the vote. That's the rule. Please tell me why they're bringing this back up.
I always like,
What the
put them on there. But those are in a very particular order. Previous ones. This paper. Yeah.
Is it dead there, Matt?
What's that?
Is it dead?
No, it's on. I just have no idea how it works. The phone never shows me.
Well, he's hit the camera first, I think.
What about the camera?
It's hooked into the camera, I believe.
No, it should be showing the same thing these are.
Okay. Why don't you put on your PowerPoint for a second, see if it goes on the screen, please? Turn on your PowerPoint to see if it's showing on the screen.
It's on.
Huh?
This is the first slide. Those blank pages that you see, those lines.
I understand that. I just want to make sure that that's what they're seeing over there. Are you seeing 3 white lines?
No, they have like a screensaver here on it. This monitor works. That screen works. That doesn't.
Yeah. No, I tried. I did not.
touch the feed is on.
Amy, did you guys show them all the magnets?
Magnets.
No, we didn't see any of the magnets.
They're everywhere.
I assume they're pictures of people.
Just pictures of people with
I
the
asked you specifically what those were, and I said, is there anything underneath there? And you said no. Was that a joke?
No.
Is there something underneath this?
No.
That's right.
It's a magnetic board.
I apologize. I thought you said no.
Well, I'll put it this way. They're so similar to the pictures you use, I actually asked my tech guy if you stole our pictures, because that's how close they were to.
Okay, no. I thought you had something underneath this thing,
No.
like he did in the beginning when he's pulling things off.
It's a
and I said-
magnetic strip.
No.
Oh, okay.
See?
Well, I haven't seen these either.
Have you guys watched the videos?
We're watching the last one, which is
These are the pictures you guys sent us.
That is going on 2 minutes long.
See, that one I was pretty sure we both had the same one. And that one.
Mm-hmm.
And that one.
Yeah, I have no objection to any of that.
They're all just literally pictures from the testimony.
Okay. Trust but verify. Because I was just told some things about the video clips, and there's Casablanca in there.
That's before my time. I really like Casablanca.
It's a good movie. You should watch it.
Well,
Well, there you go. Look at you.
I got time for this experience once I was working. And it's just the family members. Same thing.
Okay, spent a lot of money for all this to go back to the court.
Well, we can have the, what was it, the drug dealers fund?
What's that?
What was it, the drug dealers fund or something you guys used?
No, just use people's money.
Yeah. Taxes.
What are these?
Same ones we saw this morning. I promise I didn't produce those and not the.
Anything around, just checking out. Right. All right, Judge, we've had a chance to look at this stuff.
Okay. As soon as my call report is ready, we'll go back on. Okay, Mr. Zion, you've had an opportunity to review. What's your commentary now?
Well, there appears to be a clip from Casablanca in there. We would object to that. There appears to be at the end a clip of a desert escape, which is a movie. Several minutes of that. We would object to that. And then there is a clip of the testimony of Ms. Phoenix's daughter, and they labeled it witness or evidence tampering, which we believe is entirely inappropriate.
Okay.
I'll take down evidence tampering if it.
Yeah, but I don't mind the clip. It's just a reiteration. Anything on the long clip?
Which long clip, Judge?
There was one that was supposedly 3 minutes long. That was a combination of the nurses.
Yeah, it's 4 minutes, and there's multiple nurses on that one, but there wasn't anything.
Okay.
I'm willing to cut that in half and stop it halfway through.
No, I don't. it's no different than putting it up on the screen. It does have thing, as long as you put the proviso in, going in, that it's their collective memory that matters. This is to aid and assist you. That's it. We move on. Casablanca is a great movie, but
It's an analogy that I'm going to use.
okay.
It's an argument. I don't.
Well, how do I get out of avoiding 106 and having to show the whole movie? It's a great movie. It's one of my faves.
It's just an analogy, Judge. It's 20 seconds long.
Fair enough. And the sunset? We all love a good sunset.
That's another analogy that I use.
Okay, I'll note the state's objections are permitted as long as the proviso is put in. If you go into it and you start playing without the proviso, I will stop you, make the proviso, and then let you go on.
Yes, sir.
Okay? Anything else before we get started? Okay. I don't have any idea what Matt did over there. Is that screen working now? No? I apologize, folks. That one's working?
Yeah, I'm working. Can we just pull the angle a little bit? Yeah.
This is what happens when Paul retires mid-trial.
It's a Zoom. It's all the Zoom rooms.
Yeah, I wrote it. If it has anything to do with settings. I don't know. They made those improvements. Supposedly it took a whole day doing it, and it still doesn't seem to always plug in correctly. Did you guys take camera shots of those in case? Because you put them up in front of the jury doesn't mean he ain't going to go after them. I would make, if you got an exhibit you're going to use that's demonstrative,
Yes.
just for your own sake, make a camera shot before you go.
Absolutely.
Okay? Because as soon as you put it up, it's fair game.
Understood.
I don't think it's going to be resolved.
Okay, let's bring the jury then.
We're behind when this whole tricky and
I apologize, people in the audience. This is a software issue.
yeah, it happened.
We can't get it resolved today. We'll try to get it resolved in the evening. Yeah, let's roll.
wrong. It's bottom right. You gotta sit. I think it's at its highest. Sure. Yep. Yeah. Thank you.
They're one of the happiest juries I've ever seen. All rise.
Thank you. Please be seated.
Ladies and gentlemen of the jury, I hope you had a wonderful lunch. Mr. Baez, are you ready to proceed?
Yes, sir.
Go ahead.
Please support. Good afternoon, ladies and gentlemen. Welcome back. First off, I too want to join Mr. Zeiner in thanking you for your service in this case. Both sides know it was no small task. And it's interesting because I've often said for a long time that jury duty is kind of like the worst job in the world. You have to sit here for 8 hours a day. And sometimes when we go off and speak in secret behind your back, it's not really behind your back, you have to sit next to someone you don't know. You're complete strangers, and the only thing you have in common, you can't talk about. So it's understandable the sacrifice that you guys have made. And, you know, justice is a lot like making sausage. Once you see it, you never want to eat it again. It's kind of like that. It's not a scripted event. And things don't always go smoothly, especially when two sides see things very differently. So for that reason, it's this part of our presentation is a little different, because I think there's going to be times during the case where you saw things come out and you weren't really sure what's the point of that, or what are they trying to show us? I don't get it. And as artfully as we think we are as lawyers, it just doesn't make sense. Sometimes we have to help you connect the dots and show you what it is that we're referring to, what certain pieces of evidence came in, and I plan on doing that this afternoon. Over one of the weekends, I was sitting here thinking, how do I want to explain some of the constitutional principles to you? And I sat here and I sat at home and I thought different ways. And it's unique because the world is not the same as it was a couple of years ago. I think we all agree with that. Things have changed. And we realize just how divided a nation we really are. How different we are. How different we see the world. And fortunately for us, the constitutional rights that we have as citizens have never been more so important than they are today. Never. And when you think of things, you think of that we all, as citizens, we all have rights. And it's interesting, when you look at rights, you say, well, do you really have rights? I mean, half this trial, you had to wear a mask before you came in the building. Some of us have had to get vaccinated. There's all different types of things that come into play. And you might say to yourself, well, there's the Bill of Rights. The Bill of Rights is where I get my rights from. But if you read the Bill of Rights as I do, they're not really rights at all. The government can pass no law that tells you what kind of religion you should practice. You have the right against the government from having unreasonable search and seizures. You have the government cannot restrict your speech in certain circumstances. So they're not necessarily rights as much as they are to the government. Wait, you cannot do this. It is a restriction on the government more so than it is an individual right that we carry around with us every day. And that's where these concepts come from. Concepts of beyond reasonable doubt, concept on not having a burden when accused of a crime. But what makes it real and what brings it to life are you and you and you. This is the unique opportunity where you are serving to maintain those rights, to make sure that it's not just verbiage, that this is something real, for which we have all made sacrifices, and those who came before us made the ultimate sacrifices on the altar of freedom, where we're equally treated, all of us. And a citizen, whether you're rich, you're poor, you're white, you're black, Puerto Rican, what your sexual preference is, whatever it is, that we all be treated the same, and that we have equal protection under the law. I don't say these words lightly. I don't use them lightly, because in this scenario, where you have all put your lives on hold to ensure that our rights are upheld, no matter what governmental agency chooses to do, whatever the system is, the ultimate decision will lie with all of you. But it doesn't mean anything if you can't hold on to those rights. And when I refer to the beyond a reasonable doubt, it's a brilliant concept in one way too, in another way as well. It takes into account our biases because it sets that bar so high. You may walk into a room and not like a certain person, but you all swore to take, and you took an oath to say, I'm going to hold the government to this burden, which is beyond and to the exclusion of every reasonable doubt. Now, I heard Mr. Stein this morning talk about circumstantial evidence versus direct evidence that's just as strong. Yes, but you have to have evidence. And there are numerous times in this case where you've been asked to take a leap of faith, to find things that aren't necessarily there or might be there. Well, that's not beyond a reasonable doubt. And that's not fulfilling your burden. And in that essence, there's something else. Each one of us has a role, as you've heard. The judge will instruct you on the law. It is what the judge says is the law, and the buck stops there. I am Dr. William Husel's voice in court, as well as Ms. Menashe. We bear no bones about that. And we do so proudly. In addition to that, the state of Ohio has a burden, they have a job, and they have a duty. And that duty is to be ministers of justice. That does not include putting forward before you anything that is not true, misleading, or just not a fact. Each and every one of us deserves to be able to go through the process of justice without that ever happening. And I can tell you, throughout this case, it was an exhausting effort to go and weed through all of these things and point out to you multiple times where we thought you were being misled. I don't think we caught every single thing. We are far from perfect. And as I stand here before you, my heart is beating quickly because I'm afraid throughout the time I have to speak with you this afternoon that I'm going to forget something and let him down. That there are so many things to point out to you where there's reasonable doubt, no doubt at all, no evidence at all, things that were fed to you that were just not true, that are completely contradicted by the records. And it's not about making stuff up. That's not what this process is for. It's ever so important for you to hold on to these principles for the mere fact that it is one of the most important decisions you will make in your life. On top of that, in our system of justice, it's true that you're not to consider punishment. That's what makes your decision that much more important. Our system says that while you are going to make an important decision, you are not to consider the consequences of that decision. So it's important with the role that you have in this process that you hold them to their burden and that you ensure that what you do and the decisions you make are yours. You have every right to your convictions. And while you're supposed to, throughout the deliberation, listen to your fellow jurors, if it's your belief, you hold on to that because that is what we have all paid for. That's the sacrifice you made in front of the altar of freedom and all of those who came before you. And nothing could be more important than to remember that throughout this entire process. Now, I want to go through some of the instructions, and I don't want to take up too much of that time because there's just so much to cover with you in such a short period of time. But some of the instructions that I think you'll utilize during your deliberations are these. Is that the first? No, we went over. We're going to go back. First. Proof of motive. Now, you heard a lot during jury selection that they don't have to prove motive. And that's true. But there's a portion in the instructions that are important. And that is, proof of motive is not required, but the presence or absence of motive is one of the circumstances bearing upon purpose, which is the intent. I believe it was Aristotle who once said, all that is done with an eye towards something else. Simply put, to understand the deed, you have to understand the motive. Why? And all of you know that there was not one shred of evidence submitted to you as to why we're all here. Why will this man risk his family, his career, 17 years of trying to be a doctor, every single thing he has worked for, to hasten someone's death or to kill them? Specifically to kill them. Now you have a tough job because this is such a unique case. It's a novel prosecution. The mere fact of taking someone off life support, as you've all learned, is hastening their death. And not a single person has testified to you as to how long they would have lived without the fentanyl, or the Dilaudid, per se. How can you say it's going to hasten someone's death if you don't know how long they had to begin with? No one testified to that. That's asking you to take a leap of faith and they didn't provide that to you. And there's so much more, so much more. As it relates to purpose, I don't like this word purpose because it kind of is a little misleading. But simply put, purpose and intent mean the same thing. I think intent is a little more helpful in remembering it. What did he intend on doing? Where is it that he intended on killing people? Where did you hear that evidence? Now, there's a lot of innuendos and a lot of taking certain facts and trying to substitute what intent actually is. But the reality is that no, there wasn't anything of intent. Now, the prosecution earlier said, well, you can't get in someone's head. True, you can't. But there are lots of other things that you could look towards that would be very helpful in that regard. And he also said that's it's not something unless someone expresses it. And he did this with his hands. Well, we're going to get into that a little bit later, but I want you to remember that. And all of these records, every single thing here, a majority of all of this is all we have. And there's numerous reasons why that's all we have. And I'm going to get into that in a minute. But there's numerous reasons that this is all we have. And what the state is going to ask you to do again is take that leap of faith. Go against common sense. You all know common sense tells you that he's got no reason, no motive to harm these people. He had no motive to harm his patients. To the contrary, you heard evidence after witness telling you about how this man saved lives, how this man was always accessible, how this man was a teacher of nurses and other individuals at the ICU. They're trying to use that against him. Like it's a bad thing to help your team be smarter, better, operate in a certain way that helps the overall patients. Why is that a bad thing? How is that a bad thing? It's a bad thing if you want to prosecute someone for this. It's a bad thing in every other context of a prosecution, but not in the reality for which we live in. Now, there was the issue of cause, and I heard that analogy of shooting someone as they're falling down. None of that is relevant here. But one part in the causation instruction says this: and cause is an essential element of the offense of murder. Cause is an act which in a natural and continuous sequence directly produces the death. But here's the kicker: and without which it would not have occurred. They didn't tell you how long these folks, or show you any evidence. In fact, every expert said, I can't tell you. So without the fentanyl or the doses, how long would they have lived? How did we hasten it? Without which would not have occurred? No. It was an amazing thing to watch Dr. Shriver get up here and tell you all that all of these patients could have lived. When in fact the state's own prior expert said nothing of the kind, said only 4 of them could have potentially lived. They're contradicting themselves. They can't even agree amongst themselves. So, what we did, without a burden, we called Dr. Zimmerman. One of his most memorable quotes to me is, the easiest pain to bear is someone else's. Nothing could be truer. I think that resonates with a lot of people, including doctors. And they wanted to argue to you that he was general in nature. And I think Dr. Zivit's testimony, I'm bringing him up first because it was the most recent. And I think it's important to just touch on this fact. Then I'm going to start at the beginning of this case and how it started. But yes, it's not our burden to, after 2 months of sitting here, day in and day out, and hearing how sick these folks were, how many times they died. They died. How many things William Husel did to save them. You had heard it plenty of times. I guess I could have had him here for 2 days like Dr. Schreiber and gone through each and everything. But I know, I'm watching you and knowing that you're paying attention to the multiple times that they've done that. And here's the kicker. We put him up there. He told you he reviewed all of the medical records, including the dose amounts, and he found that they died from their diseases. And then it was open season for them. They could have did like we did with each and every doctor and cross-examined him on each and every single patient as to where he was wrong in his opinions. But it went unchallenged. His opinion went unchallenged and not cross-examined on one single patient. Not on one. He told you that morphine and fentanyl are two different drugs, two different things. And this was important for you to know because there's been tons of evidence, misleading evidence, that's been submitted to you that it's equal to fentanyl. No, they're two different drugs. You heard Dr. Zivit tell you cannot give high doses of morphine. It's a natural opioid. Fentanyl is a synthetic one which was created to give higher doses. The only reason you would do the comparison is to determine if someone's naive, the tolerance levels. And isn't it interesting that in 3 hours this morning, not one mention was made of any of the tolerance of these patients. They're all through these records. Both their own medications and the medications they received at the hospital, they're there. It's a critical part of this case. But that's not shared with you. That's not pointed out to you. And the fact that morphine is different than fentanyl went unchallenged. And then he explained the differences between an internal medicine doctor and an anesthesiologist. Where and how you were trained is a significant fact. We hear of second opinions all the time. Even doctors who are similarly trained can have difference of opinions. They can treat you differently. And this is something we ask all the doctors in this case, is how is it that we're trained at the same place, but yet we could see completely differently as to how this patient should be treated. There's, I guess, a third opinion, too, which is the state of Ohio, who, despite the fact that there are no maximum doses, that fact went uncontroverted, unchallenged. There are no maximum doses of fentanyl. Why is that? Did they forget? Nobody forgot that opioids are an issue in this country. Nobody forgot any of that, but when it comes to palliative care, there are no maximum ranges. It's for the doctor at bedside to make that determination. That's it. And they want to make the comparison to street fentanyl. Nothing could be different. We don't know what's in that stuff. We've seen some users and what they find in their fentanyl, carfentanil, morphine, alcohol, cocaine. But who knows what they're taking there? Who knows where that's coming from? It's very different. I submit to you, that's probably why this case was brought in the first place. Everybody knows the negative connotation, especially here. Especially here. Everybody probably has someone close to them or knows someone who has someone close to them who's passed. And it's not pretty. But it's easy to drop that F-bomb, fentanyl, and make that argument when you don't have evidence. Make that argument. Yeah, they challenged him on a bachelor degree. He went to Canada. There's no direct correlation between what doctor lies about having a bachelor's degree. How ridiculous is that? That's what they impeached him on. Rather than helping you with the patients, they're rather talking about bachelor's degrees, lower degrees, and what was unique about Dr. Zivit, very unique, is that he trained at the same place as Dr. Husel. They didn't know each other at the Cleveland Clinic. He came much sooner. It was the director of the Cleveland Clinic who reached out to him and asked him to get involved. And the man did so. And he put his money where his mouth is. Dr. Schreiber made $7,000 before he even spoke with one patient. Dr. Zivit, as you heard, is against euthanasia. And he's also uniquely researching an area that is very unique. This is the one guy who researches how to use medications, how they actually kill people in the death penalty. That's another important factor that made him a unique, highly qualified individual from Emory University, one of the finest medical institutions in the world. This is no guy from Tampa, from a Catholic hospital in Tampa, who may or may not be the director of anesthesiology. This is not another doctor from Tennessee who's a devout Catholic and is baptizing people in the ICU. Now, I don't know where or how religion found its way into this case, but it really has no place. And this is not an attack on Catholics. I'm not going to be a Catholic myself. But this has no place in this case. But somehow it kept creeping in. Somehow it kept coming in. And in fact, this morning it was mentioned people go to a Catholic hospital because they want the Catholic treatment. Well, if that's the case, and the privilege of suffering is an issue, they should have made that a lot more clear with their policies. Another thing that is uncontroverted in this case. No policies at Mount Carmel, no upper limits. You have your basis of your training. And Dr. Zivit told you, how much is enough? Whatever it takes to get that patient there. And what's unique about this, ladies and gentlemen, is you saw throughout the case, there are multiple patients that did get these high doses, but it still wasn't enough. It still wasn't enough. And then you have a patient like Sandra Castle, who they were utilizing the order sets, and it wasn't working. She was suffering. She was in pain. She was suffering a bad death for hours at a time. Hours. Even after having maxed out for amount of morphine, she was still in pain. You remember Nurse Lachard, who had only worked 6 shifts, has no allegiance to William, wasn't enthralled by him and his charm, and still works at Mount Carmel. Tell you, I could hear her at the other end of the ICU. I saw a tear coming down her eye. She was agonally breathing. I'm telling you, agonal breathing is not painful. Agonal comes from the word agony. And to try and mislead you down that path is just another series of things that, quite frankly, if you can't trust the messenger, you can't trust the message. And you should not be misled or lied to once. I owe you an apology. Because at some place in the middle of this trial, I told you, or I asked Dr. Roth about Googling something where I did not see an article. That was my mistake. And I submit to you that's the only thing I can think of where perhaps I asked a question that might have been a little misleading. Everything I told you in opening statements, I meant it. Everything that we asked about and we showed you, we tried to bring you the whole picture. And don't you think, maybe it's just me, but don't you think that we want to hold our government to a little bit of a higher standard than to mislead us, than to outright telling us falsehoods? Let me show you one. And and this is another reason why I put Dr. Zivit first. You remember, during the cross-examination of Dr. Zivit, well, they tried to talk to him about giving doses to healthy individuals in a death penalty case versus someone in a terminal extubation, which we all learned is different. But in the questioning, he was asked a hypothetical. You all remember, I was here, I tried to go after that hypothetically and have the records. Well, now I can show them to you. A hypothetical posed to Dr. Zivit was, with a patient who is being told they're brain dead and not being able to, being misled by saying they're brain dead, but so that they can have their organs harvested. That was referring to Ryan Hayes. Now, in this note, progress note, you'll see the decision of the conversation was had during the day shift. And here it says, patient is not brain dead. It's the second sentence in the middle there. Patient is not brain dead as he does breathe over the vent. Given the extent of his end of organ damage with severe derangements in his kidney and liver function, patient is not a candidate for DCD and is not a loop patient. Plans for palliative extubation this evening, once patient's son is available to get into town. He's driving here from North Carolina. He wasn't misled by Dr. Husel. The conversation was had by the day shift. It wasn't an emergency situation. They were waiting for the son. He wasn't brain dead. It's all over the records. You notice that they didn't ask a single nurse about any of these brain dead comments. Why is that? Why do you think they didn't ask a single nurse? Did you hear Dr. Husel tell Ryan Hayes that he's brain dead? Troy Allison that they're brain dead? Not a single one. I submit to you, ladies and gentlemen, the reason for that. They didn't like the answer they were going to get. It's okay to lie to you. It's okay to mislead you. As long as we win this case.
Objection, Your Honor.
Sustained. Let's rephrase.
It's okay to mislead you.
Objection, Your Honor.
Continue on with your comment.
You have a case of 14 patients, but each and every one of these are important, life-changing decisions. Now, why are you being asked, or why is a question being posed this way to this witness? Only to mislead you. Not to get any fact that will help you in your deliberations. Will asking that question help you in any way, shape, or form? No. It's because there's 14, you're not going to remember the specifics of each and every one. This whole thing mesh a little. It was an exhausting process to point this out to you folks. And one that we tried our best to do. Now, first off, it's interesting. During opening statements, I mentioned the pharmacy, and I told you about the reason how all this got started. Let me start there. And it's a fascinating thing here, because this case started a certain way, and it had absolutely nothing to do with the doses. And I'm going to show you where we kind of connected it a little bit for you. We tried our best. They started off with Talon Schroyer. Let me first show you all of the witnesses that testified in relation to the pharmacy. Now, I thought I might have mentioned where was the pharmacy of this, but I really don't recall. But I know this, I didn't make a theme, but we kept hearing, "Where's pharmacy? Where's pharmacy?" Well, ladies and gentlemen, the gentleman does protest too much. And just like that overreaction, I will tell you where the pharmacy was, because, in fact, it's still a mystery where the pharmacy was. This gentleman was the director of the pharmacy, and he talked about how they lost their funding. Well, they were placed in immediate jeopardy for their funding, and he expressed the importance of controlling controlled substances. This was the manager of the ICU, Mr. Randy Miles, who basically talked about what happened once the voice report was entered into. Gregory Dresbach was, I guess, a mentor to Talon Schroyer. They're kind of like partners. They worked together at night, and you heard them both testify, and they were pretty much on the same page. But the issue that we have here is there are far more pharmacists in this case than just this man and this man. And you heard, even up till today, the prosecution tell you that the pharmacy is unaware of these high doses. Remember that? Unaware. Well, that's not true. Look at this. Joanne Balisari, the nurse, and the nurse is Trisha Sauer, the pharmacist, Nathan Cockeiser. Where's pharmacy? Well, where's Mr. Cockeiser? He's not only the pharmacist for one patient, but he's also the patient. He was also for one of Ryan Hayes' doses. Where's Mr. Cockeiser?
Your Honor, I would object. It's inappropriate under the rules of evidence to comment on people on witnesses list that did not testify.
Sustained, let's rephrase.
Sure. You also have other pharmacists that were there that are parts of these doses, folks. Multiple patients. These are multiple counts. But you know what it is? It's about throwing it all against the wall and seeing what sticks. Because all it takes is one. All it takes is one murder case, and that's it. But Mr. Schroyer was aware of these dose amounts, because if you see, Mr. Schroyer approved Bonnie Austin and also Brandy McDonald previously. Brandy McDonald and then Bonnie Austin. What is he talking about? That's not true. And the same with Mr. Dresbach. Dresbach was involved with Ryan Hayes. Now, you also have in evidence, ladies and gentlemen, and I don't understand why you're being told this information. State's Exhibit 20D is an email dated on Thursday, June 14, 2018, 6 months before any of this happens. 4 months before any of this happens. Talking about, remember the ICU, some of the high doses of ketamine and fentanyl from different providers at the ICU. And you heard every single nurse tell you, everybody knew about these doses, including the pharmacy. And that many times they would call the pharmacy, and that's not reflected on the records. Many times the pharmacy would talk to them. That's not in the records. Just briefly on the records, these are only worth so much. Because we heard of back charting, we heard of how busy things are, and we also heard they weren't trained in charting, and some are better note takers than others. There's a whole slew of things, especially when it comes to the times, when they're going back later and putting in times as to when something was administered or when something was done and so on and so forth. So you only have so much there. But think about this for a second. Where is pharmacy? I submit to you, they did not meet their burden at all. Only hearing from these two guys who had previously told you something? Folks, and then let's talk about how it got started, which was with Mr. Timmons. Now you may recall, and this is probably hard to do because we heard from a pharmacist early, and then much later on we heard from the nurses. But Talon Schroyer talked about how he got a call from one of the nurses, and that's what sparked all this. Now, by the way, you'll notice some of these don't have pharmacists, and that's what I mentioned to you in opening about this glitch when they do a scan to order, where sometimes it doesn't go to the pharmacy. Now that's only just a couple of these cases. The one that brought it to their attention was when Jacob Diener called and talked to Mr. Schroyer about Mr. Timmons. And I want to tell you, I'm going to show you a couple of clips, but I want you to know one thing. The official record is done by the court reporter and your memory. You are to rely on your memory and your memory alone. And this is just a demonstrative aid for you to help maybe remind you of some of the testimony that came out. Okay? So I show you this short clip based on that. Please keep that in mind.
Do you recall the medication and the amount that he gave a verbal order for?
The second time?
Yes.
It was 10 milligrams of Dilaudid and 10 milligrams of Versed. Once again, I didn't pull those medications. Earl came back with a lot of medications. He had those medications, but he also had Ativan as well. I don't know where that came in. I don't know. He must have talked with the doctor. While this was happening, and I can't remember if it was right before dose number 2 or right after dose number 2, I can't say. But I called the pharmacy, called and spoke to pharmacist Talon Schroyer, and I told Talon Schroyer, we are doing a palliative extubation on a patient that has a really big opioid tolerance. He said, wait. He pulled up the MAR on his end. I pulled it up on my end. We could see every medication that was out of the Pyxis. And I said, this is what we're doing, this is what we're giving, but I also have this Ativan and additional Versed that I don't think I need because the doctor said give him what he needs, but not too much. So I was calling to say, hey, this is what we're doing, these are the meds that I'm giving. But then also, I was also calling him to say, hey, I also don't want to be responsible for these other medications that the patient doesn't need, and the physician said he didn't need them. I don't want to be, they were handed to me, I don't want these I don't want to be responsible for these, what do I do about that? And like I said, I couldn't remember if that was before or after dose number 2, but I ended up giving the 10 milligrams of Dilaudid and 10 milligrams of Versed. I later then returned the medications that we didn't use. Give him what he needs, but not too much. There's some evidence. There's a straight up, there's some evidence of that. But that's not the testimony you got from Mr. Schroyer. Mr. Schroyer said he was shocked with these wildly excessive amounts, notwithstanding that he had previously approved 2 prior doses. Same with Mr. Dresbach. That's a severe conflict of the evidence, and that's how this case got started. The concern about things being bypassed to the pharmacy, nurses taking out meds without the pharmacy being aware, that caused a concern. The potential for diversion, all of that was an issue. That's how all of this got started. Not because he was shocked by the doses. I mean, look, he's giving prior approvals. He knows. And they want to say, oh, he called, is that an extra zero? Oh, it's for a procedure? No. It's in the records. It's for a palliative extubation. Even in this situation, Mr. Deaver's telling him, we're doing a palliative extubation with a guy with a lot of tolerance. Here's the scenario. It doesn't get any clearer than that. But he is shocked. Shocked. Reminds me of one of my favorite movies, in Casablanca, where Captain Renault is shocked that there's gambling going on in Rick's Cafe. Shocked that these doses are here. Come on. Really? Nothing could be more untrue. This was a power struggle between the pharmacy and the nurses, and it got mixed, and it got sent up the chain, and one thing happened after another. They all knew this was, every single nurse came up here and told you, everyone here knows, even nurses who have been there 20, 30 years. Everyone, including the pharmacy all knew, but none of these pharmacists came and testified. None of these pharmacists for all of these individual counts, because it only takes one. And now we have this theory of attempted murder. That's a new one. So, I guess that's a conceding on that causation didn't happen, and if you're going to assume that he intended on murdering, but it didn't actually happen, I really am still struggling with that one, so I'll save those arguments for later. But
I would object to his characterization of the instructional laws given to you.
Yeah. It was ruled on accordingly, so let's bring our comments proper.
There's no evidence to support any type of attempted murder. That's not the case that was presented to you in any way, shape, or form. And you are the ultimate deciders of that fact. So, we have this Ware's Pharmacy, where there's emails, prior records, prior patients, all of this going on. And then this man steps into the picture. Now, what was really difficult in seeing this investigation, for lack of a better word, is that it was pathetic at best. Absolutely pathetic at best. You sat through this trial and now know more about palliative extubations than you ever want to know. But I assure you, you know 10 times more, and you know 10 times more than Detective Gillette does after investigating this case. How? How does this happen? And I bring this up for this fact. Let's start with how it all started. Mount Carmel went to the state attorney's office, but it was Mount Carmel who talked to the hospital witnesses first. The critical witnesses who were actually at the bedside were spoken to first by Mount Carmel. Not once, but twice. You'll never see that. The very first people that talk to critical witnesses in a homicide or attempted murder case are always going to be the police. Because it doesn't allow them time to get their story straight. It doesn't allow other people to influence what they're going to say. It's critical. Then the police talk to them with no medical records. Can you think of anything more absurd than the fact that they never spoke to a single witness with medical records? That's unacceptable. And I'm going to tell you why. Aside from investigating crimes to find if there's a bad guy, their job is to follow the evidence. By his own words, you agree with him. You follow the evidence. And that includes evidence of innocence. Evidence that's forever lost. Forever lost. Because this man did not do his job properly. And his team, the cold case squad. Then Mount Carmel talks to the families. You heard a wide range of testimony as it related to these family members. But the very first people to talk to him was Mount Carmel. How is that possible? They were, the people who were there, how is that possible that they speak to them second? No, third, because upon actually speaking to them, a majority of them got lawyers and filed lawsuits. Well, everyone in this case filed lawsuits. And then, after that, after two different people had spoken to them first, then the police speak to them. Some of them at their lawyer's office, who now has an interest in the case. These personal injury lawyers aren't doing this for free. And these cases are still pending. And common sense tells you a conviction in this case goes a long way to ultimately settling a case, a civil case, a wrongful death case. And I submit to you that really that's where this case belongs. Because you don't have any evidence of intent to kill in either a murder or an attempted murder case. Zero in here. Zero witnesses got up on that stand and told you, Dr. Husel told me A, B, C, and D. None of that happened. And that's what I was telling you at the very beginning, folks. That's where these principles come from, beyond a reasonable doubt. That's why you have to hold on to them. They're ever so precious. You would think, this is impossible. He's here, he has to have done something, okay. No. Once you see all of the evidence unfold, you'll see that every day, across our system of justice, for one reason or another, we sometimes get it wrong. And it's a hard thing to admit you're wrong. And you have to fight it all the way to the very end. So, what are some of the pieces of evidence that this gentleman missed? Well, he doesn't even know what vasopressors are. Okay? The nurses told him the vasopressors could have potentially killed him. Well, okay, I asked him, did you research it? No. Do you know what it is? No. Did you tell anyone what it is? No. Did you follow up with anyone about what it is? No. What did he do with it? Well, I wrote it in this sheet of paper here. I don't know. I mean, what's the point of you being there if you're not going to do anything? You're a detective. Do some detecting. And he didn't do anything. Doesn't know what the doctrine of double effect is. He was told by the pharmacist, we consider the doctrine of double effect. Oh, really? Did you do anything with that information? No. Did you research it? No. Has no clue what it is. Didn't do anything with it. This man could have been protected. Their job is to protect and to serve. That includes William Husel. That's any citizen accused. You have the right to have a police do an open, fair, objective investigation, professional police That's not what this man did. Far from it. He had a whole team with him, and none of them did anything. It could be an avoidance. He wouldn't be sitting here if they had done their job right. Let me show you another example of what he could have done.
In that class, you were taught that, and I want to make sure I get this right, every patient is different. Don't be afraid to give larger doses of medication. I know it seems uncomfortable at times. Correct? You were trained in that by Mount Carmel? That sounds correct. And that training was conducted by someone from the day shift, correct?
I believe it was a nurse practitioner on the palliative care team on the day shift. That's correct.
Okay. And she, in fact, told you that I've given enough to put down an elephant. Do you recall that?
Object. Hearsay.
It's not being offered for the truth of the matter asserted, Judge. Effect on the listener. It was his training. You can answer.
My memory's a little bit fuzzy. That's certainly in previous records that I've stated that.
Okay. So you recall telling the police that that's how you were trained, correct?
I believe that's what it said in the. I believe that's what I said in the interview. That's correct.
So here you go. You have a critical witness to a potential homicide telling you, we were trained to do things this way, to give high doses. We were trained that by the day shift, that we've given enough to put down an elephant. Now, what could this detective have done? He could have gone and spoken to someone in the palliative care who actually did that training. Could have gotten a PowerPoint. You would have been able to see exactly what was spoken about, what was trained. You would have been able to see what kind of other evidence is there. That witness could have gotten up here and taken a stand and said, you know what, yes, I have given enough to put down an elephant, because when you're doing a terminal extubation, the primary concern is the patient's care. It's individualized. It's based on the patient. For someone who's opioid naive, maybe, yeah, it might harm them. But in this situation, this is exactly what we train our nurses and our doctors to do. Wow. Wouldn't that have been good evidence to have? They could have protected William in that way. But because of his either direct incompetence or his direct ignoring of it, he chose not to address it. He was also told this.
Correct. And you, in fact, brought to law enforcement's attention that you have seen studies that actually high doses of fentanyl control long life, correct?
Yes, correct.
And this is a study that you actually saw that was I guess, a medical journal?
I believe so, correct.
What could he have done with that information? He could have brought it to someone's attention. They could have researched that. They could have pulled that article. They could have made the determination not to prosecute this case. If, in fact, giving higher opioids does reduce the agonal breathing, so therefore they don't tire out, and they actually live longer, that's a fact. You're not hastening anybody's death that way. You're prolonging it. That didn't matter to him. Then he was asked about potential side effects. He was told by certain people of the potential side effects. That Dr. Husel advised the families of these side effects. And his answer was, he didn't find it important. When you're giving families all of the information and the ability to give an informed consent, to understand what kind of care your loved one is going to have, the most critical piece of information is, as everyone testified, how meticulous he was, including Wes Black actually said he was the type of doctor who waited till the very end, until there was no hope left, before he actually had to talk with the families. Whereas other doctors did it much sooner. This is stuff they could have used. This is information that if it was done correctly, we not only have more information, but we might not even be here. But that is all lost forever. Now, remember when I told you there was points that I don't think came out very well, and you might not have understood why we were doing what we were doing. This one has to do with the nursing stations and the computers attached to the nursing stations.
Mr. Schultz, the patient's chest when it comes to and they're unable to breathe, basically. Would an alarm go off on the ventilator?
Yes.
Okay. And that's also something the nurse looks for, correct?
Correct.
Okay. And so when a patient's on the ventilator, the nurse doesn't, you don't just let them be, you actually monitor what's going on, correct?
You have to assess the situation and inform the doctor and get treatment for it, yeah.
Okay. And in addition to that, during a terminal extubation, after a patient gets medication, they're still monitored, right?
Correct. We leave them on the monitor even during the withdrawal.
So you just turn off the audio alarms inside the room, correct?
Correct. There's a monitor in the room and outside the room in the nursing station, and we just basically shut off all the alarms so the family member is not aware of what's going on with the patient, and it's just a blank screen.
Okay. And you took me to my next question. And basically, what a nurse does afterwards is they give the family privacy with their loved one, and they go to the nurse's station where they can monitor the patient's vital signs there, correct?
Correct.
And that's attached to a computer, you see it on the screen.
Correct.
And after you said you left the room after you administered the medication, how did you come to learn of Miss McDonald's death?
So we have monitors, like the monitors in the room, you can turn to a certain setting so the family doesn't see or hear all of the beeping, but we can still see it at the nurse's station. So I could watch the monitor at the nurse's station.
And what would you see on the monitor then?
You could see her respiratory rate, you could see her heart rhythm. She had an arterial line in, so you could see what her blood pressure is continuously. You could see what her saturations were for her oxygen saturations. And did I say heart rhythm? I think so. Anyways, heart rhythm, that too.
Nursing station, as you recall, there was more than one on the ICU floor?
Yes, ma'am.
And during a palliative extubation and the extubations that you participated in, were there times when you would leave the room to allow the family to have time with their loved one?
Yes.
And when you did that, where generally, in your experience, would you go?
We would go to either the nursing station, or we would go, if we had to go look at our other patients, we would go and proceed for assessing our other patient.
And fair to say, if you're at the nursing station, there are monitors there which allow you to continue to see what's going on in the room.
Yes, ma'am.
And while the machines visually and auditorily are shut off in the room, the patient is still being monitored even after they're extubated, right?
Yes, ma'am. And that's when you went over to the monitoring station and you were able to observe for vital signs on the nurse's monitors, correct?
Correct.
And that's attached to a computer, and all of that is working at the same time that the family is spending their last moments with this test.
Correct.
And then after that, when you recognize that perhaps Ms. Kessel had passed away, you learned about Dr. Husel.
Correct.
And when Dr. Husel came in the room, tell the ladies and gentlemen of the jury what his demeanor was like when he came back in the room to declare that.
The same, like calm, kind, caring.
Calm, kind, and caring. That's how this nurse, who barely knew him, described him. Calm, kind, and caring. Now, why were we asking about these computers? Because they're computers. And just like every other piece of forensic evidence, we would be able to know much more specifics. When did they stop breathing? Did they have respiratory depression? When did their heart stop? They didn't confiscate these computers. They didn't do any research on that. They didn't go in and remember when I asked the detective, hey, did you go to the ICU and ask them, walk me through a terminal extubation. What happens first? And where do you go then? And what do you do next? You would think that that's what they would ask to not only understand it better, but to see what potential evidence is there. What potential evidence could be used? William Husel sits here now because they didn't do that. Evidence that's lost forever. Evidence that really doesn't take a rocket scientist to be able to make that determination, especially for police who constantly, we live in a digital age, folks, you all know that. Everything electronic is there for us. How much better would that evidence have been rather than some backtracking? How much stronger would that have weighed when you make this decision of how important it is before looking at someone's notes? It would have been there for you in black and white. And I'll tell you this, they have that burden. It was their responsibility, and they did not deliver that to you. Not every citizen accused has the opportunity. In fact, no citizen accused has the opportunity to dictate that investigation, to guide the police to their innocence. You expect, hope, and pray that they're going to do a competent job. But this was far from it. Far from it. This is not something you would expect or want for your neighbor, your loved one, for someone who stands accused, for someone who saved lives for a living, who did so much for this community. Then we have some of the doctors. And people who testified for Mount Carmel. Put all these up at some point. But I want to focus in on those that work at Mount Carmel first. Let's start with these two gentlemen. Dr. Swanner and Dr. Olson. What have you heard from Dr. Swanner? Not a single person in 5 years ever complained about Dr. Husel. Physician of the Year, 2014. Was nominated several other times. In addition to that, you have Dr. Olson. Now, you may remember. You remember when the judge instructed you about admissions by party opponent. And he explained to you how, under the rules of evidence, the state can bring out things that Dr. Husel said. Not the defense. So, you heard not a single one, with the exception of one nurse, them ask any of these nurses about what Dr. William Husel said to any patient. You didn't hear it. I wouldn't object.
Ladies and gentlemen, you are the determinations of what the evidence is in this case. This is argument. It's to aid and assist you, but you can give it whatever value you deem appropriate. You are the true finders of fact. Let's move on.
In addition to that, this is the first case you're ever going to hear of. You know he was confronted, but you didn't hear a word about what he said.
Okay.
That was
Bring it back.
Sure. That's a decision that they made.
Your Honor.
Okay. Probably a good time for a break. It's getting up to be an hour and a half. You guys need a break? Yeah, I see some head shaking. All right. Remember the admonitions? 10 minutes enough? 15? 15 it is. 15 minutes. We'll get started back at 25 till. You may be seated. Mr. Zion, objection?
Judge, it is bananas that he's up there arguing that somehow the state of Ohio and the police can keep a defendant from either making a statement to the police if they choose, and or, more particularly in this courtroom, keeping them from testifying if they want. Whether the defendant testifies or not is entirely within the defendant's rights and the defendant's decision. I, of course, cannot comment on that, as it would infringe upon his right not to testify. But then to argue that somehow he doesn't have that right, Your Honor, is completely inappropriate. Completely inappropriate. It's the first case I've ever heard a defense attorney argue that, to be sure. Thank you.
Counsel's comparing bananas to apples here. I'm specifically addressing that they have selectively chosen, and this has nothing to do with the police. He was spoken to by these two gentlemen who are not police officers. He didn't have a Fifth Amendment right at that moment in time. He could have said nothing, but they have intentionally solicited admissions on some witnesses versus others they didn't. Now, I can't say what he would have said had they done it, and I can't comment on what he said, but I can certainly comment on their tactical decision to show this jury certain statements he made and withhold from them others. And that I can say that has nothing to do with the Fifth Amendment.
Were any of the documents given to you in discovery as to what was said by Dr. Husel in the interview? Does anything like that exist?
Yes. The note to chart when he was spoken to by Dr. Swanner and Dr. Ralston.
Okay. They let you know what they were.
Correct, and I'm not going to say what they are, but I do have the right to point out that they did not admit that evidence, but chose to select other statements.
But they gave you the evidence of what was said.
Correct.
Was it relevant to this?
Oh yeah, I mean, of course. He talked about his intent. He talked about his dosing habits and so on and so forth, but I can't get into that, and I have no intention of doing that. But there was also a mischaracterization brought out during direct examination that he was polite and cordial, and we, of course, corrected that during cross-examination as well. But I think there's a distinct difference between what they selectively choose to elicit from witnesses who are non-law enforcement in a non-custodial situation, but choose to withhold in others. And that's all I'm doing. I'm not going any further than that.
Your Honor, he's suggesting that somehow we've broken the law to the jury. He's selecting that somehow we've done something inappropriate. We have not put on the defendant's self-serving statements, which we don't often do in cases. And, there's one very simple way to get in whatever self-serving statements he wants to get on, and that's to get up there on the stand and make those statements. And so
Okay, hold on. No. He has the right not to take the stand.
Exactly, and that's why this argument is inappropriate. He has a right to testify and not to testify, and to somehow say the state kept out what he really wanted to say to you folks. They made this tactical decision. No, they made the tactical decision. We just followed the rules of evidence. That's what we did. To say that somehow, the state of Ohio hid this from you. He really wanted to tell you this, but no, they made their evil little nefarious decision. It's completely crazy that he's allowed to make that argument. He can do it or he can't, but that's their decision, not ours. He wants to say what he said to Dr. Ralston and Dr. Swanner. Get on up there and take the oath. He chose not to, which is his right, which I cannot comment on, which I will not argue about, but for him to be able to say that somehow this doctor really wanted to tell you what was going on here, but they chose not to. Well, you know, what can you do? The state of Ohio, as he's been saying all along, they're just selectively telling you things here, folks. Well, that is a completely inappropriate argument. Completely.
Anything else?
Yes, it's not. I'm not getting into the comments at all. And it is absurd that they would selectively decide what they want to ask for a part of your opponent admissions. But that's their choice. That's their tactical choice. So it has nothing to do with the tactical choice of the Fifth Amendment. It has the tactical choice to do with their burden of proof, which I'm free to argue, and what they did and did not admit into evidence. And clearly, there's numerous decisions where they chose not to ask certain witnesses certain things, but ask other witnesses other things.
Are you done with the comments on it?
Yes, that's pretty much it.
Okay. I don't think they're wrong for objecting here. I think you went over the line. But, you know, it's already out to the jury. I can give them the instructions that they determine what the facts are, and that's it.
Okay.
If you move on, fine. If you insist on there, I will have you forced to cut you off.
Understood.
Okay?
Understood.
That's the only curative thing I can do, Mr. Zion. You give me the look.
Sit here.
Anything else for the record?
Nothing from us.
Thanks. Yes, ma'am. In a minute. Any objection to, instead of her typing what was on the thing because the volume was so bad, just to submit the
Absolutely. More than happy.
we can make it as a court's exhibit. Because, I mean, it was a little rough. You were in costume.
Yeah, I was struggling through it myself.
Okay.
to you, to be a court exhibit. To be made part of the record.
Okay, great, thank you.
Okay, when you're ready, Sam. I have to go on here real quick. Yeah, hold on, just give me a minute. Well, you can go ahead and line them up, this won't take long. Okay, let's go on the record. During the break, I was approached by the court reporter. Can I have quiet, please? I was approached by the court reporter. She requested that the blurbs that were being shown on because of the volume and stuff be admitted as a court exhibit separate for the benefit, so, because she was having problems getting it all. I talked to both sides. There was no objection to that, so they'll be identified. I think it's 18, I think is where we're at. Yes. Can we include them all in one, or do you guys want each one specified?
Just put it on a thumb drive or something, I guess. I don't know. Just,
this is 18?
Yeah, the whole thing needs to go be made part of the record. Every slide, everything. If they can't print it out, just the whole thing needs to be on some sort of format that can be played.
Well, they're going to ask for yours to be put on the record too. Since
I've already given that to you, Judge. I gave it to you this morning and asked that it be made part of the record.
Okay. Any objection?
None.
Okay. Second issue, timing-wise. Okay. I figure you're halfway through your thing, Mr. Baez. I figure you're going to be a while. I don't want to be up trying to give a charge at 6 o'clock. So we're going to have to figure it out. I think if we go till 5, no matter who's up, I'm not trying to create a filibuster or anything, but, you know, I'm just trying to logistically do this for the sake of the jury. This is a long, complicated argument on both sides. So let's keep that in mind as we go. I figure you're about halfway.
Pretty much.
So, you know, I'm guessing you got at least another hour and a half, if not 2.
Hopefully just an hour, hour and a half.
Well, it's the old trial judge thing. We multiply the number by 2 the trial lawyer gives us. So
Understood.
we will make the salary, but I just want everybody to perceive it. I don't want an advantage of Mr. Zion coming back tomorrow morning either. So we'll just have to adjust. I do the charge tomorrow morning. I don't think that causes any problems. It gives the jury a fresh start because the law is important. Not that you guys' arguments aren't, but it's something separate that they can read along with me, and I figure if we have to, we can go tomorrow morning with it. Okay, if there's no objections, let's bring them in.
All rise.
Thank you. Please be seated.
I hope you had a wonderful break, ladies and gentlemen. Remember, this is just the arguments of counsel, okay? You guys determine what the facts are after you get the law. So with that, Mr. Baez.
Thank you, Judge. Remember when I told you I'm afraid I'm going to forget something? I did. Tracy.
Objection, Your Honor.
Let's see where he goes with it.
Now, you heard from Detective Gillette that he became aware of Tracy Young about 4 months into the investigation. I also asked him, did you go back and talk to anyone about Tracy Young? And after getting her records? And he said no. This is another instance where someone's experience is critical to the investigation. And the fact that she received more fentanyl than anyone in this case.
Sustained.
Now,
Strike, Your Honor.
Ladies and gentlemen, you disregard the last comment.
he told you that he became aware that she got more fentanyl than anyone in this case.
I'll permit that. Let's.
So, in light of that, a person's experience, and we learn throughout this case, that's how doctors learn, through their experience, through their education, through journals, and different things like that. To have all of that before you would have been critical. We may not even be here in that scenario. They want to argue certain doses or lethal doses. I submit to you, without giving you everything, the complete picture falls far from short of reaching their burden. Now, we heard from, of course, Dr. Ralston, who is an internist, as well as Dr. Hagris, who's an internist, Gina Moody, who does pulmonary and critical care, and of course, Tom Brady. We also heard from the patient safety risk officer, Katie Barton, about the hospital's investigation and how they struggled to find the root cause. In fact, they kept it at a level 4. You remember there was a level 0 through 9. 9 being causing the death of a patient, and they had it at 4. And specifically, she was asked by the prosecutor, I want to make sure I get this right, I apologize. I had it here just a minute ago. There we go. You recall that it could change at any time. They could go back and change that number at any time for these patients, but they did not. And that they knew the medication reached the patient, but did not and could not determine the patient harm at that time. And then at the very conclusion of her testimony, when asked by the prosecutor, why does it stay at a 4? She responded, even after the root cause analysis, we were still struggling with the cause and effect. Now, at one point, during some of the questioning of other doctors, it was trying to allege that she's not a doctor. But you heard through her testimony that it was they had experts that dealt with the specialization that she questioned, and that she completed a complete investigation. There were multiple people on the team, including Dr. Roth. The hospital themselves are telling you that they are struggling with the cause and effect. But you have the prosecution telling you something else. You have the entire medical industry telling you there's no maximum dose, but you have the prosecution telling you something else. You know there's no policy at Mount Carmel, but you have the prosecution kind of looking the other way of that. And you saw how basically they changed their position over time. Now, they questioned you about other doctors and what they did. The judge will tell you, and you should know, these are not expert witnesses. What one doctor does has nothing to do with another doctor, because each patient is different, every scenario is different. All of those things come into play. And internal medicine doctors are different than anesthesiologists. The one fact that you should remember is, despite the fact that they talked about how he was the only doctor doing these things, which is still questionable, because I'm going to go into a little bit of that in a bit, that he was the only doctor doing these things, but he's the only doctor in the ICU trained in both anesthesiology and critical care, which means he's different. His training is different. And we brought you somebody that trained the way he did. You know what they didn't ask that doctor? Dr. Zimmer? The $1 million question. How many patients have you given 2,000 micrograms of fentanyl during a palliative extubation? They didn't ask him that question. They asked him questions about giving doses to death penalty patients that are healthy and have nothing to do with a palliative extubation. But they didn't ask him the $1 million question, folks. What are your dosing habits? How do you make the determination? They didn't like the answer they were going to get. That's probably why they didn't ask. Because maybe you don't need that information. Maybe you don't need it. Now, we also heard from a slew of other doctors. Now, you may be wondering at some times, why were these doctors called? Because they don't remember anything. They said they didn't review the MARs. Well, number one, none of them had any independent recollection of any of these patients, so it's hard for them. I question whether they in fact would even remember that. Okay, it's not the cause. They know there's lawsuits going on in this case. None of these doctors are going to sign on for that. The easiest thing for them to do is say, I don't remember, and that's not usually what I do. Keep me away from this. That's the easiest thing for them to do. But I'll tell you this, you heard Dr. Haggers tell you, he relies specifically on on the discharge summaries and that they review the medications. You also heard Dr. Roth mention it. And you even heard the nurse Derek Dreyer when he was asked about it during his HR interview. Where are the attendings, the discharge summaries? Clearly, these doctors would have raised an issue if there was an issue. If you can assume that they relied on it, why can't he rely on it? Why can't he rely that they're going to do their job? You know he didn't do anything to hide these dose amounts. Not from the nurses, not from the pharmacists, not from anybody else that would have access to these records, which are, I presume, hundreds of doctors, including the patient safety officer. There's nothing cloak and dagger in the middle of the night at the ICU. Why is that? That's a constant theme, the cloak under the nighttime ICU. But the reality is there's systems in place. And Dr. Husel's intent can clearly be understood that he did nothing to hide these dose amounts. Nothing. And to allege otherwise is simply not true. It's all here. When you do something wrong, we remember, when we do something wrong, the first thing we try to do is hide it. And when there's something just not right, we try to hide it. That tells you his intent right off the bat. He didn't make any money if these people died. He didn't have anything against Sandra Castle, Mr. Timmons, any of these patients. There's no evidence that they got into arguments. There's no evidence of any of this. They're asking you to take a huge leap of faith to turn this case into a criminal case. The dose amounts and the wrongful deaths, that will all be decided in another courtroom, in front of another jury.
Sustained. Ladies and gentlemen, the civil case has nothing to do with this. This is the evidence in this case, and you are to interpret it.
So you have all of these individuals, everyone knowing what's going on, and then we get to the experts. These are all of the experts that testified in this case. And the first distinction I'd like to make is the toxicologist, who basically only testified about the drugs contained in both of the overdose patients. Something that the state's experts chose not to look at. Weren't provided with the autopsy reports. Which doesn't make any sense at all, given that a forensic pathologist is the doctor who investigates causes of deaths. It's their job. It's how they're specifically trained. They get all of the information together, and they make the final call. I was thinking neither one of them were declared as a homicide. In fact, you have all of these other doctors show you the comorbidities of what actually killed these patients. What it was how they were sick, basically. And if you believe this guy, Mr. Schweiger, they all could have gotten up and walked out. Forget that you died 5 times in the hospital. It doesn't matter. Forget that you're reliant on vasopressors to survive or your heart to keep beating. That doesn't matter. They could have all walked out here. It's absurd. It's absurd. And to classify them as random doctors from Tennessee and Tampa is a little inaccurate. They were hand-picked. Hand-picked hired guns who came in here and testified as to what they thought. And they didn't even agree. And again, Dr. Ely is not even an anesthesiologist. Not trained the same way. Different training. Qualified, good Catholic. They're both good Catholics. But what does that have to do with this case? Nothing. Nothing. Yes, they understand the privilege of suffering. Well, not everybody subscribes to that. Not everybody thinks it's a privilege to suffer. And if that's the doctor you want to go to, you have every right to go to that doctor. There's nothing against the law for that. But you also have the right for a doctor to keep you in comfort in your final moments. So, really, the ones that are trained in the same area and expertise are these two doctors. All he did was cut and paste a good chunk of what his opinions were, ignoring every other doctor at the hospital who said these patients were terminal. You remember Ms. Menashe going through those cross-examinations and pointing out, what about what this doctor said? This person is terminal. I'm afraid they won't survive. What about this patient? Without this life support, they will die. All of these other doctors are in cahoots. They must be enthralled with William Husel. They don't work with him. They don't know him. Well, maybe they know him. But how did they get enthralled too? All of these issues are constant within this case. James Allen had respiratory failure, had cardiac arrest, his heart stopped. He was on 2 vasopressors. His blood pressure was sinking. He was in the ICU, left the ICU. This is something interesting. You heard a lot of testimony from the nurses talking about how William Husel was always available. Remember that. Well, there's an importance to that. It's not just, hey, he likes hanging out in the ICU, okay, it's all fun and then. No, it's being there for your patients. You may recall during the cross-examination of one of the nurses pointing out, Mr. Allen, we pointed out that when he left the ICU, his blood pressure started to go down. He started to crash. And he wasn't provided the proper care by Dr. Manjan until he arrested him. The nurse paged him 10 times. Remember something about that, about being paged 10 times, and then the doctor finally called back, and then he hung up on her. That's not being available. And yet, he sits here. Beverly Scherzinger, she's the one that had a liver biopsy, normal liver biopsy, but she bled out. What did Dr. Manjan do? Mr. Not available? When they finally got him, he gave her salt water. And said, oh, it's probably from the pharmacology. You saw that in some of the records. She crashed. Who was there to save her life? William Husel. He saved her life. Tried to leave to kill her later. 14 life-saving measures William Husel utilized to try and save Beverly Scherzinger's life. CPR, he intubated her, gave her a central line, an arterial line, maxed her out on three vasopressors. Even Dr. Schweiger will tell you, every single witness who took the stand told you how fast the vasopressors end. 30 seconds to a minute and a half. He took it a step further, and he talked about if you're dependent on the ventilator, you're going to die in 4 minutes. Each and every one of these patients were dependent on the ventilator. Phelps, last time I checked, is not amongst them, who could survive holding their breath for over 4 minutes. They needed machines to keep them alive. Their heart wouldn't beat, so they relied on these vasopressors to keep them alive. And the second those things are turned off, that's your cause of death. And he sits here, charged with murder and attempted murder, after saving Beverly Schurzringer's life and utilizing 14 different measures of trying to save her life. All of them done within an hour of extubating her. That's a fact. Those facts were never presented to you during the state's case in chief. All brought out during cross-examination. Every one of them. Rebecca Walls, she went in to get for the stent for her heart surgery, had to bleed. Again, you see the doctrine of double effect coming out multiple times in this case, and how it relates to certain patients. Miss Walls didn't want to bleed out and die, but she needed that surgery. There were risks. There are risks every time a doctor touches you. Lots of risks. They're not miracle workers. But after 14 different attempts to try and save Miss Schurzringer's life, William Husel could do no more. Bonnie Austin, getting CPR, punctured her ribs broken, punctured one of her lungs. That caused her to die. But she had 5 cardiac arrests. 5 times she died at Mount Carmel. Dr. Schweiger said she could live. Walked out of there. Ryan Hayes. With carfentanil in his system, overdose. And it wasn't just carfentanil. It was carfentanil, morphine, fentanyl, alcohol. All of these things together. We don't know what's in these drugs that are taken in the streets. But an elephant tranquilizer is not a good thing. Another case, Dr. Ely didn't even know what carfentanil was, his first cross-examination. When he came back to you, looked it up, said they were kissing cousins. Maybe in Tennessee they're kissing cousins, but here they have absolutely nothing to do with one another. It's 100 times more. In fact, you heard Dr. Zivit tell you it's even used as a chemical weapon. That's how strong it is. But yet he stands here accused of his murder or attempted murder. Sandra Castle was having a bad death. Those order sets were doing no good for her, and she was suffering. She also had 6,000 micrograms of fentanyl in her hospital stay. Bonnie Austin was also on hydrocodone at home. Rebecca Walls got 6,500 micrograms of fentanyl while in the hospital. It's like 1,000 micrograms a day. She had a tolerance. You did not get a proper presentation of evidence on their tolerance. You're going to have to weed through this to go through a lot of it. We brought some out during cross-examination, but the reality is these patients had some factor or another that contributed to their dose amounts. That's why they're different doses. That's why you heard one of the nurses talk about a terminal extubation where the patient didn't get any fentanyl. It was Jordan Blair. Troy Allison had 4 heart attacks. I still can't understand how they're saying he would have walked out of that hospital. He could barely make it to the ICU. His heart kept stopping. The doctor in the note says, I walked away for just a minute and he arrested again. This was a very sick man who was on lots of pain meds, the equivalent of 750 micrograms a day. Now again, the comparison between the opioids and fentanyl are for tolerance levels. 750 a day he was getting. He was non-compliant with the pain from his leg. He had a car accident. He had all these problems. His glucose, his pH level was at 6.53. He's a walking miracle. Well, he wasn't walking, but he was being kept alive by machines. His glucose is at 899 when 100 is normal. His lactate was at 16 when it should be 1. All of these things, kidney failure, cardiovascular failure. Danny Millette, also on hydrocodone, got 2,000 micrograms of fentanyl, had multiple hospital stays, built up a tolerance, as well as 6 cardiac arrests. 3 maxed out vasopressors. You can't live like this. You can't. And what's unique about this case that will trouble you forever is when you take someone off a bed, you're already hastening their death. When you turn off their vasopressors, you're hastening their death. They can't tell you how long. Beyond a reasonable doubt, they would survive if they didn't get any fentanyl, but yet they want to tell you to hasten their death. It flies in the face of reality. It's absurd. This whole case doesn't belong here. Joanne Belisari, at her hospital stay, received 8,600 micrograms of fentanyl. She had kidney failure, respiratory failure, cardiac failure. She was in septic shock and had 2 vasopressors keeping her alive. James Timmons, 3 heart attacks. Cardiac arrests. 2 vasopressors keeping him alive. Multiple kidney failures. And I'm going to get into his tolerance in just a minute. Now I want to talk to you about probably the most critical witnesses in this case. Nurses. The nurses are by far the most important witnesses in this case, and they can hide from them all they want, and they could not ask or give you the complete picture. But the fact of the matter is they're the only witnesses in this case who are independent witnesses, who don't have a dog in this fight. They're the only witnesses that had the most contact with these patients. They're the only witnesses that know what he said and did, because they were there. And something happened during this case that was really impressive and shocking and quite unbelievable. And that is that a majority, you heard, a majority of them are some of them are no longer nurses. They all lost their jobs. Something happened to them. Some are still nurses, but a few of them are. You would think they would be really angry at William Husel. You would think they would come in here and bury him. I submit to you, ladies and gentlemen, that the reason they didn't do that is because they're honorable people. They got into medicine to help people. They were there. We were not. They were not. Neither were their experts. And all the experts ever did was rely on their notes. Some took better notes than others. But you would think about that. Think about what they went through and how upsetting that would be and how life-changing that would be. Imagine having a career, the job of your dreams, and as Mr. Zion pointed out correctly, they wanted to work with the sickest of the sick. And all they had to say, they all told you how William Husel was accessible, a good doctor, constantly. I know Mr. Zion called him a terrible doctor or a bad doctor, but that's not what the evidence showed. The evidence showed that this was a caring man that took care of his patients, that trained the other nurses and other individuals that worked at the ICU to make it a better place, to help people even more so. And they had every reason to tell you otherwise. And they don't have a financial interest in this case. They don't benefit. And they're all varying degrees. There was one. And there was one nurse, Kathleen McDowell, who, when questioned by the police in a homicide investigation, lied. Straight up lied. Said, I've never given any fentanyl, or I don't recall giving any fentanyl. I used Dilaudid or something else. I have nothing to do with that. But immediately after that, they had to call her back. They called her back, and they questioned her again. And then, wait a minute, what about this patient? And that's when she knew she needed the lawyer. You don't lie to the police in a homicide investigation and get away with it. 3-4 days later, she's sitting in the office in front of the state attorney. She's got all kinds of stories to tell. This bromance. Well, Jamie Burke was not part of any bromance. Neither was Stephanie Lachard, who barely knew Dr. Husel. They all have varying degrees. They all, after this happened, we started questioning them about bromances. Many were thrown off guard, didn't understand what they're being talked about. She also talked about odd numbers. He doesn't like odd numbers. But yet, the state, odd numbers are okay for the state when it's convenient for them, like 99.9% sure that their organ failure, he allegedly said, or 99.9%. You can't get any more odd than that number. Something about a microwave. He doesn't listen to pharmacists. That allegation, if it ever existed in any of these records, that Dr. Husel did whatever he wanted, despite the pharmacy, would have been front and center in this case. You all know that. That would have been the first thing you would have heard about, is how he ignores the pharmacy. But that's not the case. That's not the case, and you all sat here this whole time and know that. And this thing about this talk, he's 24 for 24. Why would he need to change his talk if he's 24 for 24? He's only done. You heard that Dr. Hagris does 15 to 20 a year. That's probably more than what we've seen from Dr. Husel. But you also heard palliative extubations are rare. They don't happen a lot at all. I mean, they happen, of course, but it's not a common thing. So, all of this, and of course she decides to rat out all the nurses. The police are investigating, talking, and want to know, what did nurse so-and-so tell you? What did this nurse say to you? They sent you a text, all of these different things, and they didn't like the word cooperator. They sure wouldn't like the word snitch. They wouldn't like informant. I don't know what you call it. But giving information on your coworkers, private messages to you, to the police and the prosecutors, is what she did. And I submit to you to stay out of trouble. Knowing she needed to get a doctor and get a prior sit down for a proffer with the prosecutors. And she never actually sat in a talk with Dr. Husel. zero experience in when he spoke to the family. She had no experience to speak of except for participation in another patient that's not involved in this case. That's it. That's their star witness. Even she testified about how good a doctor he was. Nobody here agreed with her. And she was the only witness that they asked her about in terms of what William was talking about at the ICU. In addition, none of these nurses ever said anything about brain death. Why not ask Jacob Diener, hey, did so-and-so mention, did Dr. Husel say that this patient was brain dead? No. And you heard from multiple witnesses, Dr. Zivit, who said, brain dead, you're dead. There's nothing to do. When a person's dead, they're dead. When the person is, there's two ways that you're declared dead. One, you're either brain dead, or two, your heart stops. Those are the two scenarios where you're dead. Any medical professional knows that. And that's why the absurdity between the cross-examination of Dr. Zivit came out, as well as Dr. Ralston also talked about being brain dead in Florida, in Ohio, as it relates to being the law. Now, what they did with the nurses was they literally threw them up against the family members. And they presented to you a conflict in the evidence. If you look at, can you get the family members? Actually, before I get into that, one of the important things, as I mentioned earlier, were the side effects. They were never asked if Dr. Husel, it came out through cross-examination in a very difficult way, but it came out that Dr. Husel actually advises the patients of potential side effects.
Tell us about all the things that you discussed. Yeah. So on top of the prognosis with him that we detailed earlier, we talked about how we're going to turn off the IV pumps which contain the vasopressors. We talked about how we were going to discontinue the ventilatory tube. We were going to take out the endotracheal tube, put a little bit of nasal cannula on him if he needed it, and we were going to give him pain medication that would help him be comfortable and pass naturally as a result of his underlying illness.
Did you discuss with the family the potential side effects of the medication?
They were discussed.
Okay. And did you feel that the family, did you feel that the family was well informed by both you and Dr. Husel?
Yes.
Okay. And that included being well informed of the potential side effects of fentanyl?
I think so, yes.
Did he leave the decision up to the family, or did he tell them what he was going to do?
He left the decision up to the family if they wanted the patient to get more pain medicine.
And I asked you about these vials. Did you think that he would, during the discussion with Dr. Husel and the family, did you, let me put it this way. If Dr. Husel had hidden important information about the side effects of the medicine, would you have spoken up and informed the family and given them more information?
Yes.
Okay. And did you have to do that?
No.
Why do I have to ask that? And every one of these nurses told you that he was meticulous, thorough, and always gave the family the options. And if he had not or misled the family in any way, it was their duty to speak up. Not a single one told you otherwise. Not a single one. How are these facts being ignored? How do you not? It's like you don't need this information. It's critical. And again, we're talking about side effects, potential side effects. We're not talking about factual things. You heard Jordan Blair say, what are the side effects? Well, respiratory depression and constipation. It's funny, you watch a commercial about a medication on TV, half the commercial is telling you how great it is, the other half is telling you about the potential side effects. That makes you wonder why they're even selling it at all. The fact of the matter is that as it relates to fentanyl, it's like every other medication. There are potential side effects. It doesn't make it a fact in a murder case. In fact, it's not a fact in a murder case unless there's some note or some indication that it actually occurred. Search through here all you want. You won't see one single patient, one single note, one single fact in any way, shape, or form that says that any of these patients suffered from respiratory depression. Not a one. Or that there was some adverse effect of this medication given to the patients. Not a one. Folks, you're not just to assume things. You're not supposed to make that connection for them. Remember, it's beyond clear and convincing. It's beyond and to the exclusion of every reasonable doubt on everything. Everything. But there, 14 cases, let's throw it against the wall, see what sticks. Because all it takes is one. All it takes is one. And that's a critical fact that they conveniently left out for you. Now, they don't like that Mr. Timmons got 14. Well, actually, let me get into this beforehand. You heard a lot about paralytics. Well, I would submit to you, ladies and gentlemen, that paralytics only apply in one of these patients. That was Melissa Penix. And she received the paralytics 48 minutes after getting the paralytic. Their own policy, the order sets that they rave about. The first thing it tells you is right up here. Discontinue paralytics 30 minutes prior to ventilator withdrawal. That is the Mount Carmel policy, and that medication was given in compliance with that policy. In addition to that, look at where it says communication, patient care. Withdraw ventilator support when level of comfort is within the desired limits. No grimacing, no agitation, comfortable respiratory rate. 30 breaths or less. What does that tell you? You also heard every one of these nurses tell you that they give the medications prior to taking the ventilator off. They want to make a distinction that these people were not on ventilators. They were on ventilators when they got the medication. They were monitored. The nurses monitored each one before taking the ventilator off. If there was an issue, an adverse effect, that's the first thing that they would have noted in the records. In addition to that, it's the medication is given on a ventilator. And until the pain is going away, no grimacing, no agitation, they're comfortable, that's when you take it off. And what does it say under medications? They start getting into medications. Well, as we know, that doesn't have fentanyl. But what does it say there? Note, principle of double effect. In a note with an asterisk. It's telling us, remember the principle of double effect when you give these medications. Again, it's true, it's not Mr. Zion argued to you that it's not a law, it's a principle, it's this, it's that, whatever you want to call it. Here you have Mount Carmel telling you that as well. And then the other issue, remember there was this whole issue with the synergy, and synergistic effect. Well, I always catch myself, but Katie Barga, the patient safety officer, attached a journal to the root cause analysis. And I pointed it out to her during cross-examination, where it specifically states, without any ambiguity, that the combination of benzodiazepines and opioids do not hasten death. That's in their root cause analysis. That's one of the reasons they struggled to find the root cause. Then, in addition to that, Dr. Haggard says that he gives the combination of the two. Dr. Zivit told you it's the gold standard. To come up with the synergistic effect, that's a prosecution theory. Because it's not subscribed to by Mount Carmel, and it's not subscribed to by other doctors. And we have to make the distinction between what the prosecution thinks versus what doctors think. And they're not doctors. So that takes us to Mr. Timmons and his 14,000. Here, the 14,000 micrograms is listed in 4 different places in the records. 4 different places. This is not, as Dr. Schreiber likes to think, a mistake. Numerous different places, including the actual anesthesia record, which shows the start time and everything thereafter. Now, what's interesting about Mr. Timmons' compartmental, here's another place in the records where it is, in the MAR, and here are the surgery records. This was a quick surgery. You see the start time was at 12:05, end time 12:34. 29 minutes. We heard from the nurses that the withdrawal takes anywhere from 15 to 20 minutes. So this is 9 minutes more than the average time of an extubation, and he's getting 14,000 micrograms. There's no distinction here. It's minimal at best. And it shows that apparently, based on his background, in the OR, they felt he needed 14,000. He got 1,000 from Dr. Husel. And he got the extras, and you heard Jake Beamer say, they were worried about him going through pain. Give him what he needs and nothing more. Give him what he needs and nothing more. So, as I mentioned, here's where we're at. Mount Carmel comes to them with lethal doses. They do their investigation. Now it's potentially all the patients were terminal. That was clear. They never made any allegations that you heard in this case about any of these people not being terminal. And the families freely decided to withdraw care. Who knows what happened in this phase? And now all of a sudden, you have all of these different theories. And theories they are, ladies and gentlemen. Theories they are. Patients were not terminal. They could have walked out. James Timmons could have gone to rehab. They could have lived. Now they're all fatal doses. They tricked the nurses into giving high doses. They were so enthralled, these folks. Enslaved by his charm. And then, wait, he's not a man of many words. So how's he charming them with not many words? Okay. Happened in the middle of the night. The synergistic effect. That's a prosecution theory. That's all new. Stiff chest syndrome. You heard from the nurses that we asked the alarms go off if there's stiff chest syndrome. The nurses will know. You can observe stiff chest syndrome. There's nothing in here that a single patient went through stiff chest syndrome. There's just as much evidence in here that they died with stiff chest syndrome than they had leukemia. Just as much, which is to say none. Just as much that they died of COVID than they died of stiff chest syndrome, or that they had any, or even side effects. Not a single side effect is noted in here at all. There's just as much that a side effect or an adverse effect occurred than there is that they had leukemia or even COVID, which wasn't even discovered yet. Brain dead. Folks, this is a new theory that is in none of the records at Mount Carmel. None of the witnesses from Mount Carmel testified to it. You only got to it through the family members who had lawyers that mentioned it in their lawsuits. So, forget the medical professionals who were there, who were independent, and believe, there was just a couple of them, and I'll go through that in just a moment, but let's bring that up. Before I discuss the families, I think everyone would agree we're incredibly sorry for their loss. They lost someone very close to them. There's no there's no fact that would ever change that. Having said that, only just a few testified about this brain dead theory of the prosecution or the personal injury lawyers brought forward. And I'm going to get into those in a moment, but I think when you have a hospital calling them and telling them a certain fact, they probably do believe that William Husel contributed or hastened the death of their loved one. Especially after having a lawyer and deciding to move forward in something like this. Probably do believe that. And after an onslaught of how this man is the pariah in this town was out there, there's zero doubt that they don't believe that William Husel, at the very least, hastened their death. But many of them didn't even look at the medical records. Many of them. And I understand it's probably not an easy thing to do. They left it up to the lawyers. But only a few of them. But the first thing I need to point out to you, before I even get into that, is how few of them are the actual power of attorney or decision maker in withdraw care that the state claimed. That can shock you. There were only 4 out of the 14 patients that the power of attorney actually testified. A person who was ultimately in charge of the decision to withdraw care of their loved one, only 4 of them that testified in this case were the actual power of attorneys. There's one that's questionable, that might make it 5, and that was Mr. Allen's son, who the spouse left it up to the decision of the rest of the family and the children. The But that's still a curious number. Why is that? Why are they not bringing you these family members, the actual decision makers, and then asking you to make a decision like this? How is that possible? It's wrong. It's flat out wrong. It's not what a citizen accused deserves, and it's not justice at all. Having said that, you had a couple of patients who made this claim of being brain dead. The first one I'll bring up really didn't say it. It was Mr. Marshall from Timmins. He didn't say that William Husel said he was brain dead. He said that the nurse who called him in the middle of the night said that he was brain dead. It doesn't seem very likely or plausible that a nurse would call for Mount Carmel in the middle of the night and tell you, your loved one is brain dead. Do you still want us to resuscitate them? And he says yes. Remember, Mr. Marshall said that the only thing William Husel said to him was, I'm sorry for your loss. So in light of that, I don't really think you can put much stock into that. But there's one thing you know. Anoxic brain injury from all of these cardiac arrests were potentially there, and the likelihood of them being confused is great. So, starting with that fact, you have David Austin with Tara Schwartz. She was 16 at the time, didn't even have a driver's license. Mr. Austin said that Dr. Husel said his brains were dead, her brain was dead, her lungs were dead. That's not a medical term. It's her other organs are dead. None of those are medical terms. And the nurses are fully aware of what brain dead is and what's required at Mount Carmel and what's required under state law. And there's nothing in evidence that indicate that their training says otherwise. Fortunately, Nurse Ebrow testified late in the case, so I got to ask him, did Dr. Husel say anything about brain dead? Did brain dead ever mentioned? No. They know. They absolutely know that you can't do eternal extubation on a dead person. Or you can't give medication to the dead. So this whole brain dead theory, which first surfaced in a lawsuit, is something that the prosecution just ran. It's something you can't forget. And something that completely contradicts these independent witnesses. All of them. Not a single one. Not even their cooperator, informant, whatever. Not even Miss McDowell went that far. And then you have Miss Allison. Miss Allison, Christine Allison, was interesting, but had a hard time keeping her facts straight as well. Another fortunate event was Jason Schultz, the nurse who was a charge nurse, an ex-Marine, an ex-war veteran, who came up here and told you that no, Dr. Husel did not say anything about being brain dead. In fact, these two contradicted each other. Her daughter said she had multi-system organ failure. Miss Allison said brain dead. That's the difference. I think she might have squeezed it later on during the second part of her testimony, or brain dead, but initially she said multi-system organ failure. And then again, they used that odd number, 99.9, 100% sure. And then we had Beverly Leonard and Wesley Black, the nurse in that case, was specific and clear about nothing was mentioned of being brain dead. These are critical. This is clear conflicts in the evidence. Clear conflicts in the evidence, which you have to consider their motives. Right? All that we do is done with an eye towards something else. They contradict each other, and they're also contradicted by the nurses. And the credibility of these three patient family members are highly questioned. There's a financial interest in this case, and I realize nothing stumps the loss of a loved one. And they probably are angry, extremely angry at Dr. Husel. But that doesn't mean they're well-informed or correct. It doesn't mean that at all. Now, there were a couple of things that happened that you may have noticed or may not have noticed. Let me start off with Miss Leonard. Miss Leonard took the stand and showed you all a bottle. And during her testimony, I don't know how many of you noticed it, she did something to that bottle. I'm about to show you a video of that, where we would argue to you that this is clearly something going on with this evidence. First thing I want to direct your attention to is there will be a moment where she gets to it. You'll hear the prosecutor talk about how the sticker is very small, the prescription is very small, and then at some point you'll see her go like this, and once she rips the sticker off of the bottle, she makes a face like that. And you can see her looking at it and then eventually putting it down. I'll show it to you right now.
May I approach the witness, Your Honor?
You may.
I'm approaching the witness with a small pill bottle labeled State's Exhibit 33.
Yes.
Do you recognize that?
Yes, it's my mom's prescription bottle for 15 milligrams of morphine.
Where did that bottle come from?
My mom's house.
Who gave it? How did you get it?
My dad gave it to me.
Okay.
Let's pause it so we get the, I'm going back, sorry.
You both are quick.
Let's pause it so we get the audio lined up with the videos. Can you handle it, James?
May I approach the witness, Your Honor?
You may.
I'm approaching the witness with a small pill bottle labeled State's Exhibit 33.
Yes.
Do you recognize that?
Yes, it's my mom's prescription bottle for 15 milligrams of morphine.
Where did that bottle come from?
My mom's house.
Who gave it? How did you get it?
My dad gave it to me.
And I know the script is awfully small. Can you find a date on there?
Right about
11/1/2018.
And what day did your mom die?
11/20/18.
And what does the prescription say on the label that it's for?
Morphine, SULER, 15 milligrams, tab, MAL. Quantity 60. Gregory Runzer's her doctor. Law prohibits free refills, and flu shots are now available.
I'll show it to you one last time really quickly, just in case you missed it.
Objection, Your Honor.
This is stupid.
May I approach the witness, Your Honor?
Like, move on. So, why is this important? Why is this important? And that is because in the medical records, there's a difference of what the dose amounts were for Ms. Pettick's home medication. You see, on one side we have 50 micrograms or 50 milligrams of morphine versus 15. We know that 15 milligrams of morphine is 100 micrograms a day that Ms. Pettick was taking at home. And remember, in her obituary, she was now finally free of pain. 50 micrograms is over 300 micrograms a day of opioids that she was taking for her pain. There's a big difference there. And you heard the testimony that this is something she gave to the prosecutors shortly before the trial. Messing with evidence in a case as serious as this is 1,000% improper. I feel for Ms. Leonard's loss, but this is an important matter that we've all labored over, and no one has the right to manipulate any kind of evidence to make things go one way or the other. And it's another perfect example that this is a witness that is an interested party. It's something you must take into consideration when you deliberate and you think of her credibility, especially based on statements she made. You also had heard that many of them have the same lawyers. And some of the phrases and things they said pretty much aligned up with one another. Oh, before I go into that, again, this is Ms. Pettick's, and as it relates to the different, to the paralytics, you'll see she was given the paralytic at 2200, and then the fentanyl at 2248, which is 48 minutes after, not well past the 30 minutes that's required under the order set. And you heard multiple times in this case, you were shown things, and paralytics was brought up multiple times. But what the state tried to do is show you paralytics during the intubation instead of the extubation. You may recall when I was cross-examining Ms. Sawyer brought up during Mr. Dreyer's testimony pain scores from 3 days earlier before he was extubated. Paralytics given in the morning when they're extubated at the nighttime. All of these different things. We shouldn't have to do that. We shouldn't have to point out the misleading information that's being given to you on the fly. Because we don't know what questions they're going to ask. We don't know where they're going to go or how far they'll go. But to do that on the fly and to be able to come up with these things and show you, look, this is from 3 days earlier. And they're trying to say, oh, this medication took care of their pain. It was sufficient. Even Dr. Husel knows 100 micrograms took care of the pain. Well, it's different during an extubation. The one fact that I hope you all take back with you is that palliative extubations are different for a multitude of reasons. But to try and mislead you and say, oh, look at this, 50 micrograms took care of the job, when in fact that was 3 days earlier, or paralytics were given and a person can't breathe when it's perfectly proper to do it during an intubation because they're fucking the vent. All of these things are unfair. This is not justice. This is far from it. And this is something you should hold them to a higher standard. Imagine having to sit in that seat and one misleading thing after another gets presented to the jury who will decide your fate. How atrocious and how scary is that? That's not justice. And that's why you must hold them to their standard, and that's why this case doesn't belong here. Far from it. Far from it. So, you heard Miss Allison say that they met at the lawyer's office and several other patient families were there? Well, yeah. Listen how they testify alike.
He's laying there resting comfortably, and now he's dead. How
how did we get there? So did you, I mean, the family literally was in a state of shock when we were told she was brain dead, because how did we get there? How'd that happen?
I don't have any evidence to say these women knew each other before this case, but certainly we heard evidence that they did after.
It's okay, James.
And certainly before they testified. So, in the beginning of this case, I showed you this chart. Remember during my opening statement, I showed you this and I said to you, all you have to do is pick one. And William Husel is not guilty on every count. And that it is impossible for them to meet their burden based on these facts. I want to revisit them now that we've had the opportunity to hear the case in its whole. The side effects. There's not a single piece of evidence that you heard that any one of these patients actually felt or suffered any of the side effects. In fact, Ms. Penix, when she was taken off the ventilator, you saw the note that she was breathing afterwards. Brandy McDonald, it was shown there that she was breathing afterwards. There are no maximum doses. What's a doctor to do? Use their discretion and their experience. He utilized his experience with Tracy Young, and you see that throughout this case, that the doses vary based on their clinical picture. The other thing with Ms. Penix, if you remember, Wesley Black testified that they pleaded with the nurse and Dr. Husel that her greatest fear was suffocation. So what's he do? Let her suffocate? Let her feel herself suffocating to death in her last moments? No. That's the time for compassion. And that's exactly why he utilized that. Her clinical picture, the fact that she was receiving opioids at home, and all of the other things, all of the other factors came into play. If your blood pressure is low, it's going to take a while for the fentanyl to get through your system. In the meantime, you're going to suffer because the blood's not pumping. It's not going to be able to distribute before it gets up to the brain receptors to be able to tell you, hey, take care of this pain. The pH levels, the acidosis, all of these things, a person's liver and kidney functions, are they able to break down the chemicals the right way? All of these things, their tolerance. None of these factors were ever presented to you. We tried our best during cross-examination and through Dr. Zivit, and he explained all of the different variations that pain management with the healthy is different than pain management with the dying. And no one knows what's painful in death. No one knows what anxiety we suffer. Oh my goodness, I'm dying. I'm going to die. No one knows what that feels like. And if you remember Dr. Zivit showing you the anticipatory anesthesia with, you want to get over that pain before it's too late. You don't want to come back after. Now, there are some doctors who will let you suffer. And they'll let you get some pain and titrate it. And they'll say, okay, let's adjust it. But that doesn't make it a crime. No evidence that the side effect ever occurred. That goes to its intent, and it also goes to causation. No maximum doses. We don't know. And again, folks, the medical community together can't come to a consensus, but they can. They don't want you to believe doctors. They want you to believe them. They don't want you to believe records. They want you to believe them. They're like, Groucho Marx, who are you going to believe, me or your lying eyes? That's literally what they're telling you. That's what they're selling you. No policy. Goes to his intent. There's not one instance where there's a policy involved, and he says, I don't care, I'm violating that policy. Let's talk about for a moment what's fair. What's fair is if somebody has an issue with what you're doing, they tell you. And you saw all those pharmacists approving the medication. And when the one that had a problem with it said something, he didn't go to William Husel. He didn't go to him at all. Neither did the manager of the pharmacy. Neither did anybody until he's fired. Or until they suspend him, excuse me. Until Swanner and Ralston decide to put him on suspension. And then they want him to be part of the order set, to help him develop a policy. If they thought he was a murderer, would they ask him to help him with the policies? If there was any evidence of that, would they ask him to be part of the policy? To fix what might be wrong? What might be different about you because you have different training? All of this flies in the face of reality, and it's such an absurd case. It's so absurd. And with any one of these, you have a right to hold to this and say, you know what? Because there's no max doses, I find him not guilty. I don't need to read this, because I know there's no max doses, and that went unchecked. You have the ability to do that. You have every right to do that. Because it's their burden that's deeply embedded in our constitutional values. Deeply embedded. It's what anyone would want for themselves. Anyone. And then, the medical studies show the opposite. You heard evidence of it. They told the police about it. And it went nowhere. Imagine telling the police something that might exonerate you, and it goes ignored. That's not fair. That's not just. It's not justice. Doctrine of double effect. Boy, was that like to get it to have you guys consider. It's definitely embedded in medicine and in everything they do, and especially when it comes to opioids and palliative withdrawals. It's a factor. Perhaps that's why they're saying they could have lived anyway, to get rid of the issue of doctrine of double effect. I really don't know. I wish I could argue something a little bit more concrete to you in that respect. But the fact of the matter is, you see it in their own order sets. You've heard multiple witnesses testify to it. Even the nurses know about it. His experience. Tracy Young speaks in and of itself. And that was before all these patients. The process. The fact that you would rely on the pharmacy doing their job. Do you know what Hagris testified to? Dr. Hagris said, Dr. Hagris said, that if he sees the meds being administered by a nurse, he assumes the pharmacist approved the order. His job, and he said it, his job is to deal with the patients, not to deal with any overrides or anything like that. He said the only way he's ever notified of an issue with his dosing is if the pharmacy reaches out to him. That's what he told you. And that he was never informed of an issue by any of the nurses that they had with him. Now, why is that acceptable for Dr. Hagris, but not for Dr. Husel? If there's an issue with his dosing, his expectation, his understanding is that someone will come to him and tell him, I have an issue with this, and let's discuss it. They discuss it, they come to a consensus, and that's it. And then he also told you about his reliance on the discharge summons, or on the attending physicians, that he assumes they're doing their job. He's going to assume it. And there was this whole thing with Mr. Zion talking about, you assume good intentions of your coworkers. Yes, I agree with that. But absent any evidence of anything wrong, you should assume that too. This I didn't get to during the openings, but the patients and their clinical picture, that literally goes to the causation. Vasopressors, 30 seconds to a minute and a half for all of these patients who their blood pressure was tanking. I think there may have been one that didn't have a low blood pressure. But all of these that were being turned off, it's going to act quickly, faster than the fentanyl. You heard the fentanyl is a 5-minute peak effect. They're still on the ventilator. The nurses can observe whether they're having an adverse effect. There can be things done. And it's so funny because it's okay for a cardiac, it's so interesting how the prosecution will argue to you, oh, you're going to have a heart attack, cardiac arrest, no problem. There are doctors there, there are nurses there, you're in a hospital, it's okay. Hey, I don't think anybody's going to volunteer to go have a cardiac arrest in the hospital. At all. But it's okay. No, you're not healthy. If you have if you die at the hospital, yes, sometimes you can be resuscitated, but sometimes you can't. So to make that argument flies in the face of it all. And the vasopressors are going to turn off before the fentanyl ever becomes a factor. Ever. And they never gave you, there's a causation on both of these, they never gave you any evidence as to how much time they would have lived but for the fentanyl. And that's because these folks were dying and dying, actively dying, even on life support. What's the opposite of life support? Death. When you can't breathe on your own and you're dependent on having a machine make you breathe, you're not going to breathe, you're going to take it away. You're also not going, your heart is going to stop when you don't have that jet fuel running through you. Any one of these folks, any one of them, is a reason that you can find William Husel not guilty. I want to conclude with something. But the first thing I want to tell you is to look at that man. He was pointed at. All kinds of things were said about him. It's called the defendant. He's not even a person, he's the defendant. I submit to you, that's not who he is. He is not the defendant. He is Dr. William Husel. He dedicated his life to taking care of the ill, to taking care of patients, to saving lives, not to taking them. And to sit here and accuse him of something else is just nothing short of absurd. Absent any real evidence. You don't have a shred of evidence to his intent. It's true, you can't get in his head. Why didn't they get those computers? Why didn't they follow the evidence? Why aren't we listening to the independent witnesses? Why aren't we just saying, okay, sometimes the easiest answer is really the real answer, which are these folks were dying. As sad as it is, they were dying. And we have to assume, because his dosing habits are different, that he's a murderer? Is that where we get? Is that where we've gotten to? Is that where we're at? Where he's a murderer because of this fact? I submit to you, no. It takes a lot more than that. Now, I'm not going to have the ability to get up here and speak to you again. And this is my final opportunity to speak with you. And I want to wrap up by telling you something. The prosecution, they will have the opportunity to get up there and say, and argue their case again. And it's not because we flipped the coin. You all know I would rather have the last word. But the reality is they have that burden. And he can get up here and say whatever he likes, just like he did the first time. When he told you, William Husel on Sandra Castle walked into the room and said, "You want me to take care of that noise for you?" Well, you know that's not true. Stephanie Lachard told you that she was, you could hear her on the other side of the ICU, and she went to Dr. Husel and asked him something for the death rattle. And what was the first thing he did? He gave her a medication for that death rattle first. And waited to see if it would go away. And if it made her more comfortable. It wasn't until Stephanie Lachard went to Dr. Husel again the second time before they discussed the fentanyl. And how this family knew what the potential side effects were and all of the relevant facts that were needed, and they made the decision. You just saw the video. He left it up to the family. And he told them, gave them the informed decision. They made that difficult decision. They made it on their own. But in this trial, the prosecutor can get up here and say, "You want me to do something about that noise? That rattle? I can take care of that." Zoom, shoot up with fentanyl. And I'm sure I'm going to have plenty to say, but please remember that the burden lies with him. The burden lies with the state. Regardless of what he says, you can't create evidence where none exists. You can't make this up. Every person, their death was hastened when they chose to take their family members off life support. And it's just unfortunately a fact of life that death comes. Death will come to us all. So as you're sitting there and deliberating this case, I want to conclude with reasonable doubt. Reasonable doubt, as I mentioned, is a unique concept because the one thing that makes it so important is it's irrevocable. You can't take it back. You can't come back the day after this verdict and say, "You know what? I thought about it."
Hold on. Where are we going with this?
That it's an important decision.
It's an important decision, but it's not. Well, let's move on to the important decision part.
It's a decision that you must make the same like you would in your most important affairs. And it's based on evidence, not theories, not possibilities, not potential side effects, not any of those things. And the people who were there at bedside all told you the truth. They all came forward and gave you the rest of the story of what they could. And not a single one spoke badly about this man. They knew him. They went to work with him every single day for 5 years. Despite this theory that he killed people multiple times, you didn't hear anything from fentanyl. the drug company? Why don't you get a witness from a manufacturer of fentanyl that will tell you, you know what, we did studies, and this is what we found, and this is the science behind this medicine? You didn't even get the insert to fentanyl. You got some lexicon description of it, but none of the other things. You didn't hear about any spike in deaths at the ICU that are different before and after Dr. Husel. There's no evidence here to suggest anything other than these were terminal extubations. When you go back and you're deliberating on this case, please remember it's your decision. You should listen to all your other jurors, but it's your decision. State by your convictions. And if you feel a certain conviction of not guilty, if these are your beliefs, they're your beliefs, and no one has the right to take them away from you. No one. As it relates to reasonable doubt in this case, through all of the evidence that you've seen, I like to compare it to walking through the desert. You're walking. And you're walking. Beverly Leonard, you come across Beverly Leonard and you say, which way to the water? Beverly Leonard tells you, well, I know I messed with the fill bottle. I know there's a dispute, but the water's that way. And then you go that way. And you have Talon Shore standing there. Talon Shore says, I was shocked. I know I told you I was shocked by the evidence, by the dose amounts, even though I had other doses that I approved. And even though Jake Deemer says something completely different than what I'm saying, trust me. And he points you in that direction. You keep walking. And you keep walking. And you keep walking. And you keep walking. And then you realize, oh my God, I've made a huge mistake. The evidence is there. The records are there in the middle of the desert, and they don't send you in the right direction. And you could have made a huge mistake. In light of that, ladies and gentlemen, there's nothing you can do at that point. Do not allow this misguided case to misguide you. If you saw evidence of William Husel intending on killing people, then I will sit down. If you see anything in here that there was respiratory depression or they suffered a side effect, then I will sit down in an agreement. But none of these things were proven to you. This, in fact, as complicated a case as it is, it's a very simple one. We have a certain standard in a criminal courtroom that is much different and much higher and cannot be tried in another way because the consequences are far greater. I thank each and every one of you individually and collectively for all of the work you did in this case and the sacrifices you have made. William Husel thanks you as well. And I know you'll make the just decision. This is not a murder case, never was, never will be, and it's not an attempted murder case in a last-ditch effort to just try to get some type of charge stick. It doesn't matter how much you throw against the wall and hope that you'll compromise. You didn't come here to compromise. You didn't put your life on hold to compromise. And I ask that you do that. You do the absolute opposite of that. Stand by your beliefs. Thank you so much.
Thank you. Ladies and gentlemen, let's take 15 minutes. I imagine you use a break. Okay, it's been an hour and a half. With that, we'll come back and hear the rebuttal. It may carry a little past 5. Is that going to be a problem? No? Okay, David, call them up and send them out. Have a good break, guys. Everybody can be seated. Mr. Biles, anything for the record?
Not from the defense, sir.
Mr. Zion? Okay. Be in recess 15. items first thing, because we're going to have to play these are. Okay. Second thing, I just saw an email from Tamria. Position.
Sure.
359, she sent it out. Yeah, you're kidding me. You see it?
That's yours.
Okay. Cool. Thanks. A little shocking. Yes. So, okay, thanks.
Yeah.
Double check, and if there's something I need to worry about, let me know. I know there's nothing I need to worry about, but. Okay, cool. Cool. Bye.
Pictures, videos, how do you prefer to do that? Same question to you.
Well, the magnet stuff and stuff will be gathered up by her, it won't be sent back. And she'll have it for Court of Appeals records.
Or do you just want to put it on some, like your whole
Well, if everybody agrees to that, great, that'd be the thing to do, so they can see it. If the other side will agree with that, fine.
I mean, I think that's the most.
It is. Yeah, but you're substituting something for the original. That's what makes me nervous. I like that, but I agree. About that time, David?
I'm trying to remember, I think so.
It was like 8 after.
Okay. Let me run.
Okay?
USB drive or like the actual physical originals.
Can we talk about this later? I mean, really? Yeah, no, but we're trying to organize it. So, I mean, talking about the exhibits right now is not, helpful for us. We have just a few minutes to work on this, and we'd appreciate.
I mean, we're going to do the charge tomorrow morning anyway.
That's fine.
Because that means if we do it now, they'll be here till 8 o'clock tonight.
Yeah, no issue. We wouldn't have issues with guitar breaks or anything like that.
Ladies and gentlemen, hope you had a wonderful break. Mr. Zion, are you ready for rebuttal to refresh your memory, ladies and gentlemen? The state has the burden of proof in this case, and he has the right to what they call rebuttal. So with that, Mr. Zion.
Judge, co-counsel, defense counsel, ladies and gentlemen, let's start where he started. Start with constitutional rights, equal protection. Absolutely. The judge in his instruction will talk about equal rights clause of the 14th Amendment of the U.S. Constitution. But insofar as the defense counsel brought this up, I will echo that. Everyone gets treated equally under the law. That's what they're talking about. And just because you've had the privilege of education, just because you've had the privilege of training at one of the best places in the world, just because you have the privilege of a family that loves and supports you, just because you have the privilege of that title of doctor, doesn't mean you get a pass. In Franklin County, Ohio, for your misdeeds done at night, the title of doctor does not have in parentheses God Almighty in that. You don't get a pass. You do dirt in Franklin County, and he did dirt in Franklin County, we're going to call you on it. Reasonable doubt. Mr. Bias kept saying, it's beyond all. No, the judge will tell you what reasonable doubt is. He'll instruct you. Reasonable doubt is doubt based on reason and common sense. Reasonable doubt is not mere possible doubt, because everything relating to human affairs, or depending on moral evidence, is open to some possible or imaginary doubt. Proof beyond a reasonable doubt is of such a character that an ordinary person would be willing to rely and act upon it in the most important of his or her own affairs. That's the law of reasonable doubt in the state of Ohio, in Franklin County. It's not beyond all doubt. It's not to the exclusion of that right there is what the judge will tell you. It's based on reason and common sense. He put up motive. He put up the definition of motive up there. Well, apparently it was too much to write this next sentence, which is the law in the state of Ohio. They did put up the first part, and the judge will read it to you. Proof of motive is not required. The presence or absence of motive is one of the circumstances bearing upon purpose. Where an act is a crime, a good motive is not a defense. So when he says there's no evidence that this man had malice towards these people, that they had some sort of argument, or that he bore them ill will, I would argue to you that is irrelevant to determining whether the state has proven its case beyond a reasonable doubt that he purposely caused their death here in Franklin County, and he's the one that did it. His motive could have been pure in his mind, because he's legal clinic trained. He's the only doctor there at night. He's the only one on the floor that can make these calls. He's the only one with prescriptive authority for that whole shift in the ICU. He's the one all these young nurses are coming to and listening to. He's the one that's teaching them. His motive could have been pure, but if it's a crime, and ladies and gentlemen, it's a crime to kill a dying person, it's not a defense. Mr. Baez seems to like the records when they support what he's saying, but these records, they don't tell the whole story. Well, those are the medical records we have from the hospital. They've been stipulated as fair and accurate. Those are the complete medical records. So when there is a suggestion that the state of Ohio was misleading you in any way by talking about portions of those medical records, the whole thing, stipulated by the defense, is right here in front of you. And that's not the only thing we have. Remember, the judge will tell you evidence is the exhibits in the evidence, it's the stipulations, and it's the testimony of the people that had things to talk about in this case. And that included the nurses, the pharmacist, and the family members that were there. Mr. Baez makes the point that we, the state of Ohio, argued that teaching and helping is a bad thing. Well, when you're teaching bad things to your nurses,
it's a bad thing. Made a point over and over again that no one can say, the experts wouldn't say how long anyone would have lived but for the fentanyl and midazolam. That's true. Remember Dr. Ely said, well, yeah, no one knows how long they're going to live. I can't say how long anybody in the world is going to live. I mean, on a long enough timeline, folks, we're all going to die, right? That was Dr. Ely's point when he said, Dr. Schreider's point, no, I can't tell you when a person's going to die, right? I can tell you these drugs either directly caused their death at that time or hastened it so that it happened sooner than it would have otherwise. But no, otherwise, who knows how long someone would live? And that's not just true in these particular situations. Dr. Ely made it clear when he said that over and over again. Yeah, in general. Because unlike some, he knows he's not God and he's not playing God. Zivit, Dr. Zivit's opinion. You'll have that. Defendant's Exhibit, Exhibit 1. It's about 5 pages long. Read it. See how detailed it is. Remember his testimony. There is no maximal dose of fentanyl. That's partially true. What was actually said by the state's witnesses is there is no prescribed maximal dose of fentanyl. Prescribed means prohibited dose that you can give. Not because fentanyl is like vitamin C, where if you take too much of it, if you just pee out the rest, that you can just take however big bottle you want of it, and, well, if your body doesn't use it, it just goes away. No, there is no prescribed maximal dose of fentanyl. Because, as the experts explained to you, with patients in hospice care, and these weren't hospice patients, in patients in hospital care, you heard reference to TY, people that were at the end of a very long illness. You can give, or people with very high, because they're at the end of that. You want doctors in those situations to give them as much as they need, because nobody is about, not the state of Ohio, not even the people that testify for the state, nobody is about making people suffer. This notion that Dr. Ely and Schweiger had some sort of demented philosophy of suffering and redemption and death. No, they didn't testify about that. Nobody does. And the medical community does. There's no prescribed, because in those situations, not these, you want doctors to be able to give 2, 3, 4, whatever they need to give to control the pain. So you don't want to give a prescription saying, oh, never give above this. That doesn't mean that for every individual out there in the world, me, the judge, anybody in this room, there is not a dose of fentanyl that will drop you and kill you in a moment. Fentanyl is a dangerous drug with the known effect. Not a possible, not like a 1 in a million chance, the known effect of suppressing the person's ability to breathe. And while as a healthy person, you can take in more because your kidneys and your liver is working, sick people can't process as much. So the maximum amount they can get before they die is much lower than a healthy person. There's no prescribed maximum dose. There is a maximal dose, Dr. Ely told you that any individual can get in this world, and they will die. I don't believe there is any evidence that Tampa General is a Catholic hospital, and I don't believe there is any evidence that Vanderbilt is a Catholic hospital. There was evidence that Dr. Ely is Catholic, and Mr. Vice, well, what does that have to do? Why was that brought in? Well, that wasn't brought in by the state of Ohio, ladies and gentlemen. If you recall, that was brought in by Ms. Menashe during cross-examination. It made a big point of that somehow his faith made him less credible or was somehow subject to cross-examination and affected what he was saying medically, his practices are, or or what the appropriate practices are. That was not the state of Ohio talking about Dr. Ely's faith. That was the defense talking about it, and I would argue to you in a very derogatory way. And whatever statements Dr. Ely did say about his faith, it enhanced, I would argue to you, how he took care of his patients. Because for him, for Dr. Ely, these weren't just the people he cares for. They're just not people taking up room in his ICU. They're people that matter. They're people that if their dying wish is to get baptized, and remember he said, I thought they just meant, yeah, we can do that. We'll get some holy water, because that's what Catholics do, right? We'll just do a little. You want the full dunk. So my staff went out and did that. They went to Costco. Because these aren't emergency things that the nurse has to go grab the fentanyl and override right at night. We got to get this done. You don't call people over and over again. DNR. That's not how you do it. This man's dying. We know it. What wrote it on the board? It was written on the board. They went to Costco. They got the tub. That was his staff that did that, not Dr. Ely. And he thought, I want to talk about this. That's why he wrote that article. Because with Dr. Ely and Dr. Schweiger, I would argue to you, you saw how it's supposed to be done. That just because you're sick and you're old, or maybe a drug addict, you still matter, and your death still matters. And it's not something to get over with in 15 to 20 minutes, so everyone can move on. Talks quite a bit about Sandra Castle, Nurse Lachard. Well, Nurse Lachard, her 6th shift as an ICU nurse, recent graduate of Johns Hopkins. She did question it twice. She talked to the one nurse and then she talked to the other nurse. Oh yeah, the nurses that have been trained by Dr. Husel, this echo chamber they've got going on down there. It's what he does, it's okay. She's not questioning that dose because it's something she's ever seen before. She's questioning because no one does this. She's brand new. And she's questioning the doctor of the year, the Cleveland Clinic guy, to these other nurses. Is this right? I would argue to you that there was no testimony that agonal breathing, the word agonal refers to the term agony. That agonal breathing, however, was testified has a deep brainstem reflex. That is not painful. So, the state misled you. The state told you Ryan Hayes was brain dead. No, the state did not tell you Ryan Hayes was brain dead. Never said that. You'll have State's Exhibit 2. What the state did tell you, though, and what you heard from Dr. Ralston from his note was, when they're talking about it, it's right there. You'll have a chance to review this. About waiting 24 hours and reassessing as he may likely progress into brain death, given the CT scan showing diffuse cerebral edema. They thought that this was the best option of all, and at this point we'll do that. I did discuss with him that he is not experiencing any pain. I did discuss with him that we may never know what causes cardiac arrest. I did discuss with him that due to the diffuse brain injury, he is not experiencing any pain or discomfort as well. And he told you, Ryan Hayes, the part that made Ryan Hayes, the top part of his brain, is gone. But he's not breathing because he's still over-breathing the ventilator. But he is not medically suffering any pain or any anxiety. And even their own expert said, and it says it in his report, the only legitimate thing to give a patient fentanyl for is pain relief. So what's the purpose of giving Ryan Hayes? Not the usual dose. Not twice, not 3 times the usual dose. 1,000 micrograms of fentanyl, 10 milligrams of hydromorphine, 10 milligrams of dest, and 23 minutes later, doing it again. What other purpose can you have in that situation with a man that clinically cannot feel pain or experience anxiety? What's your purpose there? Your motive may be, this guy's gone. He's a breathing corpse. Come on, let's get it over with. He's in my ICU. He's taken up a bed. He's not an ICU patient at this point because we're not trying to keep him alive or anything else. Let's get it done. What other purpose do you have? But you don't get a pass for killing a dying man, even if you are Doctor of the Year. He said, oh, the state's theory about this brain death, it's all made up. Well, the witnesses that were there, the family members, who I would argue to you have very distinct memories of what was said to them. These were big moments in their lives. The nurses, almost to a person, had to testify. I didn't remember this at the time. I had to go back and review, or I had a slight memory of this case, because this is what they do with Dr. Husel in the nighttime ICU, year in and year out. This is just another Tuesday night. But for someone that's watching their wife die, or their father die, ladies and gentlemen, I would argue to you their memories are very accurate. That those words, those visions, the things in their minds, the smells, is all right there, burned in. And they're the ones that said, we were told either brain damaged, and in many cases, brain dead. And, oh, none of the nurses say that. Well, Jordan Blair said it. Recall Jordan Blair's testimony. Yeah, I did hear him say brain dead in the context of the speech he would give sometimes. Jordan Blair heard them say that. And they don't want that in there because brain dead, as you heard, is a very specific medical diagnosis. It's a very specific thing you have to declare after many tests. And none of those tests were done in this case. But that's what these families were told. Either brain damaged, brain dead, you can let them live out the rest of their existence on a machine, or we can let them go peacefully. What a choice of that. Who would not say, oh, let them live out on the machine forever? Who's not going to say, well then, yeah, doctor, let's do that, of course. Every nurse told you, everyone knew. Ladies and gentlemen, rely on your own collective memory. But these nurses don't work on other shifts in general. They didn't have contact with daytime doctors and nurses. So when they say everybody in the hospital knew about this, ladies and gentlemen, I would say rely on your own collective memory. That, I would argue to you, was not the testimony of these nurses. Wants to argue that we did not meet the burden by pulling all of the pharmacists that actually administered those. Now, we pulled 4 pharmacists, 2 of the ones that were involved in many of them, the ones that finally realized what was going on in the ICU, and were so shocked by the amount of drugs being used in the ICU, because a unit dose is 100 micrograms. So shocked when they found out this is actually for a palliative extubation, they set it up a lot. Not to Dr. Husel, because when you call Dr. Husel, as Galen had before, and said, is this extra zero? When he had called him before, that's for a procedure. It's okay. Where was the teacher there? Where was the teacher explaining everything to Galen Schroeder? Now, he knew what he was doing. Pharmacy says I can't use this, I do what I want. So Galen's okay. Well, when he finally had confirmation from Jake Deemer, and remember, Greg Dreschbach, you see the same characters over and over. And how many clips did the defense play of Jake Deemer to support their case? Jake Deemer. So, ladies and gentlemen, you heard about the procedures, about what happened with Talon and Greg. You heard how for Randy Miles and Sean McConnell, how these procedures had been put in place years before, about how they disagreed, how at least Miles disagreed with that, or excuse me, Sean O'Connell disagreed with that. But that's what it was. They can take things on override. Pharmacy should not be held liable for that. You should just be allowed to clear them out. Well, the pharmacists were held liable for that, for those overrides. They didn't know it. They didn't know what was going on. And Taylor Schroyer, this whole thing of him saying it was either diversion or wildly excessive was not a recent fabrication said on the stand 7 weeks ago. That is what he told the pharmacy investigator 2 years ago. What was his testimony, Judge?
Yeah, what was his testimony? I heard objection, but I didn't hear why.
Based on the court's ruling?
I'm sorry.
Based on the court's ruling, sorry.
Okay. What time period was it?
I don't know, Judge. He testified and talked to the pharmacy board. That's what he said.
Okay, let's move on it.
So not a recent fabrication. He said, remember, he's going to ask you, the diversion call. Yeah, they thought it was diversion because you're not really, no one really puts 1,000 micrograms into a human being and calls it medicine. I mean, they got to be sealed, right? Because if this is really palliative extubations, wildly excessive. And he's a 2-year pharmacist, folks. That's who broke all of this. A man that had been doing this for about 24 months. Talked quite a bit about Detective Gillette. I think he described it. The investigation as pathetic at best. Well, ladies and gentlemen, I would argue to you that the CPD investigation of this was thorough and responsive, and they weren't about to let Mount Carmel or anyone else dictate to them how they were going to conduct, potentially, a murder investigation. They are told about the allegations from the hospital because it's got to come from the hospital, folks. This is not something that was, family members, disgruntled family members calling up the police and making calls and saying, no, I think this is what happened, I saw them do this. This is the hospital coming to the police. People like Dr. Swanner and Dr. Roth coming to the police about their own doctors, saying, not the state going out and trying to find this case, not anybody from the state's attorney, we call them county prosecutors in Ohio, nobody from the county prosecutor's office trying to go dig up a good juicy case. This is the hospital coming to us and saying, we've got a problem. We need it investigated. And those detectives were not going to say, well, when you get a chance, let's round everybody up. They said, right now, I want to talk to people, right now. And so these nurses and pharmacists and others that were involved in this are being pulled off their shifts, are being called up at home and told, you're coming to work right now. I mean, some of them were actually still working on their job. You have to go talk to HR. And yeah, they are talked to ahead of time by HR and a defense attorney who says, okay, I know you said you were told about HR here. These are your rights because in the next room, you're about to talk to the murder police. Right? Not the diversion police, not the theft police. You're about to go talk to the homicide squad. That's why the hospital talked to these people like that. That's why they didn't have the medical records. Because we're not waiting for you to tell us. We want now, right now, today. And yeah, they're struggling through this. This is a medical case. Detective Gillette is not a medical doctor. None of the people on his team have medical training or experience. They're relying on what's been reported to them, and they want to get it down now, as soon as we can. So they don't even have the medical records in front of them. That took some time to get those medical records to them. And so, yeah, they're fumbling around with them about dates and doses and things like that. That doesn't mean they're not doing a good and thorough job, because that's what the police do. They start investigating right away. They don't say, okay, Dr. Roth, you just tell us what to do and line them up and we'll talk to them when you say so. Nope. They did that on their own terms. And all those questions that Detective Gillette didn't know the answer to when he testified all those weeks ago, it's because... And he's not the one, ladies and gentlemen, that charged Dr. Husel. He's not the one that made that call, ladies and gentlemen. Like he said over and over, I'm not a medical doctor, I'm a cop. ladies and gentlemen, we're not medical doctors over here. We didn't make that call. I'm just a dumb government lawyer. We found expert witnesses that didn't know Dr. Husel, that didn't go to the same school, who didn't share the same mentor. We found experts from around the country who do this and have done this and who are recognized in their fields for their excellence and their experience, and said, take a look. And they didn't do it for free because that's what they do. That's, their time is valuable because they are so experienced and so well regarded. Do tell us. Did he purposely cause their deaths? They don't get a bonus if they say yes. Just tell us, is this murder? And they both came in here and unequivocally told you it was. One of their colleagues, another doctor, he caused their death. He hastened their death. There's no medical justification for what he did in these cases. The hospital did talk to the victim's family before the police, but only after the hospital asked the police, can we do this? Because this is about to get out in the media, and we don't want husbands and wives and children to find this out on the evening news. We want to try to do the right thing here and call them first and give them a heads up. Let them know what's going on. Throw themselves on their sword and start calling people and told them this. And that's the reason the hospital even talked to them beforehand. They asked the police, though. And after getting consent from the police, they did so. I would argue to you, ladies and gentlemen, this was a thorough investigation. You saw the size of the packet. Over 75 separate witness interviews. Over 10,000 medical records obtained through subpoenas with the police. They did a thorough job. And so, but let's start talking about acidosis, Detective Gillette. I have no idea what that is. Right? Who would? Wes Black, you saw a clip from him. I've given enough to put down an elephant. That's not him saying that. That's him kind of remembering. That sounds like something he might have said in the past from a nurse practitioner. Is that really evidence in this case that you can rely on in the most important of your own affairs? Does that really take anything away from what Dr. Ely told you and Dr. Schweiger told you? Or what Dr. Moody told you? They're not experts. The ICU doctors are not experts, but they have expertise, and their practices are relevant. Mr. Bias said, oh, geez, if the police, after Wes told him that, had just gone out and found this nurse practitioner, kind of remembers, he even said, I have a fuzzy memory of it. If they had just gone out and found her, wouldn't that have been nice to know? Well, ladies and gentlemen, if there was a nurse practitioner in the world, if there was a doctor in the world, if there was anyone with any medical background or pharmacological background that would have said these things, said what he did was okay, they would have been here.
Objection. Burden shift. Move to strike.
Okay. As the comment, this is not evidence, ladies and gentlemen. It's the state's burden to prove guilt beyond a reasonable doubt. Okay, you're not taking it for anything else. This is commentary.
It is argument that, ladies and gentlemen, that witness didn't exist. Not trying to shift the burden to anybody. The burden's on the state of Ohio. We brought the charges. I've said over and over again, and I mean it now, I mean it at the beginning of this process, hold me to my burden. But when you say, play a clip of a nurse that has some fuzzy memory of somebody saying something that might be helpful, well, geez, that would have broken the case. Another nurse, I heard that actually high doses of fentanyl can prolong life. Do you have any evidence of that besides that statement? Where is that nurse getting his information from? Who's teaching him?
Okay. Ladies and gentlemen, as I explained, the burden's on him. This is commentary, argument.
So when that nurse said those things, once again, we're not shifting the burden to anybody here. When that nurse said those things, did you hear any of our experts actually say that? You heard them say exactly the opposite of what that nurse thought he had heard. I heard there was a study out there. Well, Dr. Uli and Dr. Schweiger said, there's no literature that supports this at all. It does not exist. Who is that nurse being trained by? Who is that nurse being told by? Because they're all like, whoa, what? How much? Oh no, it's what we do. Oh, they're getting stuff jammed in there, all their little parts, and they got this lactic acidosis, and they're in terrible pain. I mean, even though they haven't had any pain medication, even though all the pain scores are 0, they're in terrible pain. Who's training that? Who's teaching them that? Mr. Baez makes a big point that the computers were not confiscated. I guess he's suggesting that the computers in the ICU are like a personal laptop, that maybe the hard drives will have some good information that otherwise is not contained in the medical records. I would argue to you, ladies and gentlemen, that it's the common experience of mankind that these computers are hooked up to servers, and that the computers in the ICU are just terminals and outlets that within themselves have no evidentiary value. At any rate, you have the stipulated complete medical records and evidence as to what occurred with these patients. Katie Barga, not a doctor, had training in her prior career as a nurse, not a nurse at Mount Carmel though. She is a patient safety officer. And I would argue to you, the patient safety officer is a euphemism for if someone gets hurt at the hospital, what's the hospital's liability? What happened here? Let's grade it. How much are we looking at here? I would argue to you, her job is to limit the hospital's liability when looking at situations. I would argue to you that if someone was biased, it was her, and that it was her job when Randy Miles forwarded Talon Schroyer's voice complaint to send this up, and it didn't happen in October. And because of her lack of action in October, 2 more patients were murdered in her watch. So yeah, she kept it at 4. You did not see that report. It is not in evidence. There is no literature that supports what Dr. Husel did. She kept it at a 4. So, once again, I'm not shifting anyone's burden here at all. I am commenting on the defense's closing argument. When they say, why didn't they ask Dr. Zivit the $1 million question? Right? Well, ladies and gentlemen, why didn't they ask their witness the $1 million question? Think about that.
It's not shifting on that one.
Why didn't they ask him that $1 million question? They have the ability to speak to people.
Objection, Judge.
They could have. Okay.
Overruled.
Ask yourselves that. I would argue that question was not asked because they wouldn't like the answer to it. When you do something wrong, you try to hide it. Mr. Baez said that. And yes, acknowledge. That's one of those head scratchers in this case. But if you think you're doing something for a good reason, you don't hide it. He thinks he's doing good by euthanizing his patients. He thinks he's doing all right. Now, he's not putting down big notes. He's not justifying these pain medications in any of these medical records. If there is a note from Dr. Husel at all in any of these, and look for them, they'll be in the progresses. Look for them. You'll see them occasionally. A note from Dr. Husel. And it usually is, order DNRCC obtained, palliative extubation done, patient died, act. So he's not really explaining anything in those notes. Remember, Dr. Ely even looked at that. Wow, I just saw that. Yeah, I've never seen that. NRCC, extubation, and a death all in once. I've never seen that. 30 years he's been doing this. I've never seen that all in one thing, because that's not how it's done anywhere else in the world. The toxicologist that testified from the coroner's lab. The coroners did not testify because, ladies and gentlemen, I would argue to you, because they didn't test the postmortem blood. They tested the antemortem blood to see what they came into the hospital with. And all the postmortem blood would have told them is confirmed what the nurses and the medical records told you he did to them. So the toxicologist testified. We know what they came in with. We don't know what they went out with. The defense says, well, they got another Catholic at their other Catholic hospital, Dr. Schweiger. I don't believe there was testimony that Dr. Schweiger was actually Catholic. He was German. I remember him saying that. His mom called him Hansi. But Dr. Schweiger did not testify that they could all get up and walk out of the hospital. Now, what he told you is the real reason we have ICUs. And that is to give the body time to recover, if it's going to recover. To chill everything out. Calm everything down. Make sure you have the secured airway, that their heart's beating, that they got that oxygen coming in and out of them. You even paralyze them to do this. You sedate them. Just let the body relax. And then declare itself. And that takes time. That takes days. 48 to 72 hours is how long that takes. That's why you send patients to the ICU. Give their bodies a chance. He said the discussion of DNR in many of these cases was appropriate. What's not appropriate is time. Let's go. Let's go. It's the middle of the night. Let's go. 2 in the morning, call the family. They're done. That's what's not appropriate. We have not given these patients, all of them, time to declare themselves. Made a big point about the vasopressors. Oh, they're going to die in a few minutes. Anytime you see vasopressor, they're dead in 30 seconds, minute, 2 minutes. Well, if that were true, what about the patients on vasopressors that live for 20 minutes or so? If that were really true, and Dr. Ely and Dr. Schweiger told you that was not true, that why give them any pain medication at all? If you're going to take them off the vasopressors and pull the tube out, and they're just going to be done. What's the point at all? Because remember, even their own expert says the only reason you should give anybody pain medication is for pain. And if you're gone like that, remember, fentanyl takes 2 to 5 minutes to even get in the system, to peak. Why are you even giving them that? I would argue to you because that's not true. Sandra Castle was not having a bad death. Her granddaughter told you, the whole family's there. If she were having a bad death, they'd be out there screaming to those ICU doctors. And they're not. She is getting morphine throughout the evening, appropriate doses. And her death rattle got loud. And what's important about the granddaughter's testimony is Dr. Husel came to her. You can quiet that down. The defense made a big point about this big decision that they had to make at that point. This big decision. What big decision is there in saying, yeah, give them enough pain medication so she's not suffering? There's no big decision there. That's a no-brainer. That is what we want you to do. Why would that be a big decision to say, yeah, if she's in pain, if she's in discomfort, give her enough pain medication so she's not? Why is that a decision at all? That is just what we want you to do right now. The big decision had been made hours before when Dr. Mahoney and the other doctor at Now I'm just waiting. And not 10 or 15 or 20 or 30 minutes, or 8 hours, because that's how long death takes. It happens now. And it's happening. Now, they want a big decision for, because it's a big decision for Dr. Husel because boom, give her 1,000 mics out of nowhere. That is not indicated anywhere in there. And he put her down like a sick animal. Troy Allison, I would argue to you, ladies and gentlemen, was not on 750 milligrams of anything prior to his admission. The medical records do reflect, and you'll see him in there, that he did have a prescription for 20 milligrams 3 times a day for 7 days of morphine, extended release. Not the equivalent of what he was given during his extubation. He was only in that hospital for 1 day. Danny Millette was only in the hospital for 1 day. The nurses, he said, oh, they're the most important people in the world, and if they were really doing something wrong, wouldn't they be angry at him? I would argue to you they are unwitting complicitors in this, that there is some collective guilt, morally at least, for what they participated in. They were duped by this man and cannot fully recognize what they were doing and don't want to admit fully what they did. They did come in and say, this isn't about diversion, nobody's stealing this, no one's pocketing, he's really giving appropriate doses and we're pocketing the rest and selling it or using it. We did put these drugs into these people at his orders, but he was so smart and he told us why we were doing this. And the other nurses told me it was okay. I would argue to you their testimony is reflective of their complicity, unwittingly. Remember, to be a complicitor, we talked about that in voir dire, you have to have the same intent. And if you don't have that as the principal offender, it's not a crime. But there's still, I would argue to you, complicity by the nurses in this case. Kathleen McDowell did not lie. She did not lie to the police. She did not lie to you. Defense said that. I'm not sure exactly where that was in the testimony. Remember, the police are not waiting for the hospital to tell them when they can talk to witnesses. They're going and talking to them without medical records and asking them about things that happened months and sometimes years before. And she did not recall this incident. And then when she thought about it, and she thought about it hard because she had just had a conversation with homicide, this woman who, a nurse who just never talked to the police in her life before, has just had a conversation. She thought really hard about it. And she called an attorney and she said, yeah, I think I know what they're talking about. That does not reflect a lie. That does not reflect deception, ladies and gentlemen. That reflects a person coming to grips with her complicity in this matter. She says, I'll tell you what's going on in there. And she told you about the toxic masculinity. She told you about the weird relationships that were going on in there. The fact that fentanyl can kill you, the fact that fentanyl causes, not potentially, the fact that fentanyl causes respiratory depression is not an invention of a bunch of dumb government lawyers over here. Not an invention of Detective Gillette with his background in marketing. That is a medical fact testified to by experts that have decades of experience in this field. That is documented in the literature you will receive. Not potential, not 1 in a million, fentanyl causes respiratory depression. Where do you see all of them suffered through respiratory depression? Respiratory depression means they stop breathing. They all stop breathing. Every single one of them, all 14 of them, they all died. That's your evidence of respiratory depression. He says, well, they gave the medication and then they checked them out and made sure they were okay and they're on the ventilator. It's really not getting them off of it. Was that the testimony of any of those nurses? They couldn't even remember if they gave it to them before or after, but it is in conjunction with withdrawal. It's either immediately prior or immediately after the withdrawal from the ventilator that they're getting these medications all at once, in boluses, in those giant turkey baster things that they had to actually go in the other rooms for. Remember, Lachard was instructed, you have to go down there, pull it all out. A nurse seems out helping with it. You think he's helping her with it because he's not busy? Or because, yeah, you've got to get them all in your hands here, and then you've got to take them to another room. And it's a process. And you've got to get them all into that, because you've got to get them to them all at once. If this was medicine, ladies and gentlemen, I would argue to you the ICU would stock medicine in that size. They wouldn't have nurses going and raiding all the Pyxis machines, having to go into other rooms, fill up big, giant syringes outside the view of the family, and walk in and give this medicine. Once again, synergistic effect between benzodiazepines and narcotic pain medication is not an invention of Detective Gillette or the state of Ohio. They didn't even know what synergistic meant before this case. Not an invention, it's a medical fact, demonstrated through studies that you heard testimony about. How does not putting on the powers of attorney wrong and not justice? How is that at all even relevant? That the person who had the actual legal authority to make the call was not put on the stand in all of these cases. I would argue to you there are reasons why an elderly spouse would not be brought in to testify. There are reasons why some family members, because of geography or whatever, did not testify. But you heard from at least one family member that was present during each one of those. And what relevancy does it have that they weren't the POA? They were there. They saw what happened. They saw what he did. They were witnesses to this crime, and they told you what he did. Brain dead theory. Once again, not a theory, not an invention by the state of Ohio or the police. And none of them were brain dead, folks. Not one of them. Not one of them were brain dead. We're not saying they are. But the family members were told they were. And their choices were let them live forever on a ventilator until they die on a machine, or let them pass naturally and peacefully. Now, Melissa Penix's daughter testified, and you saw that clip of her picking at that bottle. You have pictures, 14C and 14D, of those bottles before she was given that bottle. And for them to suggest, ladies and gentlemen, that she was somehow tampering with evidence in front of you, in front of 5 prosecutors, in front of an entire defense team, in front of the judge, in front of the gallery, on Google TV, whatever that is, for the whole world to see that she was somehow doing something intentionally by absent-mindedly picking at that bottle, somehow tampering with evidence, somehow changing evidence, I would say, ladies and gentlemen, is just desperation. Because the truth is, her mom was on 15 milligrams tablets twice a day as needed, as prescribed by her primary care physician. She testified to it. You see pictures of it here. And Ms. Menashe cross-examined her with those actual medical records. That's the truth of what happened here. If you can't trust the messenger, you can't trust the message. Who's telling you the truth on that issue? No one knows if it's painful to die or if it's anxiety-inducing. Yeah, they do. Not everyone dies in a coma. Not everyone dies like this, folks. These people were like unconscious in comas when he gave these things to them. Not everyone dies like this. People die awake. So yeah, people do know what it's like to die because they can tell it to other people. They can hold their hands. They can tell them what they need to tell them. Not everyone dies like this, floating away on a cloud of fentanyl and benzodiazepines. Double effect is included in the order set from Mount Carmel, has a caution. Remember double effect, remember proportionality. Start low and go slow. That's why double effect is included in the order set. Dr. Hagris doesn't know about how meds, he's never questioned about them. He puts in the order set, boom, 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 and never has any problems. He follows the policy. Are we to assume because his dosing habits are different, he is a murderer? Yes. Because you can't overdose people during palliative extubations. And he's not aggressive. He's not, give him twice as much. I give twice as much as what they are, which would be 200 micrograms. That's the upper dose, remember. I give 3 times as much. He starts them off 5, 6, 7, 8, 9, 10 times as much. In some cases, 20 times as much. Of the maximum of what that order set calls for, a maximum of what anyone else in the world is doing. Are we to assume? Yes, that's one of those circumstances. You are to assume that, I would argue to you. Reasonable doubt is a doubt based on reason and common sense. Reason and common sense. That's why you're here. What does your reason and common sense tell you about a doctor that does this in the 19 ICU under these circumstances? Is it reasonable that he's the only one in the world doing this? The only one in the world do?
Okay, ladies and gentlemen, this is argument. You determine what the evidence is in this matter.
Is it reasonable that he's the only one in the world doing this? Does it make common sense that a brand new minted doctor in 2013 doing this all on his own without any consultation, without anyone else knowing about it, is just being aggressive? Ladies and gentlemen, this is about his dosing during palliative extubations of these patients. He could have had the best motive in the world for this. The best. But if his purpose is to hasten or actually cause their deaths, that's murder. And under the law, under the equal protection of the law, no one gets past that in front of you. Even if you are a doctor, even if you do have years and years of education to do that, even if you do have a family. You don't get a pass for what he did. He killed these people. And they matter.
Thank you. Ladies and gentlemen, we're going to do the charge in the morning. It's about an hour and 10 minutes. Plus I have some forms to do. One thing I wanted to talk about, after we do the charge tomorrow, we're going to divide the alternates away from the main jurors. Now, I know you guys have your places back here, but I'm going to put the main jury in the big room, and the alternates will be in the little room. Okay? Just warned you, if you got stuff there or stuff, you might want to get it out of there. Okay? Because once I separate you, you guys won't have any correspondence unless something happens. Okay? Just forewarning you tomorrow. I know you guys have gotten comfortable back there in your spots. Okay? So tomorrow, after we do the charge, then you'll be separated into the 2 rooms based upon the jury. Now, 2 of you have moved up in the jury pool. Okay, and David, who are they?
It's Damien and Sydney.
Okay.
Forgive me, I don't know about last names, but I think I do. I just don't want to say.
Well, I think they all know who Damien is.
Your Honor, I think the camera's rolling.
I'm sorry? Oh, yeah, about the jurors. Turn off. Okay. Sorry about anything more before I excuse the jury for the evening? Okay, ladies and gentlemen, have a wonderful evening. It is particularly important that you don't start discussing the case. You do not have the law yet. Okay? Have a wonderful evening. Remember the admonitions. Be safe. I'll see you guys at 9 in the morning. All rise. He's moving slow today, isn't he? Have a wonderful evening, ladies and gentlemen. You be seated. Mr. Zion, anything for the record?
I'm sorry, sir?
Anything for the record?
No.
I have something for the record, just
Yes,
I really got to run to the restroom.
Okay, go.
See you for 30 seconds. That's the longest 30 seconds I've ever experienced. Huh? Maybe. Yes, sir. Yes,
We're on the record, folks.
Judge, at this time, the defense would move for a mistrial based on improper comments to the jury argued by the prosecutor in what we believe is typical burden shifting in his multiple statements and multiple questionings. First, starting off with the potential witness that the prosecutor commented that we should have called in reference when he said, if there was a witness, you would have heard it, referencing this, the witness that trained Wesley Black, that made the comment, I've given enough to put down an elephant. I think that's a classic scenario where the prosecutor knows that there's a line here. It's one where the defense takes the burden of proof seriously. It is something that is one of the very few things in their toolbox as to constitutional protections, and to suggest that the defense should have called a witness that trained Wes Black is improper argument by the prosecutor. In addition to that, requiring that we present articles to support Nurse Derek Dreyer's statements about about patients living longer on opioids. That too is suggesting that we have a burden to submit such a fact, when in fact it really should be law enforcement following up on leads. In addition to that, why didn't we ask a question of Dr. Zivit? Is an improper statement to make. Just by prefacing it by saying I'm not burden shifting does not reduce the fact that he is in fact burden shifting. We don't have to, we can ask, if an accused wants to put a witness on the stand and ask them 2 questions or 1 question, that is entirely their right, and we do not have to present anything more. In fact, the whole reason he was up there arguing to begin with was because they have the burden, and he gets the privilege of having that last word because of that burden. But to suggest and to throw out there that we failed to ask a witness a specific question is, again, classic burden shifting. And in addition to that, if quadruple downing on the burden shifting wasn't enough,
okay, hold on. I count 3.
Okay, I've got
missing witness.
Sure. The West Black trainers 1. The nurse Dreyer not submitting the article to support Nurse Dreyer's statement. Why didn't we ask the question of Dr. Zivit? That's okay. I think he asked that twice. I'm sorry. He mentioned it twice in his argument. So that would be 4 in my count. And then number 5, absence of anyone in the world making the argument that no one in the world is giving these doses is, 1, assuming facts that are not in evidence, and completely improper. I don't believe that falls under burden shifting. So I can't in good faith argue that, but I think this is not 1, 2, 3, but 4 occasions where the prosecutor saw the line, knew the line was there, crossed it multiple occasions on a very serious constitutional protection that is set up for a reason, and Dr. Husel is entitled to those protections, and we would move at this point for a motion for a mistrial with prejudice based on the prosecutor's comments.
Mr. Zion.
I didn't do any of those things, Judge. I said those words. You can't say, why didn't they ask the question of our witness, and then say somehow I am barred from asking why didn't they ask their own witness of this question. That doesn't shift the burden to anything. It is answering their argument. All of those things he mentioned were specific answers to his argument. And as the court said, and as I said, I'm not saying they had the burden to prove anything here, but if there was somebody out there in the world that could say this, where are they? And when I say there's nobody else in the world, that's based on our expert witnesses saying nobody else anywhere is doing this. That's what that was all based on. These were all directly responsive. You don't somehow get me in a trap by saying oh, well, they didn't ask our witness this question, so therefore they failed on their burden. Well, they have the same ability to ask if they choose to present evidence, and they chose to present the evidence of Dr. Zivit. They have the same ability to ask him questions as we do of our witnesses. And to somehow say that I'm not allowed to comment on their argument that I didn't ask or our side didn't ask in cross-examination an appropriate question, and therefore therefore that we failed on our burden, is appropriate to comment on in rebuttal evidence. It wasn't like I brought that up and said they didn't, it was an answer exactly to what he had argued. So, I mean, this is nonsense, Judge.
Anything else?
No.
Yes, Judge, to call the burden of proof nonsense is...
I didn't call the burden of proof nonsense. These arguments are nonsense,
Excuse me,
Judge.
I was talking. I waited for you to finish. Anyhow, to make the comment, I think a prosecutor who does know where the line is on the burden of proof could say there is nothing in evidence on the record that states what Dr. Zivit's dosing habits are. That would be a proper statement to make. But to comment on us not doing something affirmative in their defense is classic burden shifting. He knows that. This is a prosecutor with much experience, and that still doesn't answer to the other things of us providing a witness who trained West Black on the excessive doses in their training session at Mount Carmel is a very serious accusation to make, or a very serious crossing of the line on burden shifting, as well as expecting us to provide articles to support Derek Dreyer, their witness's testimony, that he in fact advised law enforcement of the fact that there were studies out there that show opioids can extend life. Again, whenever you ask or argue that the defense should have taken an affirmative action on something in defense of themselves, that is shifting the burden. It's very simple, and it's not a complex concept. And prosecutors all across the land know this. And to take that jump is quite fascinating. And of course, to make the statement that no one in the world, like somehow their experts going to know that what everyone in the world is doing in dosing of opioids that's somewhat absurd. So I think we've laid our record. I appreciate the court's time in that regard, and we may supplement it with some case law tomorrow. Should
So you want me to roll on in the morning?
Sure.
Okay. Anything else?
No, I have nothing for this.
And if you want to submit case law, everybody has my email.
All right, Judge, thank you.
Okay?
Thank you.
Anything else?
No.
Nothing from the defense.
Okay. Have a good evening.
Thank you.